The Committee of Finance is hereby called to order. Madam Clerk, can I have a roll call, please?
Senator Marvin A. Blyden. Senator Blyden, present. Senator Samuel Carrion. Senator Carrion, absent. Senator Dwayne M. DeGraff.
Absent.
Senator DeGraff, absent. Senator Donna A. Fred Gregory. Senator Fred Gregory, absent. Senator Javon E. James Sr. Senator James Sr., present. Senator Janelle K. Saru. Senator Saru, absent. Senator Kurt A. Vialet.
Here.
Senator Vialet, present. Mr. Chair, you have 3 present, 4 absent.
Thank you, Madam Clerk. Any correspondence?
Yes, Mr. Chair.
You may proceed.
Correspondence dated July 28, 2022. Honorable Kurt A. Vialet, Chairman, Committee on Finance, 34th Legislature of the Virgin Islands, 3022 Estate Golden Rock, St. Croix, U.S. Virgin Islands. Dear Chairman Vialet, please excuse my absence from today's Committee on Finance budget hearing on July 28, 2022, as I am ill. Consequently, I respectfully request to be excused from today's hearing. Thank you for your consideration and understanding. Sincerely, Samuel Carrion, Senator, 34th Legislature of the Virgin Islands.
Please mark Senator Carrion as excused. Any more correspondence?
Yes, Mr. Chair.
You may proceed.
Correspondence dated July 28, 2022. Honorable Kurt A. Vialet, Committee on Finance, 34th Legislature of the Virgin Islands, Capitol Building, Charlotte Amalie, St. Thomas, Virgin Islands. Dear Chairman Vialet, this letter serves to inform you that due to a personal matter, I will be absent from today's Committee on Finance budget hearing. Please accept this letter on my behalf for an excused absence and forward any relevant information to my office. Thank you, and please accept my best wishes for a productive meeting. Respectfully submitted, Janelle K. Saru.
Please mark Senator Saru as excused. Any more correspondence?
Yes, Mr. Chair.
You may proceed.
Correspondence dated July 28, 2022. Honorable Kurt Vialet, Chairperson, Committee on Finance, Legislature of the Virgin Islands, 3022 Estate Golden Rock, Christiansted, St. Croix, Virgin Islands. Dear Senator Vialet, please accept this letter as a formal notice of my late arrival to today's Committee on Finance meeting, which is scheduled to begin at 9 a.m. in the Fritz E. Lewetz Legislative Conference Room on St. Croix. Please have all circulated documents placed on my desk for immediate review upon my arrival. Thank you for your consideration in this matter. Kindest regards, Donna Fred Gregory, President, 34th Legislature of the Virgin Islands.
Please mark Senator Fred Gregory as tardy. Any more correspondence?
No, Mr. Chair.
Can I have the count?
Mr. Chair, you have 3 present, 1 absent, 2 excused, 1 tardy.
Thank you, Madam Clerk. You may proceed and read the agenda into the record.
The Committee on Finance Fiscal Year 2023 budget hearing for Thursday, July 28, 2022 at 9 a.m. in the Fritz E. Lewetz Legislative Conference Room, Christiansted, St. Croix, U.S. Virgin Islands. The Committee on Finance will receive testimony on the proposed fiscal year 2023 executive budget for the government of the Virgin Islands of the United States. At 9 a.m., the Department of Health invited testifiers, Justa, Encarnacion, Commissioner. At 12:30 p.m., the Virgin Islands Board of Nurse Licensure invited testifiers, Carmen Vanterpool-Romney, Territorial Executive Director. And at 2 p.m., the Department of Licensing and Consumer Affairs invited testifiers, Richard Evangelista, Esquire, Commissioner. Mr. Chair, this concludes the reading of today's agenda.
Thank you, Madam Clerk. Good morning to the people of the Virgin Islands. Good morning, colleagues. Good morning to the testifiers. Before us today, we have the Department of Health, and I'm going to allow the Commissioner to put her name and title on the record, and then those individuals who will be here supporting her testimony. Commissioner, you may proceed.
Good morning, and thank you, Justa, Ortita, Encarnacion, Commissioner of Virgin Islands Department of Health.
Thank you. Next.
Jean-Baptiste, Deputy Commissioner, Human Resources, Labor Relation, Virgin Islands Department of Health.
Thank you.
Good morning, Dr. Nicole Cragwell-Sims, Assistant Commissioner, Department of Health.
Thank you.
Good morning. My name is Tatia Monell Hewitt, Chief Financial Officer for the Department of Health.
Repeat your name. The mic wasn't on at first. Just your name.
Tatia Monell Hewitt.
Thank you. Next.
Good morning, Dr. Esther Ellis, Territorial Epidemiologist for the Department of Health.
Thank you. And we have a number of individuals who will be participating virtually. So I will begin with, I think I see Mr. Malloy.
Good morning. Ruben Malloy, Assistant Commissioner, Virgin Islands Department of Health.
Next, to Mr. Malloy. Doc. Hunt Caesar.
Good morning, Ty Hunt Caesar, Medical Director, Department of Health.
Okay, next.
Good morning, Hadir Charles, Deputy Commissioner, Department of Health.
Thank you, Ms. Attorney Taylor.
Hi, good morning. Attorney Taylor Jones, and Chief Legal Counsel.
Beverly Stevens, Samuel.
Beverly Stevens Samuel, Departmental Budget Control Officer.
Mr. Evelyn.
Good morning. Lyle Evelyn, Deputy Commissioner for EMS Health Department.
Ms. Valmont.
Good morning, Janice Bauman, Deputy Commissioner, Health Promotion and Disease Prevention.
Ms. Johannes Gomez, she's on.
Good morning. My name is Eleanor Johannes Gomez, Director of Federal Grants Management for the Department of Health.
Ms. Ramos.
Good morning, Ms. Ramos from Behavioral Health, Department of Health.
Thank you. Ms. Myers.
Good morning, Charmaine Myers, the Director of the Maternal Child Health Division at the Virgin Islands Department of Health.
Ms. Greenwich Payne.
Good morning, Jacqueline Greenwich Payne, Department of Health.
Mr. Henry.
Good morning, Jason Henry, Director of Communicable Disease.
And Mr. Hodge. It's Marsh Cole.
Should be.
Is Miss Marsh Cole there? Laverne Marsh Cole.
Good morning, Director of the Health Disparities Program, Laverne Marsh Cole.
Thank you. Mr. Hodge, is he there? Okay, I'll go to Ms. Stout.
Good morning, Monife Stout, Territorial Director, Immunization Program, Virgin Islands Department of Health.
Ms. George. Okay, when those two individuals come, I'll let them put their name and title on the record. At this time, we're going to allow the Commissioner to proceed with her testimony. Commissioner, you may proceed.
Thank you, sir. Good day, Honorable Senator Kurt A. Viale, Chair of the Committee on Finance, Senate President and Vice Chair Donna Fred Gregory, committee members and other members of the 34th Legislature of the Virgin Islands of the United States, and of course the listening and viewing audience. I am Justa Encarnacion, Commissioner of Health.
Pull the mic down a little bit so you can, yeah, that's better.
The Virgin Islands Department of Health appreciates the opportunity to appear before the Finance Committee to share our fiscal year accomplishments and challenges, along with the goals and objectives established to satisfy the Governor's recommended fiscal year 2023 budget. I would like to recognize Tatia Monell-Hewitt, our Chief Financial Officer, and Joan Jean-Baptiste, our Deputy Commissioner of Human Resources and Labor Relations, who are here with me today. Also with me is Assistant Commissioner Dr. Nicole Cragwell-Sims and our Territorial Epidemiologist, Dr. Esther Ellis. Virtually, we have our Assistant Commissioner, Ruben Malloy, along with other members of the executive and leadership team. I would also like to thank all the dedicated Department of Health staff who partnered to improve the health and wellness of the Virgin Islands population. You honestly continue to amaze me. Without your dedication and fortitude, we could not have gotten through the past 2 years. Thank you very much for joining together, embracing external agencies, and keeping us safe during the pandemic. The Honorable Governor Albert Bryan Jr., Honorable Lieutenant Governor Tregenza A. Roach, and the members of the Cabinet, thank you for your continued support in positioning the Department of Health to be able to continue improving the services needed in our community. Members of the 34th Legislature, your support during this time has not gone unnoticed. We thank you. Title III, Title 19, and Title 27 of the Virgin Islands Code prescribe that the Virgin Islands Department of Health is responsible for providing public health services to the people of the Virgin Islands, which involves protecting and improving the health of our people and our community through health promotion and preventative initiatives. Preventative initiatives or measures are widely recognized as key components of efforts to improve overall health and reduce health care costs, particularly related to chronic disease. The Department of Health functions as both the state regulatory agency and the territorial public health agency for the USVI. The department has oversight of 26 programs, of all of which are operational. Additionally, as a lead agency for Emergency Services Function 8, or ESF 8, the department also oversees hospitals during a declared emergency or disaster. At present, we are the lead agency during the COVID-19 pandemic, now endemic, while successfully providing essential health services to the public. I would like to thank all of our partners, federal and local, who have collaborated so effectively to respond to the COVID-19 pandemic. Today, we will highlight key overarching accomplishments during fiscal year 21 and 22 to date, and provide an overview of the fiscal year 22-23 agency budget and outline agency goals and objectives for fiscal year 22 and 23. It's guided by our strategic plan and key performance indicators. During fiscal year 21 and 22, we continued our work with the Association of State and Territorial Health Officials, or ASTO. As indicated during our last budget review, our goal was to complete 3 products: a strategic plan, a comprehensive health needs assessment, or a CHA, and our Community Health Improvement Plan, or CHIP, a systematic multi-year process to improve the overall health of a population. The final project, the Community Health Improvement Plan, or CHIP, titled Healthy Virgin Islands 2030, aligned with the National Healthy People 2030, has been completed and can be found at Reports and Plan, USVI Department of Health. Our key stakeholders remain with us through the completion of the CHIP. The hospitals, other governmental agencies, federally qualified health centers, and community-based organizations. I would like to thank all 557 community members who took the time to complete the community survey, thus provided community input to inform the selection of health priorities. You'll also find copies of the 3 documents in the budget package. Special recognition goes to Deputy Commissioner Dr. Jenny Spalman, who led the overall project. We'll start with our breakdown on our financials. The breakdown for our general fund, which is 0100, is as follows. $25,376,558, 31%, or $7,842,643. Other services and charges, $11,658,647, or 46%. Personnel services, $662,646, or 3%. Supplies, $5,212,623, or 20% for fringes. The breakdown of the federal funds, which is 3100, overall, $22,006,401, 0.2%, or 60,000 public utility services, 31.1%, 0.17%, my apologies, personnel services, which is $400,800, sorry. Other services and charges, 11.9%, which is $2,637,079. Supplies, which is 23.83%, $5,243,659. Fringe and benefits, 17.26%, which is $3,797,342. Capital outlay, 1.32%, $291,419. Federal funds, as I said, is total $22,006,401. Health revolving fund, which is 6079, total $3,136,000. Public utility service, 63,000, which is 2.10%. Capital outlay, 62,750, which is 2.09%. Supplies, $1,011. Oh, I'm so sorry. $1,011,381 is 33.71%. And 62% goes to other services and charges, which is $1,863,05. The breakdown of our cost, health, casino fund, and emergency surcharge is $3,740,214 total. Capital outlay with 2% at $77,000. Supplies, 14.0% at $525,200. Public utility services at 35.05%, $1,310,989. Other services and charges is at $1,827,025, which is 48.85%. The health revolving fund, appropriate funding, as I read it, health revolving fund, $3,136. Non-appropriated fund, it is $3,740,214. General fund, $25,376,558. Federal funds, $22,006,401. Revenue cycle management. Despite the operational changes due to the COVID-19 pandemic, our anticipated collection for fiscal year 2022 are projected at $3,032,143, which is higher than the fiscal year 2021 collections of $2,873,106. Revenues as of June 30th, 2022 are $2,587,143. The business process improvement. In 2022, the Department of Health and the community continue to benefit from successful business process improvement with the Association of State and Territorial Health Officials. Areas of improvement are seen in our procurement and payment processes while maintaining our improvements in drawdown and posting. Data from our key performance indicators show that we have reduced our rejection rate to 1% due to our quality and compliance initiatives. Congratulations to our Chief Financial Officer, Tatia Monel Hewitt, who was featured in ASTO's new quality improvement video training series on our work and financial improvement processes. CFO Manel Hewitt would like to thank ASTO for the opportunity to contribute to the quality improvement training for individuals, agencies, and businesses around the world. Stemming from our internal work, the Department of Interior provided funding for ASTO to lead an interagency business process improvement. The interagency team consists of commissioners and directors from the Department of Health, Department of Human Services, Department of Education, Department of Property and Procurement, and actually led by the Office of Management and Budget, Department of Finance, Department of Justice, and the Division of Personnel. The focus is federal grant planning and set up to increase the processes' speed and quality. The quicker the budget is online, the quicker the community benefits from the federal grants awarded. We prove to be better stewards of our funds. That is our goal. Improve the quality and consistency of our work and increase the collaboration and communication internally and externally. The government of Virginia truly appreciates the Department of Interior and ASTO for their tremendous support. The Office of Procurement and Contracts and Management and Reporting, or OPCMR, the Office of Procurement and Contracts Management and Budgeting, or Reporting, was created pursuant to Executive Order number 493-2019 and facilitates the procurement process for goods and/or services as well as leases for the department. OPCMR ensures adherence to all of the established policies and procedures of the Virginia Department of Property and Procurement in a centralized manner. Since the establishment of the OPCMR, the department has participated in approximately 8 GVI-wide contracts with various vendors for services included but not limited to janitorial, exterminating, purchase of household cleaning supplies, security systems, and/or guards services. The unit has also coordinated efforts with DPP to approve agreements attached to monthly recurring charges for FY22. 20 agreements were fully executed. The same will be done in 2023. The coordinated efforts also result in the execution of 52 contracts department-wide. Some of the agreements were 3 to 6 months. Some have expired but were nonetheless executed. Currently, there are 81 items on the list of pending agreements or solicitation and 15 pending leases that the unit is working on. There are executed leases, 4 on St. Thomas. There are 6 executed leases, 4 on St. Thomas and 2 on St. Croix. The Office of Federal Grants Management. The Office of Federal Grants Management is presently overseeing 65 projects and 81 single budgets, totaling $70,661,212, which consists of $22,006,401 in core grants, $36,333,292 in COVID-19 grants, $6,197,482 in WIC infrastructure grant, and $6,124,046 in one-time grants. Since the pandemic, the department has been awarded 32 individuals COVID-19 grants totaling $36,333,292. The awarding programs are epidemiology, laboratory capacity for infectious diseases, Ryan White Care Act Title II, immunization vaccine program, maternal child health or MCH program, initiatives to address COVID-19 health disparities among populations at high risk and the underserved, including racial and ethnic minority populations in rural communities grant programs. Nationally, the COVID-19 grants were all afforded extensions to address the needs of the community. The VI Department of Health has had no return of any federal funds for this fiscal year. Since the pandemic, the federal grantor agencies have implemented the expanded authority designation that allows the various project funding in the portfolio to be available through the end of the project period for spending. This designation allows a project to have continuous access to the funds, enabling the Virginia Department of Health programs to spend the funds until the end of the project period. The VI Department of Health has 2 restricted grants in the portfolio, which is the F707H, State Primary Care Office, or PCO, grant worth $150,464. This grant has been restricted due to the delay in receiving the new indirect cost percentage. The VIDOH has received F701K, ARPA Pediatric Mental Health Care Access Area Expansion from HRSA. It's a HRSA grant in the amount of $45,000, which is a new pilot grant and came with restrictions for the simple reason that it is a new project grant. And it is, as I said, from the Health Resources and Services Administration, or HRSA. The VIDOH has also received a new SAMHSA grant, F704L, the VI 988 Cooperative Agreement for $250,000. This grant was awarded to assist in the introduction of the new 988 emergency system for mental health access to emergency assistance. The department's fiscal year 2021-2022 accomplishments under the Bureau of Human Resources and Labor Relations. The Human Resources Division works to increase, the efficiencies throughout the agencies by improving its functions. Over average numbers of recruitment days is defined as the timeline starting from the date of the receipt of the completed request for personnel action, or the RPA, with all approved budgets to support the request to the approval date of the notification of personnel action, or NOPA. Our average recruitment days is 47, which is 6 days short of our KPI goal of 38 days. Our recruitment days decreased from 55 days to 44 days, which shows an 8% improvement. We continue to rework our internal processes and collaborate with external agencies to reach and surpass our goal for recruitment. We have increased our HR staff by 1 in St. Thomas. We will continue to build the HR team territory-wide. Most of our divisions participated in a series of educational training courses. The department successfully achieved a total of 2,282 training hours over the past year. Example of the offerings were Public Health 101, COVID-19 protocols, emergency medical services, behavioral health, and dealing with COVID fatigue, and others, to name a few. The excellent training offered by the division personnel assisted us as well. The Department of Health FY 2022 budget includes a total of 367 funded positions, 215 general fund positions, and 152 federally funded positions. 181 employees in St. Thomas, St. John District, and 186 in the St. Croix District. 234 of our employees are classified, while 121 are exempt, and 12 are temporary. To further break down the numbers, the St. Thomas St. John District has 125 classified employees, 51 exempt employees, and 5 temporary staff. The St. Croix District has 109 classified employees, 70 exempt employees, and 7 temporary employees. 37 employees separated from the Department of Health in fiscal year 21-22, 26 resignations, and 11 retirements. Our HR goal for staff turnover is less than 10%, which impacted by numbers of resignations and retirement for a turnover rate of 10.08%. An organization the size of the VI Department of Health expects a turnover rate of negative 21%, or of 21%, my apologies. Our turnover rate of FY 2021 was less than 2%. Healthcare organizations nationwide have suffered from high turnover due to the pandemic, which continues to impact recruitment costs. We currently have 3 people in our acting role: the acting assistant director of behavioral health, acting head nurse community health, and acting director EMS regulatory. All placements of compensation documents are being processed. Major accomplishments for HR: recruited and onboarded 32 team members in fiscal year 21-22. The numbers included staff in the following areas: behavioral health, and in particular the mobile strike team, the new disparities grant, chronic diseases, communicable diseases, Office of the Commissioner, epidemiology, immunization, and human resources, to name a few. We have a total of 90 personnel requisition forms, or PRFs, processed and approved between October 1, 2021 and June 30, 2022. up to 18 for the same period of the previous year. Labor relations. All labor relations cases are being addressed as we continue to collaborate the Office of Collective Bargaining. In 2022, there were 10 labor relation cases, 6 new and 4 from the previous year. 4 were resolved with 6 going through the process. From the previous year, 2021, there were 24 cases, of which 18 were resolved, leaving 4 cases that are now in the count for the current year. Our goal is to continue working through the cases. The reduction from 2021 to 2022 is 14 cases. In June of 2021, the department was also awarded a 2-year grant with an end date of 2024 for the Center from Disease and Prevention in the amount of $3,114,521. The grant addresses health department response to the health and health crisis, national initiative to address COVID-19 health disparities among populations, otherwise known as OT 21-2103. The VI Department of Health HDP. To date, 99% of the staff members required have been onboarded, including the first set of community health workers in the territory, and the program has begun to effectuate some of its core requirements. We are collaborating with Puerto Rico as the other Atlantic district who has awarded disparities grants as well, along with ASTO, to develop a significant plan and foster sustainable relationships. Our outreach efforts have begun and focus on the underserved population by providing educational materials, working to streamline mitigation efforts, and offering guidance related to health disparities that have become amplified by COVID-19. On August 1st to 14th, this next week of 2022, our local strategic partners will join us as we convene the very first Health Disparities Leadership Conference, along with the first federal partners to include the National Network of Public Health Institutes, National Association of County and County Health Officials, ASTO, and CDC's Office of Minority Health and Equity. The Office of Commissioners received approval from the Office of Management and Budget to open the very first Virgin Islands Department Public Health Office of Health Equity, the focus of which will be to facilitate and promote equality in healthcare and eliminate the many barriers in access to healthcare for underserved members of our community. There will be ongoing efforts to address avoidable inequities and increasing access to care and community services. The initiatives will benefit populations including the LGBTQIA+ group, those who with behavioral health challenges, the pediatric population, and those living with HIV, to name a few. Our Public Health Preparedness Division. Public Health Preparedness Division works with the public health and health systems to build capabilities and enhance the response to public health emergencies. This is an accomplishment through collaboration and emergency preparedness and response planning, training, and exercises. The team in the Public Health Preparedness Division led the daily COVID-19 emergency operation meetings using the Incident Command System. The National Hospital Preparedness Program Cooperative Agreement is a 5-year program funded by the Assistant Secretary of Preparedness and Response, or ASPR. This funding focuses on improving patient outcomes, minimizing the need for federal and supplemental state resources during emergencies, and enabling rapid recovery from catastrophic events through the development of healthcare coalitions. This program focuses on 4 capabilities: foundation for healthcare and medical readiness, healthcare and medical responses, coordination, continuity of healthcare services, delivery, and medical surge. Funding from this program has been used to pay core staff salaries, purchase equipment to the hospitals and divisions, purchase personnel protective equipment, and provide training opportunities to both hospitals and their employees. Our Health Care Coalition, or Emergency Support Functions, ESF 8 Public Health and Medical Services. Our goal is to formalize the VI Health Care Coalition. Healthcare coalitions are groups of individuals, healthcare and response organization in a defined geographic location. They serve as multi-agency groups that support to integrate with emergency support function 8 public health and medical services activities in a context of incident command system. Currently, ESF 8 leads meet monthly and discuss needs for the health of the territory. ESF 8 meetings will be used as the core of the VI Healthcare Coalition for the preparedness under an agenda that will allow for detailed strategic planning and vision of PHP in the territory. The coalition will be formalized. We will be able to collaboratively identify groups, mitigate strategies, conduct operational planning and response, improve situational awareness through informational sharing, and strengthen resources management and coordination. Public Health Emergency Preparedness, the Cooperative Agreement. The FEP COAG is a 5-year grant program funded by the Centers for Disease Control and Prevention. The focus of the funding is to support strengthening the capability of public health systems to effectively prepare for and respond to public health threats in the emergencies. This program is built on 6 domains of preparedness: community resilience, incident management, information management, countermeasures, and mitigation. The Public Health Preparedness, or the FEP team, works very closely with the VI Emergency Management Territorial Agency, or VITEMA. Looking ahead, with the assistance of VITEMA and FEMA Territorial Action Review, we have begun with the goal of determining the hits and misses of the COVID-19 pandemic. Areas covered will include use of the incident command system, overall communication, financial operations of incident staff, etc. This process includes developing and implementing courses of action to test and improve our plans and procedures to future operations. We are currently undergoing this AAR this week, and the results should be coming out pretty shortly. Communicable disease, 340, getting to zero, is the theme of the Communicable Disease Division promotes as we work on ending HIV epidemic in the Virgin Islands. The goal of the 340 Getting to Zero campaign are 90% of people living with HIV know their HIV status, 90% who know their HIV positive status are receiving treatment, and 90% of people on treatment have surpassed viral loads. The Communicable Disease Division held the first historic summit on St. Croix entitled Innovative Approaches to HIV Prevention and Treatment. That was March 10 to 11. The summit brought over 100 healthcare representatives, including Governor Albert Bryan Jr., Vice President of the 34th Legislature, Senator Novell Francis, and Stan Phillip, Branch Chief Centers for Disease Control and Prevention. Several topics that were discussed during the summit include status-neutral HIV prevention and treatment, which is critical for reducing or really deleting the stigma of HIV, and a few others were addressed as well. The summit also brought a unique approach, allowing the audience to hear firsthand from HIV-positive individuals, representatives from the LGBT community, as well as sex workers. The division is happy to announce that they will be holding a workshop on the summit at the United States Conference on AIDS later this year. The sum of the workshop's learning objectives include which will be discussed the power of collaboration in providing training, technical assistance, and health programming for multidisciplinary HIV providers. Continuing in the spirit of 340 Getting to Zero, the Communicable Disease Division is elated that our prevention coordinator received a scholarship to attend the 24th International HIV/AIDS Conference from July 29th to August 2nd in Montreal, Canada. Under the theme, It's Time to Re-engage and Follow the Science, the conference will define future research agendas, shift the latest evidence to action, and chart a new consensus on overcoming the HIV epidemic as a threat to public health and individual well-being. In June, Communicable Disease Division and Department of Health employees allied with LGBTQIA+ advocates to show support for the diversity of the Virgin Islands community and promote culturally relevant information. Most recently, the Communicable Disease Division joined community-based organization Frederickstead Health Center, Inc., One Love, Inc., St. Croix Pride, Inc., and independent community advocates to discuss the needs of the LGBTQIA+ Virgin Islanders with Governor Albert Bryan Jr. during the meeting led by Frederickstead Healthcare, Dr. Rodney Kidd, to critique with the critical needs of the community. Virgin Islands were discussed. including local protections and advancements of marriage rights, education and training on LGBTQIA+ issues, accurate gender identity markers, housing, employment, and anti-discrimination policies and legislation. As COVID-19 numbers fluctuated in the territory, the Communicable Disease Division continued offering rapid HIV STD test screening and the COVID testing at multiple community outreach events. The approach created a safe space as we worked to destigmatize STD, STI, and HIV testing. As a result, our approach, the division director was asked to present at a webinar, Making Strides Towards Ending the HIV Epidemic, in collaboration with the New York State Department of Health and Puerto Rico Division of HIV, Hepatitis, and STD Prevention. In 2021, the division had a total of 13 new HIV/AIDS cases, 462 new chlamydia cases, and 47 gonorrhea cases, and 42 syphilis cases reported in the territory. Working closely with the Office of Management and Budget Division successfully put all of their federal grants online to include $1 million Disease Intervention Specialist Workforce Supplement. Monkeypox. The World Health Organization has declared the current monkeypox outbreak as a global emergency. As of July 22, 2022, the CDC reported 16,836 global cases, of which a majority are in countries that have not historically reported monkeypox. There are 2,891 cases in the nation, with 9 cases in Puerto Rico. The department is participating with the federal and local partners to respond to any local cases of treatment and outbreak prevention. The department will send diagnostic samples to reference laboratories and confer with CDC Monkeypox Division for access to medical countermeasure treatments and vaccination prevention. Our immunization division has secured 100 doses of Genua's vaccine for outbreak prevention. Genua's is a replication-deficient smallpox vaccine that has been shown to be effective in monkeypox prevention and treatment. Monkeypox is a rare virus that's smallpox, like smallpox, but is milder and rarely fatal. Symptoms of monkeypox include fever, headache, body ache, swollen lymph nodes, exhaustion, and a rash with pimples or blisters. The virus is spread by person to person through direct contact with infectious rash, scabs, or body fluids. It can also be spread by respiratory secretions during prolonged face-to-face contact or during intimate physical contact such as kissing, cuddling, or sex. The virus can also be spread during pregnancy through the placenta. Any suspected cases identified by a healthcare provider should be reported immediately to the Epidemiology Division and the Territorial Infectious Disease Specialist. This notification will also activate the protocol for laboratory diagnostics, access to medical countermeasures through expert consultation with CDC, and contact tracing from post-exposure prophylaxis with vaccination. The antivirals are available on demand for severe cases from the CDC. The department will continue to provide education to providers and territory to keep the public informed of any confirmed cases. Vaccination will be used primarily for post-exposure prophylaxis. Pre-exposure prophylaxis may be considered to target high-risk populations in the community transition if the community transition is high. Our certified territorial public health lab. The public health laboratory was essential to the territory response to COVID-19 pandemic. Achieving clinical laboratory improvements amendment, or CLIA, certification meant that this testing capacity improved substantially. Over 93% of the total 10,000 molecular tests conducted by the public health lab in the last year have been reported in less than 2 days following receipt of the lab, and the median numbers to complete testing in under 8 hours. It is important to note that despite shortage nationwide, the public health lab was successful and never ran out of COVID-19 test kits. The Department of Health trained over 100 persons to conduct testing and continues to provide testing resources throughout the territory. Nearly 90,000 tests were distributed in 21 and over 60,000 tests so far in 22. The laboratory contributes to a healthier U.S. Virgin Islands by providing diagnostic screening, monitoring, reference, research, and emergency public health laboratory services to departments, agencies, physicians, hospitals, and private communities. The Public Health Lab has been successful in transmitting quickly since first opening in 2020, from sending specimens off island to CDC or elsewhere outside the territory. Within the next year, the laboratory intends to expand testing for other infectious diseases and to allow for testing of all sexually transmitted infections on island. Through the collaboration with our Communicable Disease Division, the Public Health Lab is now testing specimens for chlamydia and gonorrhea in the territory. This is a historic achievement as all testing territory-wide for these samples have been sent off island, causing providers and clients to wait anywhere from 2 to 3 weeks for a diagnosis. With the historic achievement, results can be received in as little as 24 hours. Importantly, we will work with community stakeholders, including federally qualified health centers and private providers, to ensure local testing technology and capability access. We are expanding from infectious disease testing to include environmental testing. We are currently working with CDC to be able to conduct local monkeypox testing. The laboratory will have also conducted preliminary testing on cisterns and will be equipped to conduct hemp or marijuana-related testing. Epidemiology. The epidemiology division collects surveillance data to identify, prevent, and respond to current, emerging, and unknown public health threats. As a division within the Department of Health, epidemiology has assisted partners in detecting and responding to a variety of public health issues, including dengue, chikungunya, Zika, norovirus, and bacterial specimen pathogen and surveillance. Epidemiology also led the fight on COVID-19 throughout the territory and continues to do so. The team will continue collecting information on 2019 nCoV and will conduct testing and contact tracing as needed. The division experienced an intense workload for all staff working 7 days a week during the COVID-19 pandemic. We will continue building capacity within the division to respond quickly to the future infectious disease threats. Data modernization methods will be employed to pull data, provide the information, and use the information to drive decision-making. Although it is a budget hearing, quickly, the last updates on the COVID-19, we have tested 595, which 32 were positive. Active cases as of the 24th, just 2 days old, 205. Recovered, 21,271. St. Croix has 24 new cases, active cases 124. St. Thomas had 8 new cases, active cases 69. St. John had no active case, no new cases, and only 12 active cases. Our partnership and resolve are strong. We will continue to work together collaboratively and keeping the public safe. Epidemiology does not provide any clinical services at the current time. It offers pop-up testing for COVID-19 and blood draws for mosquito-borne viruses as needed and supports specimen collection, such as blood and stool, in the event of an outbreak. The Bureau of Public Health Services. The Division of Behavioral Health, Alcoholism, and Drug Dependency Services, or BHAS, is recognized as a top priority clinical services area supported by the Governor's Executive Order 486-2/2019, referenced above. Key accomplishments include the 988 Suicide and Crisis Lifeline with collaboration with VITEMA, National Guard, Veterans Affairs, and telecommunication providers. The 988 is now active in the territory. However, this is the first phase. The second phase is to develop a call center in the territory or region while simultaneously requesting funding to develop a mobile crisis response team so that someone will respond to a crisis locally when necessary. The federal government has proposed additional funding to support the 988 initiative. Behavioral Health Federal Funds. The Behavioral Alcoholism Drug Dependency Services is a single state authority for the Substance Abuse Prevention and Treatment Block Grant and the Community Mental Health Block Grant. which is administered by the funding through SAMHSA. BHADS receiving a funding to provide behavioral health and substance abuse services throughout the territory with a combined total budget of $1,026,901 upon grant application. Project for Assistance in Transition from Homelessness, or PATH. We were granted $52,000 for that. That's a state opioid response program. It is funded through the Substance Abuse and Mental Health Services Administration, or SAMHSA, Center for Substance Abuse Treatment. CSAT is the amount of $250,000 annually by submission of a grant application. The state opioid response, which also is $250,000. It includes substance abuse block grant, community health block grant, substance abuse supplemental block grant, community mental health supplemental block grant, substance abuse block grant, community mental health block grant. BHADS continues its role in the development of the Office of Gun Violence and Prevention, now under the Office of the Governor. In collaboration with our maternal child health division, the Department of Education's primary school teachers and staff, BHADS, participated in its St. Croix District Let's Talk Youth Mental Health Collection. Services to provide 430 patients enrolled in the outpatient service between the clinics St. Thomas St. John District and St. Croix District. Patients receive one-to-one therapy, case management, methadone services, psychiatric services, medication management, clubhouse, and substance use services. Residential patient services. Currently, 35 individuals are on off-island care. 20 of the 35 are in the forensic population with a cost of $4.4 million annually for forensic placements. 9 patients total returned to the Virgin Islands thus far during this fiscal year. 5 patients returned into the community, 1 reunited with family, and 3 others brought to Elder Shelterbrand from off-island facilities. The Elder Shelterbrand facility currently has 27 residences. We continue to conduct outreaches within our school system, within our public and private partnerships, and provide our therapy to the seniors of the Department of Human Services in both the St. Croix and St. Thomas District for Mental Health Month awareness. We continue to conduct trainings with EMS Division. We conducted a naloxone/CPR training, which is very essential when speaking about overdose with opioids. BHADS staff collectively continue to enhance their skills by studying current evidence-based treatment methodologies and models via online training. CPI, or Nonviolent Crisis Intervention Training, has started. VIPD is also they're collaborating along with us to include that training sessions as well. Our EMS, with the passage and enactment of Bill 31-0101 early this year, Emergency Medical Services, or EMS Division, legally transferred to the Virgin Islands Fire and Emergency Medical Services team. Emergency medical services were provided to the territory's residents and visitors by single-role EMS provided ranging from emergency medical technician to paramedic and EMS certified firefighters. It is anticipated that EMS response component of the integration of EMS and fire services will commence 2 weeks after the issuance of the certificate of need. Right now, the fire department and the Department of Health are working collaboratively to ensure that that is completed on an expeditious basis. Full integration implementation is expected 180 days after the Act 8545 was signed into law. We are committed to ensuring that EMS integration is seamless and will continue to support the EMS providers through our authorization and authority to coordinate a program for planning, expanding, and upgrading emergency medical services throughout the territory. With pride and a bit of heavy heart, we say goodbye to EMS operations and welcome our role in the EMS regulatory affairs. EMS has retained their staff longer than many other divisions in the Department of Health. Members of our now VI FEMS, you define dedication and compassionate care. You are joining a great team under the leadership of Director Darrell George, and we thank you. The Bureau of Regulatory Services. The Department of Health's regulatory outside services include birth and death certificates, burial permits, funeral homes, tobacco control, medicinal marijuana control regulation, food safety, certificate of need, medical malpractice, clinical and allied health licenses, and professional boards and related health data collection. In environmental health, number of inspections completed in 21 was 3,500. In 2021-22, 1,906. The number of health permits issued, 4,450 in 2020 and 2021, and 2,272 to date in 2022. The number of health cards issued, 12,000 in 2021, and in 21-22, 8,526. The revenue collected, $638,089 in 2021, and in 21-22, $434,449. You'll see a drop in our activities as a result of, one, an increased number of businesses that occurred, as well as a decreased amount of our staffing. We are working to enhance and improve our staffing levels so that we can continue to regulate, ensure that food safety continues within the territory. Implement the goals, implement a new schedule for administrative fees, which will project approximately $5 million into the Health Revolving Fund. Introduce enrollment in Save Serve, a nationally recognized and American Standard Institute certified course on food safety and best practices for one to obtain a health card. Professional licensure and health planning. License renewal automation will commence this fiscal year. Professional licensures, collaboration with the primary care office, workforce development project, physicians and dentists is ongoing and produce data guiding territorial health planning efforts and substantiated the VI's designation as a health professional shortage area, qualifying the territory for federal resources. Licensure by credentials and reciprocity is available in the territory for most of the Department of Health's Professional Health Board. This has increased access to healthcare specialty providers and much-needed services. Professional licensure experienced more than 25% increase in applications for licensure in the territory. The VA Board of Pharmacy implemented a non-resident pharmacy registration process that complies with the national standards and established regulatory protection for the territory. The VA Board of Medical Examiners website officially launched this month in July 2022. With the complement of 3 full-time staff, the division manages a day-to-day operation, processing and maintaining over 1,000 applications biannually. In addition, it serves as a liaison between the local boards, federation boards, and the Department of Health, federal agencies, and numerous intergovernmental divisions in the territory. With increasing demands on regulatory processes and improved standards to protect the public health safety, we will be recruiting additional staff members to manage the workload better and continue providing optimal customer service for all the applicants and the public that we serve. Immunization. The VI immunization program is charged with the responsibility of ensuring uninsured and underinsured population receive vaccination, prevent disease, disability, and death. The immunization program is 100% federally funded and works cohesively with the Center for Disease Control and Prevention. The immunization program comprises 4 components, including vaccines for children and surveillance, hepatitis B and epidemiology, adolescents vaccines, HPV, DTaP, and meningococcal teens and adults for those diseases, adult vaccines and the pandemic flu. Our budget, the immunization program core grant is from July 1st to June 30th and reflects 6 spending sources of options that ideally reflect the program components: vaccine for children, vaccine quality and assurance, vaccine operations, 317 operations, public preparedness health fund, pandemic flu and immunization information system. With the onset of the coronavirus pandemic or COVID-19 in 2020, the immunization program has redirected its focus to join in the national cadence to vaccinate everyone quickly and equitably. Since then, the immunization program has been receiving, delivering, and administering federal COVID-19 vaccines allotment through federal and local partnership, the last of which ended in June 17th. Community vaccine clinics were one major ways to offer the vaccine to a wide cross-section of the community, initially at the University of the Virgin Islands, and now they are back into the Community Health Center, both St. Croix, St. Thomas, and St. John. The Virgin Islands Immunization Registry System. This year's major accomplishments for the immunization program is the expanding development of the VI Immunization Registry System. The immunization program registry was lost after substantial significant damage from 2017 hurricanes. We are happy to see it back up and running and will be maintained so that your records can be protected. The immunization program will continue to engage the community to educate about the importance of vaccination, provide information, and offer opportunities to get vaccinated against disease. Challenges, of course, were there. Vaccine staff pending, IT specialists, data quality analysts, data extract analysts, EMT, registered nurses, our Division of Human Services working hard with Director Stout to ensure, and we also have a hepatitis B coordinator that's needed to ensure that we, they're federally funded, to ensure that we get those people on board as soon as possible. Vital records. The Department of Health Office of Vital Records and Statistics is mandated by the VI Code to register and preserve data relative to all vital events in the territory of the United States Virgin Islands. VRS is responsible for the registration, maintenance, and dissemination of the territory's birth and death records. In FY 21-22, there were 838 births and 622 deaths. Revenue generated of June 2022 is $108,460. Accomplishments. A contract package for the information management system has been partially executed by the Commissioner of the Department of Property and Procurement and transmitted to the Department of Justice for further processing to the Office of the Governor for full execution. Partial funding for this project is an amount of $450,000 was received from the Epidemiology and Laboratory Capacity, or the ELC grant. The Division of VRS has been approved to receive technical assistance from ASTO to assist with the implementation of the online processing system. The 2021 live birth standard certificate of deaths and fetal deaths information were scanned, uploaded to SAMS, and sent to National Vital Stats System. The department will be reimbursed for its data sent to NHCS. Bureau of Health Promotion and Disease Prevention, one of our most productive units in the terms of community outreach. The Bureau of Health Promotion and Disease Prevention includes Division of Chronic Disease. Community health clinics include Morris Castro, and on the island of St. John, family planning, infants and toddlers, maternal and child health, children with special needs, primary care, public health laboratory, women's and infants and children. Project directors and administrators in this unit manage over $28 million in local and federal funds, employing 118 clinical, allied health, and administrative support professionals. Chronic disease program. The 2021 Block Grant Risk Factor Surveillance System, or BREFIS, was completed as planned and recorded 1,519 completed surveys. Data is currently being analyzed and cleaned by the CDC pending release in August of 2022. Data collection for the BREFIS began early in June and will be completed by June 2023. For the first time, data for the 2022 survey will include questions on use of dried tobacco, leaves, or Fanta mixed with marijuana. The 2022 survey will also assess the prevalence of long-term effects of COVID-19, equitable vaccine distribution and commodities among those experiencing the virus and its effect. Our sickle cell disease program collaborated with various laboratories in the territory to offer free sickle cell trait testing. The Virgin Islands Cancer Center Registry, the VI Department of Health Cancer Registry information system is designed for the collection, storage, and management of data on persons with cancer. Registries play a critical role in cancer surveillance, which identify where we should place our efforts to reduce the cancer burden. Surveillance data may also serve as a foundation for cancer research and are used to plan and evaluate cancer prevention and control intervention. The Virgin Islands Cancer Registry is currently working to finalize 2017-2018 cases by October 22. Chronic Disease Self-Management Program. To date, the division has facilitated over 8 workshops and more than 150 participants. Since the COVID-19 pandemic, the workshops have been facilitated virtually, allowing participants to engage during their lunch break and from the comfort of their home. In August of 2022, we will be expanding to train leaders who will offer workshops in various settings such as housing communities, community-based organizations, and senior centers, thus expanding the reach of the program. The community health clinics in St. Croix, St. John, and St. John, and St. Thomas during FY22 have been instrumental in the role and implementation of the COVID-19 vaccines through the clinics and community vaccine centers. Established on all 3 major islands since the arrival of the vaccines in the territory. By the end of June 2022, over 68,000 vaccines have been administered and 7,990 incentive gift cards were distributed through the CBCs. We do share our sincere apologies for the delay in closing out the incentive program, and to those who have not received their outstanding cards, Department of Health wants to say that we are sorry and working very collaboratively with the other divisions to ensure that you receive your card, and will have a press release so that you know when your cards are ready for pickup. Family planning programs. From October 1st, 2021 to June 30th, 2022, the family program served 1,961 clients and submitted all required reports and continuation grant application to ensure continued funding. The department was awarded $960,360 per year for a 5-year project period to continue the family planning program, $4,801,800 total funding. 2 other critical awards received include $337,092 in annual funding for CDC to resume national breast and cervical cancer screening programs in the USVI for the next 5 years, $1,685,460 total funding, and $419,485 in funding for 1 year to expand the telehealth infrastructure in the family planning program. Infants and toddlers. Infants and toddlers program is required to provide an initial evaluation assessment and develop individual's family service plan within 45 days of the child's referral. If the target is not met, the program must report whether it is due to family circumstances or due to program error. The cumulative number of infants and toddlers who receive early intervention services in 2021 is 34 in St. Thomas, St. John District, 228 in St. Croix District. Additionally, the Interagency Coordinated Council continues to convene to advise and assist the program as required by the Office of Special Education. MCH, or the Maternal Child Health and Children with Special Health Care Needs. Fiscal year 2022 was a very active year for the MCH division. The division engaged in several health initiatives geared towards early intervention and prevention. These activities include breast cancer awareness walk, diabetes awareness walk, the oral health initiative, nutritional month run, Kick and Bounce Fun Day. During Oral Health Month in February, the program collaborated with the Department of Education, the Dental and Children Dental Care, Inc., and applied fluoride varnish to 290 elementary and junior high school students. Of 290 students seen, 143 were boys and 147 were girls. Over 1,000 students attended Nutritional Month activities territory-wide, conducted in collaboration with the Division of Sports, Park, and Recreation. Students participated in games such as basketball, kickball, and other sports as well. The Virgin Islands Child Psychiatry Access Program, or VIC-PAP, launch is in both districts in April, aimed at establishing a new pilot regional pediatric mental health care tele-access program for the psychiatric consultation, care coordination, and referral to behavioral health services in the USVI. In April, the program participated in the First Lady's Easter egg roll and distributed Easter baskets to 200 children. MCH also implemented telehealth during the month of July. This will significantly improve healthcare quality by increasing accessibility and efficiency by reducing the need to travel, providing clinical support, overcoming geographical barriers, offering various communication devices, and improving patient outcomes. Telehealth advantages include cost savings, convenience, and the ability to provide care to people with mobility limitations. Also in July, the program held a 4-day Children's Mental Health Summit. The summit purpose was to encourage community leaders, parents, community partners, and providers to come together to discuss and seek solutions for mental health concerning impact on our territory's children. The summit began with 2 days of training. Some topics included trauma, gun violence, depression, the effects of poverty on our mental ill, early childhood expulsion, and sex abuse. 36 professionals participated 1 day on 38 on day 2, for a total of 74 participants. The Office of Primary Care. The United States Virgin Islands Primary Care Office increased access to quality health care through assessment, collaboration, and workforce development. It is 100% funded through a cooperative agreement, and the funding's worth is $150,464. It is supported by the Health Services and Resource Administration, or HRSA. The 3 broad areas of activity covered by the PCO are statewide territory primary care needs assessment, shortage designation, coordination, and technical assistance, and collaboration that seeks to expand access to primary care. During FY 2022, the PCO reestablished the territory's participation in the Department of State Conrad 30 program for the first time in almost a decade. The participation in the Conrad 30 waiver program allows J1 foreign medical graduates to apply for a waiver that enables them to serve the territory, thereby increasing the territory's access to medical providers. 2 applicants for the J1 visa to the Conrad 30 program is in process, and the PCO also partnered with the Office of Professional Licensure to develop a process for the Department of Health Certificate for rural health clinics applications, forging a path for eligible clinics in the territory to obtain National Rural Healthcare designation. Thus far, 1 clinic has applied for Rural Health Clinic designation. This also opens us up for federal funding. Notably, the PCO successfully submitted applications for health professional shortage area designations for St. Croix, St. Thomas, and St. John. Women's, infants, and toddlers. Increased WIC infant breastfeeding averages rates from 60% in 2022 to 72% in 2022, from 2020 to 2022. VI WIC boasts the highest breastfeeding rates in the nation, for which the rate is 32.8% nationally. This helps buffer our severe impact on infant formula shortage in the territory. It also helps to protect our youngest ones in the population from negative impacts of coronavirus. Contracts for the hurricane rebuild projects for Newt Hansen St. Thomas WIC building and the Frederiksted WIC Clinic have been awarded construction. It is expected to begin later this year. Facilities, maintenance, securities. The most important item that I will speak about is the modular units were established as a temporary facility for the Department of Health, Public Health Services by FEMA, a mission assignment to the U.S. Army Corps of Engineers following the severe damages caused by 2017 hurricanes Irma and Maria. The Department of Health began occupancy in April of 2019 and began experiencing environmental challenges shortly thereafter. Even though we have provided FEMA with situational awareness of the state of the modulars, we are in the process of securing local funding to transfer staff out of the building as early as August 1st, 2022. In response to the environmental conditions in the modular units, we have employed various strategies to include repeated testing, cleaning, fogging, maintenance of AC units, deployment of industrial dehumidifiers and air purifiers, construction including removal of skirt panels, and repair of the structural issues. We have also reduced work hours. We have consulted with various vendors and governmental agencies for support in resolving the solution or the situation. Those entities include environmental services vendors, AC vendors, construction, U.S. Army Corps of Engineers, FEMA, with O'Brien and GVI entities, including VI Department of Health Environmental Unit, VI Department of Labor, OSHA, Fire, DPNR, Department of Education, ODR, OCB, SIU, and DPW, to name a few. Health Information Exchange administers, develops, and supports the Department of Health network infrastructure to support the growing needs of the agency to communicate, share, and connect with informational resources efficiently and securely. The Department of Health HIT Division continues to enhance, maintain, and support and implement current and advanced technical assistance and solutions to support the Department of Health's goal and objectives. Health HIT is working collaboratively with the Office of Health Information Technology under the Office of the Governor on the integration of the Department of Health electronic data system to the future planned Territorial Health Information Exchange Infrastructure Project. Health HIT has played an integral part in the data storage and reporting during the COVID-19 pandemic. I do have a list of project management and capital projects, but Senator Villalay, that will be for a later time. And that it finally brings us to our conclusion. The Department of Health continues to fill critical vacant positions by offering training and educational opportunities. We will continue our public relations campaign geared towards information and educating the community about health risks and trends as seen across the nation. We are steadfast in our quest for health equity as we strive to improve the quality of service in collaboration with our community. Guided by key strategies and priorities outlined in our Strategic Plan 2020-2025 and Healthy Virgin Islands 2030 Community Health Improvement Plan. As always, I would like to thank the VI Department of Health staff for their strong support throughout the year. In conclusion, Senator Kurth A. Villalay, the Department of Health is committed to reducing health risk, increasing access to quality health care, and enforcing health standards. As always, the Department of Health commits to continued collaboration between the members of the 34th Legislature. Senators, this concludes our testimony. Thank you for your continued support and patience as we read that testimony. This ends the testimony, and I welcome any opportunity to respond to questions that you may have. Thank you, sir.
Thank you for your testimony, for your extensive testimony. Before I go to the first senator, which will be Senator Blyden and then Senator James, in reference to fiscal year 2022, how many vacancies did you have?
2022. I'll turn that over to our Deputy Commissioner of Human Resources.
Thank you, Senator. Thank you, Commissioner.
If you can just take down the mask for now. Thank you so much.
It's a habit.
I know.
All right, my apologies on that. True vacancies for 2022.
And state your name first.
I'm sorry.
Reporter is
Sure.
in St. Thomas.
Joan Jean-Baptiste, Deputy Commissioner, Human Resources, Labor Relations. For 2022, 10 general fund vacancies and 18 federal fund vacancies, for a total of 28.
Say the numbers again, 10 and...
10 general fund and 18 as of June 30th, 2022.
Okay, that's all we had for the entire year? I thought you had like 90 vacancies.
We've been pushing quite a lot. The numbers that appear in the report here was as of April. We've been pushing quite a lot. We reconciled our numbers again last evening.
So
that's what,
the number that you're giving me is what is presently existing.
yes, for
Okay.
2022.
So how many new individuals were you able to bring on in 2022?
32, Senator.
So 32 new hires.
Yes,
And then you had 26 resignation and 11 retirement.
that's correct, Senator.
So that's 37. So it's still like a net loss of 5 positions.
Yeah.
Okay. And how many vacancies are you projecting in fiscal year 23?
Okay, so for 2023, our vacancies are funded at 50%. So 16.5 is the number under the general fund. So if we get it funded to 100%, then it becomes 33, Senator.
And on the federal?
On the federal, it's 43.67, so we run that up to 44, Senator.
And they were not the same formula of 50%, right?
I'm sorry? No.
They're 100%.
Yeah.
Okay.
Federal is 100.
Senator Blyden, you recognize, let's start with a 6-minute round. Senator Blyden. And recognize Senator Kenny Gittins, 1 minute, Senator Kenny Gittins, Senator Noble Francis, Senator Carla Joseph, and Senator Dwayne DeGraff. So those who are on the committee, please put them as present, and those non-committee members, thank you for coming as usual. You may proceed.
Thank you, Mr. Chair. Good morning to my colleagues, listening, viewing audience, staff, central staff. Good morning, Commissioner Encarnacion and your supporting management team that's there with you, and thank you so much for that most comprehensive, in-depth testimony. But I'm going to spend most of my time speaking to Ms. Hewitt and Ms. Gomez when it comes to the federal grants. Good morning, Ms. Hewitt. In respect to your comments just now, I guess that would explain on page 5 of 35 of the post-audit report, the large number in variance when it comes to the personnel services, some $2.4 million variance. Because I know in 22 was 14 million appropriated, and it's a recommendation of 11.7 for 2023. So is that because of the lost positions and the funding at 50%?
I defer that question to DC Jean-Baptiste.
Sorry, Senator, can you?
It's the federal grant. If you're speaking about federal grants, sir, that did not include a 50% decrease.
No, ma'am. I'm not speaking about federal grant. I'm speaking about personnel services on page 5 of 35. The variance of $2.4 million for personnel services and 1.1 million for French benefits. I was asking if the loss of the 5 positions and the funding at 50%, does that account for the difference, such a large variance? And if not, what's the reason for it?
Good morning again. Tatia Monell Hewitt, CFO. The difference is due to EMS transferring to fire. So we have that's the majority of the difference. So that's the reason for the 4.5.
Okay, that explains it. Thank you so much. And also on the other services and charge, in 2021, the actual was 74,000, but we are saying a $1.6 million for 2023 recommended. What's under that category, and why such a large variance in funding?
For other services under the general fund, the reason for the variance is that we transfer $1.5 million to our indirect costs for off-island care. So that's the reason.
Thank you for that. Now let's go to page 11 of 35 under the federal grants. I know in the testimony it was mentioned that you have received some $70 million in federal funds, and that's a large amount of money. I'm not going to go through the list because it's extensive, but my question is, as the commissioner stated, that in 2022, no federal funds were sent back or lost. When it comes to some of these federal funds, for instance, I note on page 12, 1,301,000 for the Community Resiliency Project. That grant have expired in May of this year. Have we completed, utilized all of those funds for that project?
I'll refer that to our Director of Federal Grants. Ms. Johannes, could you answer that question for us, please?
Yes, good morning, everyone. My name is Eleanor Johannes, Director of Federal Grants Management. The Community Resilience Fund that you're seeing, it was extended. As a matter of fact, the extension just happened yesterday when they asked us to send a new SF-424 for the additional funding. That grant is extended until December of this year.
Okay, thank you for that. And also on the next page, the reopening of school COVID-19 grant that expires the end of this month for $3.1 million. What's the status of that grant?
That grant is under the expanded authority. It's COVID funding. And so that is not going to be expired until about year 2024.
2 minutes.
Because
so you
COVID
got
is...
you get an extension of that grant?
Yeah,
because
they're
it's
all under the...
2022.
Correct. They're all under the expanded authority. So that was recently given also.
Okay, very well. So you have had several extensions basically with some of those grant fundings.
Yes, as the commissioner stated, because of the expanded authority for healthcare grants, this is something that is nationwide. It's not just for the Virgin Islands. But because of COVID and the various agencies also had a reduction in their workforce, they came up with this expanded designation so that it will have the programs them be able to spend their money all through down to the project period ending.
Okay, very well. Thank you for that. Let's go to page 19 of 35 on the contract listing. And I see you have a contract here for inductive health for $1.6 million when it comes to contact tracing. How much have been expended for that contract, and have they been paid up to date?
Dr. Ellis, can you please answer that question?
Yes, hi, good afternoon, or good morning. Dr. Ellis, Territorial Epidemiologist. With inductive health, we are up to date on the payments, and we pay them monthly. There is a contract, and so it's monthly payments. The exact amount that has been paid to them thus far, I would have to defer to CFO Monel Hewitt.
So let me ask another question then, because there's some $51 million in contracts. So you do not have any outstanding payments for on your contracts?
Correct, there are no
Do you have any?
outstanding payments for inductive health.
Are you asking about all contracts or just inductive health?
Oh.
CFO Hewitt, can you please answer that? Any outstanding payments on contracts per se?
Time.
No, there's no outstanding payments for contracts at this
And
present
lastly,
moment.
Mr. Chair, okay, thank you so much. And lastly, Mr. Chair, in closing, outstanding obligations. I know I see a $1.5 million obligation for different vendors, etc. Do you have any outstanding obligations? Because I'm seeing many of them at the time of the postal report stating that the payment is in progress. Have those payments been paid to those vendors? Have they been made whole?
Not all, sir. We addressed that up until yesterday, and we have forged a way to ensure that we more expeditiously pay the vendors. So there are a few, CFO Hewitt can speak to them at this point in time, noting that some of the vendors, their payments may be delayed as a result of us attempting to go into a contractual arrangement with them, and they're not all documents are being provided as they need, and that sometimes delay payment. But CFO Hewitt, you want to speak to that, please?
Yes. Of the standard payments that is listed, totaling $1.3 million, we have paid $1.1 million, and we have a balance of $382,000 at this present moment, which is still going through the process for payment.
Okay, well, thank you so much for your responses, and I appreciate the time, Mr. Chair. I appreciate it.
Thank you, Senator Blyden. Ms. Hewitt, Monel Hewitt, in reference to the emergency fund, the emergency services fund, is that amount going to be transferred over to fire? Because the original purpose of the fund was to assist the ambulance service, etc.
Most of that will be transferred. We're actually in the process right now of still doing some negotiations, especially since we are going to be conducting the billing and coding process for EMS at this point in time. So we're, like I said, we're still in the negotiation phase.
Okay, because we have projected the entire amount. This year, the appropriation was $734,809, and next year, the suggested amount is $734,809. So we're trying to figure out what should be the percentage, since we have kind of double fire responsibility.
What we're looking at right now is making sure that all of that goes to fire, but we have to make sure that we are compensated in some way for what we're losing, so that especially our head revolving fund, since fire did bring in, EMS did bring in quite a bit, how we're going to compensate for that. So we're still in negotiation phase on that.
And compensate in terms of, because you're doing the billing?
Correct.
Okay. But you know, that's legislation.
Yes.
Because it's 40, 30, 30, so I would suggest that you have a discussion with the chair of the Health and Hospital Committee so that we can be able to change that particular percentage.
Thank you.
And there's also some federal allowances for that, for the use of those particular monies. So
I don't think those particular monies are going to be. They're going to be transferred over to fire. Let's be very clear with that. The negotiation remains as to what are the funding we can make sure that we increase in health to supplement for that.
okay, that would work. So now in reference to Mr. Evelyn, is the Department of Health or Fire EMS? Because I'm trying to.
We borrowed him. We actually have documentation through our personnel. So he's working right now as the transition continues. So he is Assistant Director over Fire EMS, but he's also the lead person in health, working with us during the transition. Okay. He's being paid by fire. Mm-hmm. Yeah.
But he's just assisting with the transition.
He's just assisting with the transition.
But he's not a Department of Health employee.
No, we own him, but no.
Okay. So he's here to provide answers if we want to
Correct.
speak to the transition.
Yes.
Okay. Senator James, you recognize.
Good morning to the people of the U.S. Virgin Islands. Thank you for being here. And I just want to continue to say thank you for all that you and your team have done during COVID-19. I know you guys are probably still working with the transition, even though we still have COVID-19 cases. So I just want to say once again, thank you for the hard work. No one expected this. No one planned for this. And for our first time facing this scenario, I must say once again, thank you. Thank you. As far as your off-island residential services, I know that the previous speaker mentioned the processing of the payment, but as far as Virgin Islanders, how many Virgin Islanders are currently receiving off-island residential services based on what we're paying out?
Deputy Commissioner Renan Steele, are you available to answer that question? Give me 1 second, I'll get back to that. And if he doesn't, then it's in the report.
Good morning, Senator.
Okay.
May you repeat the question, please? Deputy Commissioner Steele.
How many Virgin Islanders are currently receiving off-island residential services? The previous speaker made mention of the processing of payments. So I just want to understand for what we're paying, how many Virgin Islanders are benefiting from these services?
We have 35 residents off-island, and 20 of that 35 is forensic.
And as far as the individual who is working with the Department of Health, who is the liaison to make sure that those individuals have a contact person, and we're making sure that not all of their needs might be met, but we're making sure that we're trying our very best?
I'll start to answer that, and then DCC can come in. But I just want to say that I'm very proud with our system that we have in behavioral health. We do have some case managers, and they're the ones who keep in contact with them on a monthly basis. We also have to provide reports to our courts, and so we've been working very closely with our family courts and Judge Gallivan, and so the reports are being handled, and our case managers are doing an awesome job.
And based on our FY 2023 budget, how many case managers do we have?
Right now, DC Steele, can you answer that, or DC Jean-Baptiste?
Yes, currently we have 4 case managers operating. We just added one for St. Thomas District.
Thank you for providing that information. And I know you made mention that with the processing of the payment, there were some issues with the documents. Is that the first time we had an issue of that nature?
No, I would say that the GVI has a system that ensures that all updated documents as well as the business license is intact prior to getting the contract. We have a lot of vendors that don't have those documentation in place, and so we want to make sure that once we get into a contract agreement with them, everything is there, and sometimes that is delayed because some of the vendors don't have those documents readily available.
Thank you for breaking that down, and I hope we go back and watch our lessons learned to make sure that this don't happen, because when you watch the amount of money or funds that are owed to these companies is in the millions. 2 million, 4 million, $2.9 million.
May I clarify? The documents that are missing are not the documents that are missing from the Department of Health or Property Procurement. It's that the vendors themselves have not kept their documents up to date. So in order for us to go into agreement with them, we have to make sure that their documents are where they're supposed to be, that they have their business license, that they have their corporate documents, and they're able to provide that to us prior to contractual arrangements.
Totally understand where you're coming from. I just want to make sure that before we enter into those agreements, like you made mention, based on lessons learned, that we hold these individuals accountable initially, so we don't have to be in these situations.
2 minutes.
And I see that you have 3 vacant positions for community outreach worker. Is it hard to get a community outreach worker? What are the qualifications?
I'll have DC Jean-Baptiste take that one.
Thank you, Commissioner. Senator, they have not had to come by. We have actually onboarded quite a few under our disparities grant. The 3 vacancies you're seeing there, they're not actually 3 vacancies at this point. We have 1 outstanding under our behavioral health program for St. John, and just one that's going through the process now to close our disparities. So the community outreach workers you're seeing, they're vacant. They're not truly vacant at this point.
Thank you for placing that on the record. We want to make sure we have our community outreach workers out there. And as far as your employer contributions for retirement, they're current?
Go ahead.
Yes, we are current.
Okay, awesome. Good thing to know that. And I see where your revenue report, you don't really have much coming in for substance abuse and medical records. Have we been able to find out why? Is that always a trend when it comes to those 2 sections?
Yes, that's always the trend.
Okay, just want to make sure. I want to find out what's going on with those low numbers. And as far as your chief legal counsel position is vacant, who do you currently rely on for legal counsel? Based on the post-audit report, it says you have a chief legal counsel vacant position.
We actually have hired, and the date of the numbers that were presented to the post-audit report probably predated the hiring of our chief legal counsel. She's actually on the call with us. Her name is Attorney Jones, and she's on the call with us.
And when did she came on board?
March 1st.
Okay. Thank you for placing that on the record. And I saw where there's a 2005 Chevy 3500 van that is in poor condition. What is that van used for, and what are we doing to replace that van?
I would turn that over to Assistant Commissioner Ruben Malloy, to be more specific.
Good morning, everyone. Ruben Malloy, Assistant Commissioner. What's the van you're referring to? Which number?
A 2005 Chevy 3500 van that is in poor condition. I just want to know what is the purpose of that van, and what are we doing to replace that van? Is that used for critical services, or? Yes, no?
No. I'm not sure exactly what that van is used for. but we have reduced our fleet for the number of vehicles over 6 years old. So that van may have already been turned over to property and procurement for all. But I will validate that information and get back to you.
Mr. Chair, with your indulgence, just this one last question is regarding behavioral health.
Proceed.
I see where in FY 2023 you're recommending approximately $400,000 for behavioral health mobile staff support. And I don't want to say, I'm happy to know that we had the mobile vans, we had the ribbon cutting ceremony, but if I'm not mistaken, I think the governor said, I think we made a mistake or something along that line when it came to purchasing those vehicles or something like that.
No mistakes in purchasing those vehicles.
Something was online, it was on his Facebook.
You don't believe everything you read on Facebook.
All right, so lastly, as we speak about behavioral health, we know we have $3 million for Anna's Hope. It sounds like they're trying to downsize it, or you're asking for more money. What's going on there?
Oh, no. In reference to Anna's Hope right now, what we're asking for, and Senator Francis can also speak to this, we actually had that area assessed, and the building on that area cannot be renovated. So we actually have to break down that building. So the money is still there. The $3 million has not been touched, but we would need further funding in order to really expand the facility into something that we really need, which is more so transitional care. Right now, we're struggling with forensics since we have so many forensic patients, and it is an issue here in the territory. So we're trying to figure out the best way and source of what we do with that funding.
In closing, please let us make it happen. I've been an employee of the senator who has been pushing for that, along with the colleagues of the 31st and 32nd legislature. And just yesterday, I was driving at the stoplight, and I saw a young man that I went to school with, naked, as he bond, just swinging his stuff left and right. Let's get this thing up and running so we can take care of our young men and women, because there's a lot of people I went to school with who are walking these streets, and it really hurts me. So please, let's get it up and running. Thank you, Mr. Chair, for
If I may?
Yes,
I think it's important to note a couple different things. We are going to actually be here tomorrow in terms of the behavioral bill, and we'll be discussing that. But it's important for the general public to know that there are individuals out there that don't always see themselves. They are not a threat to themselves or to others. And so they have to be managed in a completely different way. Put them into a home isn't necessarily the best thing for them at that point in time. So we try to link them with our wraparound or operational services in the Department of Health, outpatient, and that's where our community outreach workers are so important, and our crisis intervention team. So we try to do a little bit more. DC Steele is on the line. He could explain a little bit more. And of course, Dr. Sims is here as well. So, but putting them in a home isn't always the best. And I just really wanted to make that point.
Thank you so much. And that's why we bought the behavioral health vans, so that we could all go out and provide the service to them on the street. I mean, it's not necessarily you want to put them in a home, but we just want to be able to provide them with service. So definitely somebody that's outside with no clothes on, there is an issue, and that somebody would want to target and provide them some service.
When we're called or when we see, we do respond to that as well. DC Steele can speak about the use of the vans as well.
Okay, now let's go back to the Anna's Hope so we could just clear it up. Exactly what do you want the Senate to do? You want the language to change, that it says that you could utilize the $3 million for demolishment,
primarily it's for the architectural and design of the place right now, for the A&E, as well as the demolition of the area. It's not going to cover the rebuild, which, $3 million.
We want to know what's the rebuild. We want to get it done. So what is the total cost of A&E, demolition, and bill?
And the rebuild. So we're looking about $30 million. So I would say about $35 million. $35 million.
And what's the interim plan if we don't have the $35 million now? What's the interim plan?
Well, yeah, I will be speaking about that tomorrow a little bit as well. Okay. We've had initial conversations with VI Finance Authority and see if we can actually put in an application for that. So we're looking at other options.
That's years out. So we're looking for something that's more immediate. I know that in your testimony you said that the 12-person unit, that was there at Anna's Hope to renovate would take 700 and something thousand, 765,000. They're saying now that that's no longer a possibility?
It's no longer an option because we had Public Works came in. They didn't have the specialist to be able to really do anything with it, but the determination was made, and DCC can speak to this. It's not in a way that we can use it as a modern day behavioral health facility. That's why it needs to be torn down.
DC Steel?
Yes, Senator.
Can you expound on that?
Yes, when we had the Anna's Hope property assessed, like Commissioner said, the cost of replacement exceeded because it would be more than the 50% of the replacement cost based on renovation. So it was not appropriate to renovate the building as such, as well as it did not meet the square footage and space it needed for the number of beds to be able to place behavioral patients there and have it accredited.
Okay, so stop there 1 second. We know that it's not sufficient beds. We clearly understood that, but this was just a start. It's not the end line, and we were trying to see whether or not there's a possibility of just starting.
But it's not just the beds, it's the way that the structure is built. And so the recommendation was for us to demolish and actually rebuild so that we can actually have a place that is more suitable for behavioral health at this time.
Okay, well, that sounds like 5-6 years out, and the legislature really looking for a solution that's going to be within 12 months. We got to see whether or not we can look at other areas that might be a possibility. Have we looked at Charles H. Emmanuel School? The possible retrofit of that facility, that's easily 40 rooms plus. It's large classrooms. I don't know if we could do plumbing and restroom.
We're supposed to be having a summit, a behavioral health court summit, but in that we are also starting a coalition. The 34th legislature would be part of that. The Senate president came to the summit as well. So I think that is local community members will be a part, and I think that's some of the decision makings that need to come out of that from a strategic perspective. So I'm hoping to have that back on the board after the hearings in August, September. We should be coming together to meet.
Well, point of information, and you're next, anyhow. Then we proceed.
Thank you very much, Mr. Chair. Good morning. Good morning to everyone. In respect to the Anna's Hope site, of course, we've been bantering back and forth the best approach to the Anna's Hope site, and the commission is correct that, in fact, they were making some recommendation in respect to demolish and moving forward. I gave my approval back in February, albeit verbal, and yesterday I had a conversation with the commissioner as well, where we'll be putting that, and you'll have it in writing today, so that we could move that forward. But there's also an alternative site that we're looking at in the meantime, which was the Golden Grove site, to at least be able to support and getting something in place as a temporary until such time as we could move in the more structured development of an institution. So that's being considered. There's a location over at Golden Grove that we believe that could be retrofit and expeditiously to be able to address at least our immediate needs. So it's one of those issues that we continue to talk back and forth. It changes quite often as well. But tomorrow we'll be having extensive discussion regarding behavioral health and comprehensive reform, as well as some immediate needs that need to be rolled out so that we could be able to meet the needs of our community. Thank you.
And now you're recognized for your minutes.
Thank you very much, Mr. Chair. Good morning to you. Good morning to my colleagues. Good morning to the Department of Health. I too want to join the Commissioner in thanking the rank and file, the leadership executive team as well for the work that they've been doing in regards to keeping us safe during the pandemic. It's outstanding. I believe that our community is beneficial to the hard work of Department of Health, and certainly is commendable. Please make sure that you send that message out to the rank and file as well, because it's important that we continue to encourage them to do their part. So today we're here to discuss the budget, and I know that there's a lot of federal monies that's flowing around, and I think it's critical that we're able to really move the needle in respect to how do we utilize that funding to make us a better community. I wanted to ask the issue of the gift cards, though. What is the real barriers, impediments in being able to get the gift card as promised? It was an incentive program that was used to encourage individuals to immunize and get vaccinated. So what is the real issue that we have not been able to meet that mandate?
Honestly, communication was one of them, but we think we overcame that. But we needed to do a reconciliation of our numbers. It's federal funds that's being used, so the reconciliation took place, and now the funds are going to be dispersed to the Department of Finance so that they can be purchased. Once they're purchased and in our hands, we will then let the general public know that they can come and receive the cards.
Is there a timeline? Because I think it's critical that if we're promising and we encourage people to do this, that we don't want to seem wishy-washy. Because the next time around, they'll be very discouraged. This was an incentive for individuals to be vaccinated. Do we have a timeline that has been established to execute?
We contacted Department of Finance, and they're going to be getting back to us by Monday to let us know, and then we will. Because what we've been doing is we've been sending press releases out, letting them know that we apologize and that we, as soon as we get them. So once we get them, we will. Even if it says in 2 weeks we'll be getting them, I think the general public needs to know. So we haven't gotten that yet, but as soon as we do, we'll let the general public know.
Commissioner, I live in this community, and I don't want to belabor the issue, but I'll tell you that there's a lot of pessimism in our community as a result of that, and we really need to close the loop on that. But I'll move forward.
Thank you.
Who in your department is ultimately responsible for monitoring and tracking your key performance indicators, the KPIs?
Well, all of the directors are, in terms of the responsible party, that's Dr. Nicole Craggle-Sims.
And Dr. Sims, how are you continue to monitor the KPIs? Because it's critical. KPIs drive accountability. Whether it's for the purpose of budgeting or efficiency of Department of Health. So how are you monitoring that?
Thank you, Senator. Dr. Nicole Cragwell-Sims, Assistant Commissioner, Department of Health. We worked extensively with the Office of Management and Budget to begin that KPI process. For me, on a monthly basis, the directors are responsible for tracking or putting data into sheets that were built for each of their areas. We're moving to outcome-based budgeting as well as tracking of performance. So for 30 days each period, we touch base with directors to find out how they're tracking and where they're tracking. The tracking system has gone from quarterly to monthly. And so if you look at the sheet at the bottom, you may see 10 in some area, 20 in some areas. Those are monthly tracking numbers. And at the end of the year, the calendar year, those numbers are compared to the targets identified.
Okay, very well. Thank you for that. Continue to monitor those because, again, it speaks to efficiency and accountability.
2 minutes.
So real quickly, how's the morale at Department of Health?
It depends on the day, to be honest with you.
Today's Thursday. How is it today?
Well, I hope good. But I think that one of the things that having to do with the delay in how we're looking at our buildings. So when we have, for example, the WIC buildings in St. Thomas is coming on quite well. We know we're having some struggles with the modulars here in St. Croix. And so it depends. So we try to balance that. I have to say that our CFO, Tatia Monel, she does an awesome job along with Joan Jean-Baptiste, as well as with Renee Justa. And in St. Thomas, we have others individuals who really do the legwork and really keeping our staff happy. And the communication is important. So general staff meetings are definitely there. And we have been having very successful general staff meetings virtually, where we have over 200 people, sometimes closer to 300 people attend, and they're able to express their feelings. I think it's important for us to allow, and also to share, because I think it's important for the general staff to know what they're feeling, we're feeling too. We are no separate from them. When we're in a building and the building is sick, it's not only the staff that's feeling the sickness, the leadership feels it as well. I'm wheezing now. I never wheezed in my life. So you see what I'm saying? It's okay for them to know that we're human beings just like they are, but also to say thank you to them.
Very well, thank you. And in respect to remediation of the mold situation in these modulars, and what is there any funding set aside in this budget to accomplish that?
We have funding set aside for the 2 months coming, and so we're in the process right now. We have 3 leases that we are going to be signing off on. So we're hoping that by early next month, which is next week, that we could begin moving into some of those buildings. MCH is working with another company, but we want to make sure that they're secure. And then when that company is finished, for them to move in, because it's going to take about 3-4 months. We can't wait 3 to 4 months. So we're hoping to be moving in shortly.
Time.
Thank you. And I wanted to quickly ask you about the ARPA funds as well as the CARES Act. I know that there was a tremendous amount of money earmarked for the Department of Health in regards to ARPA. What is being done with that funding? What is the game plan to expend that funding?
I just had a conversation with Director O'Neill last evening. Some of our ARPA funds have been used for staffing, or a large amount of our ARPA funds have been used for funding. We've had some units like Dr. Ellis has had direct ARPA funding to her unit, and that's been used for testing, supplies, and she could speak to all of that has been used with that as well. I know that a large amount have been looked for behavioral health, but it's not infrastructure, because that was the first question that I asked, can we use it for behavioral health infrastructure? And it can be, but it's for services, so we need to figure out exactly how we're going to be using those, but we can't hire staff with it, and we cannot use it for building a building. That would be really nice. So those are kind of things, but Dr. Ellis can speak a little bit more about what we've used the ARPA funding for.
Yeah, Dr. Esther Ellis, Territorial Epidemiologist. The ARPA funding we used for the majority for back-to-school testing. So we did back-to-school testing in order to safely open schools and tested all staff, faculty, students prior to reopening schools, and then again after spring break to ensure that schools started after spring break safely and to keep the schools open. We did testing as needed. We had a couple of schools that did have COVID outbreaks, and so we would respond to the outbreak at the particular school and set up a pop-up drive-through at that school as needed.
Very well. Thank you.
There's one more, I think it's important. Can you speak to the IT collaboration with VitalStats? Yes, so the new grant, or so we also have a new workforce development grant that we are applying for. We'll be applying for it next week, and that actually allows us to hire individuals. It's a 5-year cooperative agreement. We don't know what we're going to get yet, but potentially about $1 million a year for hiring staff, whether it's IT related or it could be staffing for clinical care, as well as epidemiologists or data analysts. A lot of what we're doing is trying to bring our technology up to where other partners, other stateside partners are, as far as electronic exchange of data and healthcare data, and a repository for all of that. And I know you know that I've been working over the past decade to really improve our electronic health exchange so that we get electronic lab reports automatically into our database from both hospitals, all the 2 federally qualified healthcare centers, and private providers.
Thank you. Thank you very much, Mr. Chair, for the leniency. I just want to conclude by stating that they have a best kept secret over there, the laboratory. And I didn't hear much about that today, but I have a resolution really to commend the epidemiology as well as the lab in terms of all of the work that they have been able to do during this pandemic season. So kudos again, and thank you very much for all that you do. Mr. Chair, thank you for the time.
Thank you, Senator Francis. In reference to your budget, I'm seeing that your general fund budget decreases for personnel by some 2.4 million. Is that going to impact vacancies?
That is due to the transfer of EMS to fire. That's why it was reduced.
Okay, and the same for French then?
Yes.
And the other services and charges?
Other service and charges was reduced because due to our budget ceiling, we had to transfer some of the off-island costs to our indirect budget.
To which budget?
Indirect cost budget.
What are your actuals now for other services and charges?
The actuals for off-island care,
For FY22, as of whether it's June or the bulk of those monies are off island
yeah,
care,
the bulk
right?
of the general fund.
Other
funds-
services and charge are spent on off island care.
Yes.
Okay, what's the present?
So the total for off-island care for the general fund is $6.3 million.
Thus far.
Yes.
Okay, so you're going to be pretty tight by cutting to 7.8, because 6.3 and we still have
So
what, 3 more months?
Yeah, I think we projected over $7 million
Yes, we
for.
projected over 7.8.
So you projected 7.8 for off-island care for fiscal year 23.
Yes.
Okay, so then what you have here would leave you with nothing for other services and charge, nothing else but off-island care.
Yeah, basically. Most of it is for behavioral health for off-island care.
But you have additional needs.
The other needs for the other programs are, we use our health revolving fund. So most of those other programs, their other expenditures are paid through the health revolving fund.
Okay. Your vendors, your off-island vendors, are the contracts current?
Can you repeat that, please?
Your off-island vendors, Hogar, Larkin, Liberty Place, St. Elizabeth, do we have current contracts with those entities?
I will defer that question to Derice Holly.
And I'm referring to all of the residential care facilities. Give me an update as to whether or not we have current contract with those entities. You can start with Correct Care.
I'm not sure if Ms. Hartley's on the line. We can get that information from you. I can tell you that we've been going back and forth and ensuring that but we've started the contractual process with them several months ago, I would say close to a year. But it goes back to making sure that they have their corporate agreements, and not all of them have been able to submit it. But I can't tell you exactly for which ones we are. We actually just signed a contract recently. DC Steel, can you speak to the contract that was just completed? That was for off-island care?
Yes, the contract that was just executed was Devereaux, Pennsylvania.
Devereaux in Pennsylvania.
Okay. And you have here payment and process. You have some outstanding obligations. Payment and process meaning what?
Payment process meaning whether is actually in the department for approval or at property and procurement for approval, the justification letters, because of the amount of the payment, a justification letter is required. So, sometimes we're pending that at property and procurement, and sometimes payment in process means that it's at the Department of Finance to be executed, for the checks to be issued.
Okay, so I'm going to give you a little bit, and then I'm going to come back to page 17 of 35, and I will ask you directly for the status of all of those payment and process that are going down. You can tell me if it's in procurement, if it's in finance, exactly where it is. Senator Gittins, you're recognized.
Thank you, Mr. Chair, and good morning to all.
Morning.
Commissioner, thank you for your in-depth testimony. And let me also thank you and the team for at least closing out one of your vendor payments. I was looking at the post-audit report and looking through for some vendors that I know that were behind in their payments. So thank you. I was told that one of them was totally taken care of 2 weeks ago. I wish that this would happen all the time. I hope that y'all don't wait until the budget process, though, because these folks said that they've been waiting like 2 years. However, staying on the vendor payments, I see that you have about 12 vendors outlined in the post-audit report. Are those totaling some 1.5 million? Are those the only vendors that are owed at this time?
No, we have more vendors owed. The information in the post-audit report, most of those vendors are paid already. We just have 3 of them that is pending payment.
How many more, besides the 12 that appears in the post-audit report, how many more are owed? How many entities?
$24.
24. And how close are we to paying them? Are those 24 paid from federal or local funds?
Those are paid from both federal and local, and we have some are being paid today, because today is a check run, some next week, so they're in different stages of the payment process.
So I'm concerned, and thank you, Commissioner, for you and your team for your work on the fire EMS merger. But I'm very concerned about our ambulance service and maintaining the nurses. We do have a shortage here, and so I'm concerned about that. What about the payments to Pafford?
The payments to Pafford? Well, I can, Tatia, Manel, you can speak to you about what the last payment was. We are attempting to keep up with our monthly payments. Can you speak to that, please, and where we are?
That's exactly what I want to hear. How are you keeping up? We should be able to stay on top of these payments. What's going on with this?
So the Padford payment, the monthly payment, we are actually up to date. Of the last payment, which is outstanding, which is June, this is actually, we got a purchase order, it's actually entered, and so we're within the 30 days mark for payment. The only thing that we have outstanding right now is the surge payment, which is still going through the process with Ernest & Young.
Are you certain about that? Because I'm told it's somewhere in the ballpark figure of 17 million from last August.
That's the surge payment. Our regular monthly payment, we're up to date, but the surge payment, we're outstanding.
So
2 minutes.
What is it going to take to get up to date with the surge payments?
Well, currently, Ernest & Young is reviewing the documents, the documents, so they call it observation. They had a couple observation, and they're reviewing the documents that were submitted, and once that is completed, Vitima and Ernest & Young will give us the red light to go ahead and process the payment. We already have the funding is already allocated.
Slow down for me. So are we ready once they give the green light to proceed? Because we're talking 1 year ago.
Yes, so we have the purchase order. We have the purchase order. The payment is already entered in the system. It's just pending in Vitima's queue once the observation is completed and we get the green light.
And it don't take nothing for somebody to approve something that's in the queue. So that shouldn't take another month, another 2 months, or 12 months. Yes. So the premium pay, have you provided all necessary information to the Office of Management and Budget for your employees for premium pay?
DC Jean-Baptiste will be able to take that question.
Thank you, Commissioner. Joan Jean-Baptiste again here. Every document was submitted to the Division of Personnel right on time. That was the action that was requested, and then...
Okay, I don't want the long drag-on ones. So every document was submitted For how many employees we're talking about? How many are affected?
I will have to get that for you.
And when you say every document have been submitted, you're talking about even for individuals making over $70,000 a year?
We followed, in collaboration with our finance department, we followed the criteria as outlined through the communication that was sent to us by the Division of Personnel. So to your question, we followed the criteria and we submitted accordingly.
So the answer is
Commissioner.
yes?
Yes, Commissioner. Yes.
Thank you so much. You see, time gone. That's why all I want is some direct answers. Yes, they were submitted. I want to make sure that those of you that's been on the front line get this money. That's why the monies were sent here to the Territorial, and we need to ensure that everyone, from doctor to nurse to whoever, gets their money. I don't care how much money you're making. You're entitled to that money, and all we need to do is justify the payment. So I'm checking with every entity to make sure that you have submitted those. Mr. Chair, may I close with one more?
Proceed.
The vacancies. Last time you were here for budget hearing, we spoke about the vacancies in, I believe it's your environmental health division with the inspectors. You had a number of inspectors that were just on contract or temporary. And there was talks that you were making them permanent. Have any of those temporary or contractual employees been made permanent at this time?
DC Jean-Baptiste?
Okay. So we have, and I know you want a yes or no, but I need to say this. I'm sorry, Senator, this way.
This
So-
one you could explain.
Okay. Thank you for the opportunity. All right. So we do still have 5 environmental health staff on our CDC Foundation, being paid through CDC Foundation. We do have currently, as we speak, 2 positions posted on the DOP website, to which it should be closing any day now so that we could go ahead and interview to fill those. So that's where we are with filling vacancies.
So no promotions from within? No one that's there on contract have applied to these vacancies?
Yes, sir. It's not closed out yet on the DOP website. As soon as they close out, the process is they'll send us an eligibility listing, and those persons, once they applied, and they know that it's posted because yours truly actually told people it was posted as well.
And do you
my team.
prioritize in-house?
That would be, once we post it as GVI, giving the focus to GVI or internal only, yes, sir.
Okay. Mr. Chair, one real last one. The EMS C partnership grant under the federal grants.
That stays with us.
What's the status of that? And what's the acronym EMSC?
It's a Child Emergency Services Grant. Our Jackie Greenwich's Payne is on the call. She manages that grant, and so it stays with us. So Jackie, Ms. Greenwich.
Okay, so I just wanted to make this
It
grant
stays
is
with us.
staying with you.
Correct.
And not being transferred. Okay. Thank you so much. Thank you, Mr. Chair.
Thank you so
for the
much,
leniency.
Senator Gittens. Ms. Greenwich is with DOH or with fire?
She's staying with DOH, and right now she's our acting director of EMS Regulatory and Health.
Okay. So for the other acting positions that she had before when she was with DOH, is there any compensation there? Was she acting before?
We can speak about her compensation. DC Jean-Baptiste, you want to speak to that?
Yes.
Thank you, Senator. So we did, and I know this is not a yes, it's yes, almost there, but we did a thorough analysis of Ms. Greenwich Payne's compensation stemming from several years because she acted in several capacities
Correct.
historically. So to date, we have analyzed it through, in collaboration with finance, and the documents are being transmitted over to OMB.
I just wanted to know that you're doing it. So
Yes,
that's good.
yes.
You're working on it to make
Yes.
sure that the acting positions that she held before, that's what I wanted to know, that is taking place.
Yes.
Now, your chief legal counsel, Marquise Taylor Jones,
Yes.
she is working directly with Department of Health or through the AG
She's-
office?
No, she is working directly with the Department of Health.
And is that the vacancy that you have listed
Yes.
in
so,
the budget?
I'm sorry.
So you need this vacancy funded at 100% because it's funded at 50%.
Correct.
Okay, so that increase your personnel by 57,000. Are there any other positions that are listed here as vacant that you have been able to fill and would need to convert to 100%? And you could give me that after.
Senator, I would like for all of them really to be funded at 100%. We're a healthcare facility, and we're already lagging the market as far as competitive salaries as it is.
In terms of being able to find bodies to fill the position,
Trust me, we are going continue. I'm not going to say going. We are continuing to embark on a rigorous recruitment strategy
to find bodies.
to find bodies. And if I may say for the record, just to really, really emphasize, COVID has heightened public health, and with that, we're seeing a lot of Virgin Islanders who have degrees in psychology, sociology, tapping at our doors, and I want to take advantage of that. I know in the listing for the post auditor, you see some vacancies, but trust me, especially on the behavioral health, our pipeline is not stopping.
Okay, so
People-
you're going to define to me which of those positions you believe that you can have on board for October 1st,
Okay.
so that we can make an adjustment.
Okay, so
And I think I also have a recommendation of somebody to you that's in that particular area.
Okay.
But we need to, if we could find them now, especially the staffing for the behavioral health vans, 'cause that's the plan, right?
yes.
Yeah.
Yes.
Well, we can actually speak to that. I think we actually have everyone for that in the pipeline right now. So we're almost
Because
full.
I need to know if any of those in the pipeline are here as vacant, so that we can convert that to 100%.
Correct, Senator. All the behavioral health selectees are already moving through the pipeline for the mobile van. We actually have completed like 5 of them, and the others are being selected. Well, they're selected literally. So
Okay.
we're closing that
How
one
many-
out as well.
how many needs to be
that's very good
shifted?
news.
We have 5. I'm sorry, Senator.
No, so that's very good news. So last question before I go to Senator Joseph. Do you have any positions that are federally funded that are temporary and that particular grant is ready to expire? Or is going to expire within FY23?
We have that in our immunization grant. Not 2023, actually would have been expired, but we got an extension, and we have all the PRFs ready to process, so we should be able to provide those, not really it's really for increase in salaries is really what we're
Okay.
looking at, but I don't think we have
So
anything else.
they were on the federal budget
They're on the federal budget.
and they remaining on the federal budget?
Correct.
Okay. And you had some other staff for COVID and so
We
forth?
have some staff that's in the CDC Foundation grant, foundation contract, and we've shifted them over. They have extended us, and they're going to supplement that for the next year.
Okay, so you're good. I just want to make sure that nobody's going to be terminated and we need those individuals.
Okay, so can we make a better determination and get back to you on that,
Sure,
please?
you can. No problem. Senator Joseph, you're recognized.
Thank you so kindly, Mr. Chairman. A pleasant good day to you, members of the Finance Committee, the testifiers, the viewing and listening audience. I am not a member of the Finance Committee, but I realize that this is one of the most important responsibilities of a senator, so I make the time to be here. I want to first begin by commending you, Commissioner Encarnacion, as well as your hard-working staff for the great job you did. You did a very bang-up job with handling the COVID. And also, I want to say kudos to your environmental health persons. I had the opportunity to accompany the Department of Health on their walkthrough with various agencies for the opening of the schools, and I must let you know that your one Lone Ranger environmental health personnel was there throughout. It had like fire, they were switching. They had inspectors who came to relieve, but your one environmental health personnel was there from the beginning to the end. And so I really want to commend you and your team on that. And I'm looking forward to seeing that report and the condition, because I had some questions. I'm not too confident that the schools are in a position to open based on what I saw. But, you know, we have some days and hopefully that can be addressed. Now let's go quickly to the budget area. I'm going to focus most of my questions on the federal funding. I know one of my colleagues in the St. Thomas district did ask some questions regarding the grant funding area, but I wanted to ask you questions pertaining to, let's go to page 6 of 35, and if your grants manager could speak to me about the indirect cost, and do you have an indirect cost rate?
CFO Hewitt, can you please take that? If you need to refer
Yes, we
to-
do have an indirect cost rate that recently.
Not too long. He's very strict with me, the chairman.
Okay.
I don't have all the leeway that everybody does. Kindly indicate the indirect cost rate.
So indirect cost rate is 19.8.
And do you have an in-place cost allocation plan? What you said, 19.8?
Correct. And based on the rate, we're able to collect $2.8 million on the grants that the department is awarded.
Okay. And do you use any of those funding to, because I know I saw some personnel costs. There were monies allocated to personnel costs. Have you been using any of those funds to go to personnel services, et cetera? Because no.
No, we do not use, we do not fund any personnel under the indirect costs.
And what that funding is used for?
It's used for utilities, and currently for FY23, we also will be using it for to assist with off-island care.
Okay, so let's go to off-island care, because I did take some copious notes when you indicated you spend, and you're projecting to spend about $7.6 million. $6 million, so that's what the funding is used for. Some of that, 2.8 million. And so you have how many persons in off-island care? Total about 35. So we're spending about $228,000 per person per year.
2 minutes.
Regarding this funding. So that's fine. And so do you have a cost allocation plan? That's my next thing. And when was this indirect cost rate granted?
Early this year, but
okay, okay, that's fine. Yes, it's current. Okay, and now, do you have your audit reports? Are they in place already? If you've completed your audit, when was the last audit you had?
well, currently I know GVI is going through a single audit right now for FY 2021.
Okay. So you're going through that with GVI. Okay, let's talk about the premium pay. A previous senator from the St. Croix district asked about that, and you indicated, Ms. Jean-Baptiste, that you had submitted all of the documents, and you mentioned timely. Have you been in conversations with OMB and Finance relative to when they will be dispersing those checks?
No, Senator.
You don't follow up on behalf of your teammates, because they've been working hard in the trenches and above, and I would suspect they have also spoken to you, asking you when that is going to occur. So you have not followed up with OMB nor Finance?
Senator, if I may, the process, Division of Personnel is driving the process. We're part of the central government, as everyone is aware, and we follow the mandates through the division.
The mandates told you not to follow up?
No, No, Senator. With all
The mandate said you shouldn't follow up with them and ask them for your colleagues.
Senator, after submission, I actually spoke with Division of Personnel myself, even though I know a communication was sent to all of GVI indicating those who did not submit and those who did submit.
I am just asking about the communication between you, Ms. Jean-Baptiste, and the individuals who cut the check and make it happen for our employees. Did you follow up? I think when you're human resources, you're supposed to be able to follow up.
And we do. We talk with OMB several times a day.
So,
But regarding the
Mr. Chairman, so have they given you a time frame when they're going to be issuing the checks?
Senator, that's Division of Personnel indicated, and again, I have to lean to Division of Personnel, if I may. In August is when the checks are supposed to be out. So that's why I focused on that Division of Personnel piece, because they drive the process in this case. So it wasn't a Department of Health.
I understand clearly, but I'm just saying, so you are aware that you're human resources and you have your colleagues, and they really deserve that level of service and follow-up, especially because they acted with valor coming out in the pandemic.
Senator. If you want to ask the next question, you can ask a question. But
you want me? I can ask the next question.
Yeah, I was saying though.
Okay, thank you kindly. Thank you kindly. Thank you kindly, Mr. Chairman. Now, I wanted to also ask about your maternal child health care services. How much funding do you have in that division, and are you meeting your grant requirements under that division?
Thank you, Senator. Go ahead, you may respond.
Okay, I'm actually going to have Director Myers. Dr. Myers, can you please answer that question?
Good morning. Dr. Charmaine Myers, Maternal Child Health Division Director. So currently we have about a little over $8 million in the Maternal Child Health Division, and we are meeting our annual requirements that the grants, for all of our grants.
Thank you so much. A short conclusion. You may proceed.
It's not.
Yes,
Hello. Oh, thank you kindly. Okay, thank you so much, Mr. Chairman, for allowing me to ask those questions. Again, I want to commend the team at the Department of Health for the Herculean job that you're doing so well. Thank you kindly, Mr. Chairman.
Thank you, Senator Joseph. In reference to the premium pay, the department just submitting the information. After that, it's out of their hands. It's a submission of information. And then OMB, finance personnel, they're the ones that process this stuff. So I ain't gonna be no fast or slow, it's up to them as to which agencies or government entities they're going to designate as first in that particular cycle. Senator DeGraff, you're recognized.
Thank you, Mr. Chair. Good morning, colleagues. Good morning, testifiers. All viewing, listening, and present. Commissioner, to you and your team, your department, I stand in 100% support of you guys. Thank you for all you do, and continue doing what you're doing. Now, straight off to personnel. Have any of your personnel received wage increases in the past fiscal year?
Yes, they have. DC Chairman, please.
Yes. Good afternoon. Senator, yes, we have inputted and implemented salary increases for both Seafarers International and USW. We have an amount of approximately 17 persons that have not, we're not finished with their process. Full transparency here. We had to do several miscellaneous actions in order to be able to bring them current. And so my team is working diligently to complete EPAD, NOPAs, and miscellaneous corrections to have them made whole.
I thank you very much for the transparency. And what type of time frame would they be made whole by next pay period, next month? You have a time frame?
Okay, so I literally charge my team to get it completed by next week. As soon as they're finished implementation, then it moves over to the finance side of things. So I cannot say categorically that they will be receiving that next week because it will be fully in the system by next week. So we gather it will be after that for those persons.
Okay, great. And finally, make sure you inform those employees so they can be aware. You have any GS employees?
Yes, we do. We have our human resources team is on that schedule.
Okay, good. So you are budgeted for the 23 budget for that increase in 23?
I do not believe that was included in the 2023. It's the salary increases for the GS schedule. Those in HR are on the GS schedule.
That was not included, but OMB stated that any salary increases that were not included in 2023 budget, during budget wrap-up, they will include it. Well, we're going to inform them of the total amount, and they will gladly include it in the wrap-up.
Okay, what is the total amount and how many employees will be affected?
Senator, if I may, Joan Baptiste, it's not a large group. It's my team in HR. So we're talking about 3 persons specifically. And I could have the amount to you. I don't have it right now, but I could get that to you rather quickly.
Yeah, please. And again, 1 person not being paid what's owed to them is too much. So 3, that's a lot. But I need to get a number before the day is out.
Will do.
Commissioner, the facilities you're working on the St. Thomas end, give me an update on those facilities and what type of capital outlay would be needed to, because I heard you mention that you're wheezing. That's not good. To come from a health commissioner that you're wheezing tells me that the facilities are bad. So again, what is the status of the facilities for the employees? All of them.
So what we're speaking in particular about is the St. Croix modulars and the way that they were built and looking at where they are in our geographic location. But I will have DC Malloy, and I also have Rosalinda Brown. I don't know if she's on, DC Malloy, to give a more clear indication of what we're doing with the facilities in St. Thomas.
2 minutes.
Correct. Okay, good. The short version, please.
Of course. AC Malloy, sorry.
Thank you, Commissioner. Good afternoon, Ruben Malloy, Assistant Commissioner. The locations on St. Thomas, in the yard, Newt Hansen, and Robert Moorhead Yard are FEMA projects. Those projects are in various stages of obligation, most of which are obligated, most of them recently. We have a project for the clinical build-out, old mental health building, interior repairs. That's about $640,482.55. We have another project that repairs for environmental health building, other buildings. That's around $3 million. That was obligated June 29th. We have another project building, HIT building and vital records. That was obligated on 4/12/2022 for $1,037,392.79. We have Eldridge Schulterbrand projects. The Eldridge Schulterbrand project for the annex prudent replacement was denied. We're appealing that decision, FEMA's decision. We have the Board of Nurse Licensure building that was obligated on June 27th, $3,066,555. And on St. John, we have the Morris Castro, which was also denied for prudent replacement, but we are also repealing that. And I will let our who leads our budget.
Excuse me, because again,
Time.
my time is running. If I could get that information. Okay, Mr. Chair, I have just some wrap-up questions. How many ambulances do we have on the St. Thomas St. John district? How many in St. Thomas, how many in St. John that are operational?
80, Evelyn would be able to answer that, but just to let you know, all of the information you're requesting is in the end of the report for the new build-outs, okay? So you can look at that there. But 80, Evelyn can give you the ambulance update.
Okay, but
Okay, thank you,
before we have an answer, I just want to make sure that the ambulances are no longer under Department of Health. So that's really the fire service question. It's not even, Mr. Evelyn really shouldn't be even here testifying because he's a fire service employee and not a Department of Health employee. So, but proceed.
Mr. Chair, I agree with you, but I saw it in the post-auditor's report in regards to ambulances still under the Department of Health. That's what I was wondering about.
Okay.
In regards to that.
Just to let you know.
But again, okay, so if you want to leave that, I could follow up with fire. I have no problem with that. So in terms of just wrapping up, how many persons have retired, and are you current with the monies into GERS, and do you have any terminations? And you can answer in the chair's time. Thank you for the time, Mr. Chair.
I'm also going to have you repeat that, so I apologize. I didn't hear your question.
Resignation, termination, retirees.
Oh, okay. We have a list of those.
Right.
Senator John Baptiste again. We had a total of 26 resignations and 11 retirees. That was the second part to your question. I'm not sure if I heard that correctly.
Yes, I just GERS payments current, employee and employee.
CFO Hewitt, is the GRS payments current?
Yes.
Senator, you heard the answer?
She said it yes. I didn't hear.
Yes, they are current.
Yeah, yes was a.
So for clarity, it was 26 terminations and 11 retirements.
Yes, Senator John Baptiste again. Yes.
Not terminations.
Not terminations, separation. So 26 resignations and 11 retirements.
Okay, you could just elaborate on how those numbers, but the chair, thank you for the time, Mr. Chair. I won't abuse it.
Thank you so much. Did you conduct exit surveys?
We did for some, Senator. Not for all.
Why not for all? You were not able to?
Some of the resignations, we got it after the fact. Some went through the divisions and the persons were long gone. And some people, when we tried to reach out to them, even while they're gone, they just don't want to go through that. But most people who were in-house, we did.
And what was the main reason?
For the retirees, they were resignations.
Separations,
not
retirees.
Separations, clearly the great resignation hit us the same way as it did the mainland. Some persons, the age group, looking at the age group that resigned, again, some of it had to do with competitive salaries. And just all the rewards, the full package.
What was the age group that resigned?
Mostly between the late 20s up to the 30-something.
Okay, thank you so much.
Yes.
Senator Fred Gregory, you're recognized.
Thank you, Mr. Chair, and good morning, or good afternoon, rather, to the Department of Health Family, and good afternoon to my colleagues, and good afternoon to the listening and viewing audience. I guess it's 10 minutes till 12, so it's still morning. Now, so I think we've exhausted most of the budget questions, so I'm going to ask some operational questions. Commissioner, in 2020, the legislature passed Act number 8369, specifically trying to ensure that we are able to conduct behavioral health screening for our children, prenatal, postpartum care, etc., prenatal and postpartum care. And I know that there was some work that the Department of Health was supposed to do to ensure that this is happening throughout the territory. So I am trying to establish from you, find out from you, what's the status of putting the policies in place to ensure that this Act A369 is actually enacted.
I know we received some reports in terms of policy. I would refer to DC Steele to see if I haven't signed up, to be honest with you. But DC Steele, can you please speak to that?
Okay, my time is running, so I'm going to go to the
Deputy
next one.
Commissioner Steele, that would be MCH program.
Okay, so my time is running, so I'm
get
gonna
back to
I'm
you.
gonna ask that be answered on the chair's time.
Thank you.
Also, Act 8187, FY calendar year 2019, there was some $3,082,000 appropriated to the Department of Health for mental health programs. What's the status of those funds? Have we exhausted all of those dollars?
One of those
No, Deputy
programs.
Commissioner Steele, that's all clubhouse funding. And I'm sorry, Commissioner.
Continue,
we have
sir.
I'm not hearing you.
expended our funds. Can you hear me?
I can't hear you.
Can you get closer to the
Can you
device?
hear me now?
Get closer to the device.
Okay, can you hear me clearly?
Yes, I can now.
Okay, yes, of that funding, we still have 1.9 million remaining, and that's allocated with our clubhouse services.
Through the chair, can the Department of Health please submit to the legislature the use of those funds and the status of the outstanding amounts? This has been since 2019. We are now in 2022. Thank you. And going back to, I still need to understand what's happening with Act 8369. This is an omnibus piece of legislation that was moved by one of my colleagues. It's an important piece of legislation. It's important that we understand what's happening with it at this particular time. Behavioral health, the behavioral health mobiles, are they in fact working to our satisfaction? What's the status?
DC Steele, can you speak to that, please, more specifically?
Yes. Deputy Commissioner Steele, the behavioral health mobile vans have been being utilized specifically in the March through June months. We primarily focused a lot on the school services, which served 676 students in that time frame. We send the school closures. We've also utilized the services for outreach in the community, and we've also utilized it with our services with VIPD, with the having tea with the cops and so forth. So those vans are being.
Okay, I'm having a hard time hearing you. So would you say on a scale of 1 to 10 that the behavioral health mobiles are in fact effective?
Yes, the vans are effective, and we're onboarding the staff. We hired 5 staff members specifically for the vans to be a dedicated outreach staff for that as well.
Perfect, thank you. Thank you for your response. Now, let's talk about the possibilities of other vans, other health prevention vans. Commissioner, is there any consideration to seek funding or additional federal dollars or local dollars to secure vans to go out in the neighborhoods to provide health services to women in particular, men as well, for mammograms, diabetes screening, etc.? Because we know that we have an underserved community.
So I thank you for that question, Senator. I think that one of the things we can do is look at the workforce grant that is available right now. A lot of it is for infrastructure. So we can look to seek grant funding for that main reason. Community health workers is something that we have now implemented. I know years ago we're now bringing them back. And so those are the ones who are going to be going into. So in other words, we're looking at community members who live in the same community, working with the people that they live around and being able to provide the assistance you're talking about.
Thank you for that response. I see that there's a lot of, healthy habits, et cetera, that, we're promoting, but we really, really need to bring back community health. And that brings me to I think earlier this year, one of my colleagues brought the legislation around the fluoridation program in our schools that used to be in our schools when I was a youngster. What are we doing to bring that back, to at minimum bring back some sort of dental services in our schools?
So we've started that fluoridization program. Over 400 and I think 480 students in the report, but our Dr. Myers would be able to speak to you with that. There's a collaboration between education and health to get that done.
Okay, so is it happening now, or
it is happening currently?
Working towards it
Correct.
happening because it's very important.
Yes, it is currently happening.
Time.
It's happening. Oh boy. Okay, Mr. Chair, Act 8369, I would really like for that to be answered. This was a legislation that we discussed. It was held. This is the legislation that had the corporal punishment in it. It was held, and we did some additional work, and we were able to move it forward. And I think behavioral health screening of our children is important, and health care for the incarcerated women and men is also critical, and prenatal and postpartum care is critical. We need to provide these services if we are going to continue to talk about promoting healthy habits in our community and ensuring that we address the issues that we have in the Virgin Islands around gun violence. It's all connected. So I would really like to know what's happening with 8369.
Chair, if I may.
Good morning.
Just 1 second, and Dr. Myers, in terms of 8369, what we're going to do is go back and write a complete report rather than trying to break it down. I think that's the best thing for us to do right now. Dr. Myers.
So you will provide a full report and
Yes.
implementation of Act 8369.
Is it okay for Dr. Myers to give a report? Okay.
Yes.
Yeah, so through the chair, I would like to get ask that a report be sent. And I too also want to lend my voice by commending the Department of Health for the work that they've been doing in the community. They've really held it down for us. They've kept us safe. So Commissioner Encarnacion and your team, I really want to congratulate you. It's not a perfect world. This is not a perfect environment. However, you've done your due. So thank you.
Thank you.
Thank you, Senator Fred Gregory. In reference, I know that we recently gave some money to some nonprofits, the group for dialysis and the 1.9 for diabetes screening. Who monitors as to what is taking place, especially with the diabetes screening? Who's monitoring how many individuals they're seeing on a regular basis? What is the outreach? How does a program look? Because I haven't really heard anybody go into a particular site or getting any information.
We have the regulatory authority to monitor who we need to monitor. So that I will say that we have not been in there. It's something that we can do, and we can report back as to what the numbers. I know that they have a diabetic drive this weekend, so we can begin with that as well and let you know ongoing what's going on with them.
What was the thinking behind not putting out an RFP for this particular program? Because I know like Fredericton Health Center does a lot of outreach services, and they provide a great job to this community. What was the thinking about going to a new nonprofit instead of opening it up to existing nonprofits on the island?
I can answer your question in particular. I can say that the Fredericton Health Care, they get a lot of opportunities from a HRSA perspective for grant funding. So a lot of nonprofits don't. So if you look at that perspective, from a financial responsibility, you don't have that access to federal funds as a federally qualified health center would.
Okay, no, but back to the surge payments. I know, Ms. Monell, you said, Hewitt, you said that, how long has it been a disaster recovery? How long has all the completed documents been in disaster recovery?
The completed document as of June 24th.
Okay, but for last year, because I know we owe them from August of last year. When was that? August, September, October, November, December. When were last year documents submitted? Just June? Or were they submitted before?
No, they were submitted before. and they had observations, and those documents were submitted again, and the last set of documents was submitted June 24th.
I can also speak to that. One of the processes we have, of course, we have Ernst & Young, who really vet our projects prior to going to FEMA. One of the things that they provided to us is that we wanted to make sure that every fund that we were getting from FEMA, that we don't have to pay back. We realized that there are some audits that we needed to complete, so we had to complete those audits, redo some of the work that we did, just to make sure that we had all our documentation in place so we don't have to pay those monies back. So it took us a little bit to get that done. One surge grant was paid out, so we have the other one pending. It usually takes about 45 days when it goes through the process, so we're hoping that once that 45 days are over, we can just press a button because we have our documentation prepared for the surge grant the surge funding to be paid.
Okay, so right now it's like 30 days since we've submitted it to ODR.
Correct, so we're waiting for a response back to them. They said 45 days, that hasn't gotten here yet. So we're hoping that once it's over, then we can, and like CFO, you would have already said, we're ready to press the button whenever we're giving the okay.
And I'm just trying to get a button pressed because it's been
Understood.
it's been 1 year and we're not in a good place in terms of health care and the possibility of losing access to health care because every jurisdiction literally are utilizing some type of traveling nurses or traveling medical staff. So it's 17 million, and that's a lot of money for a company to go without for exactly 1 year. So I'm hoping, I guess I'll try to get in contact with Ms. Williams Actaline to see exactly.
We'll do the same thing, sir.
What is the hold up there? We, as of June 30th, we went from 100% reimbursement to 90% for PAFN?
90-10, yes.
90-10. Is the 10 included in this budget?
No, that is prior to, so that's 100%.
Okay.
We don't have, it's zero cash share.
So come October 1st, where are you getting the 10 from?
Okay, so we've spoken with the governor and OMB, and the 10 will be coming from the ARPA funding.
Okay. ARPA going on quick. We see 48 million yesterday for WAPA. They don't have 60-something million. So, and what is the estimated 10?
For
DOH, for the traveling nurses and all of that?
Well, let me just say one of the things that we're doing is we're collaborating with hospitals, right? Because a lot of the funding, a lot of the nurses or clinical staff work in the hospital. So we're doing a couple things. The hospitals will be going into their own PWs and be able to use the funds that they just received to pay for their own.
So part of the 10 million that they just received,
will go
they have
towards,
to earmark 10% for...
Which they've all agreed that it's a lot less than paying for a company to come in to provide.
I agree. I just right? So what is the 10%? What does it look like for the hospital?
For the hospitals, it'd probably be around 200,000 versus,
okay,
like 2 million. So it's a lot better for them.
Okay, and that is the same for the dialysis center?
No, the center will stay with us. BOC will stay with us, Department of Human Services, and Fire, because EMS is now in Fire. And I needed to...
Well, what I'm asking is the dialysis center would have to come up with their 10.
10%,
okay.
Correct.
But they would stay under DOH?
Yes.
Okay, and BOC?
Correct, and Department of Human Services as well.
Okay.
And Senator, if I may, I know that we have Assistant Director Light Evening with us, but I didn't think that we should completely ignore a whole year of EMS working with health. And so that's why I really wanted him here as well.
Okay,
I thought that was
I understand the justification,
okay,
but it's gone from So
okay, good.
We can see the transition of the ambulances and everything else as to how that is going to work out. They have submitted a plan, the integration plan to the legislature, so I'm sure that the chair of that particular committee will be holding a meeting so that we can get an update as to exactly how things are progressing. And then we'll have some more discussion at that point about the emergency services fund and the percentage and all of that, so we can. The chair of the committee, Senator Noble Francis, sir. At this time, I am going to allow one question, because we're not doing a second round. Just one question, because we have the Board of Nurse Licensure up next. So one question beginning with Senator Francis.
Thank you very much, Mr. Chair. I want to conclude or ask if the commissioner could just quickly touch on the Charles Howard demolition plan and what's happening at Charles Howard. I know that there's some plans over the weekend coming up in respect to that, but if she could just give the cliffhanger version of what's intended for the Charles Howard.
Okay, real quickly, we have completed the external architectural and design process at this point in time. We're looking at more the internal process that has to do with the services that are available. So we now have a conversation with the community that we're calling it from 2 to 4 p.m. on the 30th, which is Saturday, inviting everyone to come, especially the areas that are going to be affected right around Charles Howard, how we're looking at the demolition, what we're going to do to protect them as the demolition takes place. We have to move the areas, for example, laboratory that you spoke about, that has to be moved from that site as well as the vehicles that are around there. So those are the other things that we're working on. For more details, it's actually in the document itself, but if you need any more information, we could get that to you.
Very well. And real quickly, I got a text in respect to supervisors in the department not receiving their negotiated salary increases thus far, which was due back in October of last year. What's happening with that?
I will ask DC Jean-Baptiste to speak to that.
Thank you for that question, Senator. We do have, and again, I'm going to put the word full transparency here. We do have some supervisors that have not realized the increases. I did give the previous senator a general overview. We are working through those. Again, if I may, I know I'm going to call a name. Jackie Greenwich Payne would be one of those, because again, we had to do an analysis, for example, on her, requiring several actions before we could get to the point of implementation for her. So just to give you an example of what's happening, we do have a few supervisors that's pending that we've been working on. But for the most part, we're just about 90% complete with our implementation for the unions.
Okay, so that question is definitely going to come back around again. So we'll actually in a month and see what is the status in reference to that particular question. Senator Gittins.
Thank you, Mr. Chair. I hope the answer don't be the same in 1 month. But I had an opportunity to look at the website, both DOH and Division of Personnel, and I don't see any postings for environmental health inspectors.
Okay.
And it just so happened that I left out of here quickly to go sign some documents and saw like 4 of them in one car. What's going on with this?
Okay, I could speak to the posting. I don't know about
Yeah,
in
tell
the
me
car.
about the posting first.
Okay, so regarding the posting, remember I said there were 2 positions posted, and once that 2-week period is out, you will not see it on the website again. So it may have closed maybe as early as yesterday. Again, I did not check the posting as of yesterday or today. If that vacancy closes, you will not see it. That means an eligibility listing will be then sent to my team for us to go ahead and continue the process.
But I'm
so I believe that's where we're at.
I'm not understanding if you have folks in there that's on contract, that's trying to get on permanent for how long. Why don't they have this information?
Why don't they have the information of the posting?
Yeah, so that they too can apply.
The post, Senator, it was communicated, and I don't want to call specific names because we do have some folks that's been transitioned that I personally, I don't want to put their name on the record here, that I personally went to them. One of them was a transfer, I could say that for the record. One was a transfer from another agency. I personally went to that person and indicated to the person, I shall not mention the sex, It's now posted. Go ahead and apply. And we
Okay.
also have on the island of St. Thomas persons as well who made calls and asked.
So you and I could talk about that offline
Sure.
before you leave the building.
Definitely.
Can someone respond to me about now seeing 4 of them in one car? Because I'm not understanding. I was happy to hear the other day that y'all were actually out there inspecting restaurants, even citing and shutting down a major one and whatnot. I like to see work being done. But for me to just see 4 of them in one car, I don't know if they're linemen. I don't know if there's not enough vehicles for them to go around. But this is an 84 square mile island with a lot of businesses to be inspected. And to see 4 of them in one car, what can you tell me about that?
Well, you did say something. We don't have enough vehicles, so that's something we're working on. But Director Watson Harris, if
With
you
how
want,
much Teslas and how much Acuras
so you're
and
really,
everything?
really, really going to go there.
Yes, we really gonna go there. Yes. This is what the
so-
community is seeing.
Okay, so what I'm going to do is I'm going to focus on environmental health.
Right.
And Director Harris, if you're on the call, I can't say what they're doing. I know that because we have limited vehicles, they do gather and they may be dropped off. But Director Harris, if you're on the call, if you can speak to if there's any activities that we should be aware of.
Okay, thank you, Senator.
Thank
Sir.
you, Mr. Chair.
Director, you may answer.
Good afternoon, Winston Harris, Director of Environmental Health. Can you hear me?
Yes, go ahead.
Hello, can you hear me?
We can hear you. Go ahead.
Winston Harris, Director of Environmental Health for the Virgin Islands Department of Health. So we have inspectors that actually work in teams of 2. Sometimes they will work in teams of 4 based on the type of establishment they have to inspect major establishments. I could tell you today we have one of the vehicles for the
He's frozen. I think we're having an issue there. Okay, let's.
I've asked him to text me, and when he gets me the information, I could give it to you.
Okay, not a problem. Thank you so much. Point of inquiry, Senator Francis. Recognize Senator Francis, Mike, please.
Thank you very much, Mr. Chair. I just really quickly wanted to ask Commissioner Encarnacion, what is your role in the sarcasm issue that has confronted us as a possible public health concern?
I'm actually one of the lead ESF that attends the meeting. Our Ovid Williams, who is our Director of Preparedness, he is also part of it. Shanna O'Reilly is now acting as our PIO. And she also is attending. We did a press release, sent out a press release yesterday, and I'm very clear indicating that anything that has to do with water has to do with health. And so I've asked that we are included in every aspect of it, and we have been.
Are you aware that individuals are complaining of headaches associated with the sarcasm? Is that one of the symptoms?
Headaches, nausea, skin irritation. We've also included the hospitals because it's not just health, public health. We've included both CEOs of the hospital so that they can report any incidents coming into the ED. Yesterday, we sent a press release out, and the press release didn't focus on just emergency care. We wanted them to contact us or contact the emergency room. So even mild symptoms can be tracked because that piece is important as well.
Thank you so much. You're sending a testimony, and we'll finish in just a few minutes. You're sending a testimony that you're fixing the nurse licensure building on St. Thomas.
Correct.
After it's fixed, it's going to go back to the nurse licensure?
Since the VI Board of Nurse Licensure is still on the auspices of the Department of Health, we met with them clarifying that and said that yes, of course, they will. It would be offered to them once it's fixed. And then, of course, we'll be meeting with them on an ongoing basis so that they know exactly what's going on.
So on the PNP, the building is under DOH or under the nurse licensure?
No, it's under DOH.
It's under DOH. Okay. And that's going to change after?
No, it's going to stay. I know that the financial responsibilities are now under, they have their
They
own
have their
financial
own, yes.
responsibility, but besides that, they work under the auspices of the Department of Health in terms of regulation. And right now, we met with them, asked if there was any issues with that. They still would like to see one change, and that is the certifying officer be placed under the Board of Nurse License. And
That's Miss, what's her name? The person?
the executive director.
No, the certifying officer.
The certifying officer is for the Department of Health, since they're still formally still under the auspices of the Department of Health. The certifying officer is still our chief financial officer. However, they're asking for the board, which really and truly there is no oversight or no regulation if they sign off on the information that they're needed or the finances that they needed. So we checked with finance to see if that was even an option. And right now, Tatia Manel Hewitt can speak to that because I queried as well.
What I'm going to do is I'm going to ask for the chair of the Health and Hospital Committee, Senator Noble Francis, to be able to convene a meeting with DOH and Nurse Licensure so that we can just make sure that everything is set, see whether or not we need any additional legislation, et cetera, so that we can be able to clearly make sure that we have a path moving forward. In reference to the travel nurses, do we have a clear path for licensure with the Board of Nurse Licensure? Have we worked that out? Because I know there've been some back and forth, and we can have a...
It's not travel nurses per se. It's temporary versus
Temporary nurse,
permanent.
okay.
Right, temporary versus permanent nurses and license. And so our Nurse Practice Act clearly indicates if you submit all of your documents to the Board of Nurse Licensure.
Okay, so stop there. We don't have a meeting. Cause
Okay.
we're going to meet. I've asked the chair. I know he said that he wants to meet, and we'll have the discussion because we want to have a clear path moving forward.
So do we.
For both entities. So we will. Senator Joseph, you have any question? One question?
Thank you so much, Mr. Chairman. I just wanted to follow up with a question relative to the step increases. I know it was mentioned before by one of my colleagues from the St. Thomas, St. John district. How far are we as far as getting those step increases in place for those unionized workers?
We, Senator Jones Baptiste again, we are very close. As I indicated prior, we had a few employees who their actions required several actions, to include some historical analysis to be able to bring them up current and bring them up current, the right way. So yes,
Okay, so
we're hoping to get finished with all of that, and I'm going to be rigorous with this one. I've charged my team to do it. So by next week, we're hoping to finish all the EPAD NOPAs and get that into the system.
Okay, thank you so much.
Thanks. That's why I was just looking for a direct answer. So it could have been 2 words next week.
Yeah,
And we're good to go. Senator DeGraff,
thank you.
you have a question? Senator DeGraff.
One, two, thank you. One, two, thank you. Can you hear me now?
Yes, we can.
The one question I had in regards to the separations, were any of those separations, or how many of those separations were from during the time with the issue with vaccines, whether they were being vaccinated or not? And have you reached out to those individuals? If so, to see what the status is? Were any from the vaccines is the question.
You didn't have a mandate.
No, we don't have a vaccine policy at the Department of Health. Is that the question that he's asking? Oh.
Correct. In regards to the separation.
Oh, not due to
If
vaccines.
any of it was because they weren't being
and they
vaccinated.
and they were not terminations. And so that would be more, if we had a vaccine mandate, they would either leave voluntarily or we would have to terminate them if we had the mandate, but we don't.
Okay. Thank you. Thank you, Mr. Chair.
Thank you so much, Senator DeGraff. Senator Fred Gregory, last question.
Thank you, Mr. Chair. Very quickly, Commissioner, I know sometime back in April, you guys were offering some $250 for individuals who got, is it either boosted or who got the first dose of the vaccine. I'm getting calls indicating that some individuals did not receive their 250. Is there a plan to issue those outstanding amounts to those individuals who participated?
Yes, Senator. Reconciliation had to be done. It was completed. We're now waiting for finance is going to purchase a card. Once we have them in our hands, we will submit a press release letting everyone know when and where they can pick it up. I don't have.
Do you have a timeline around that?
I don't have a timeline. We are going to call on Monday morning and to receive an update. We called this week, but we'll call on Monday to see if there's a new update for us, and then we'll send out the press release.
Perfect. Thank you. Thank you, Mr. Chair.
Thank you. Thank you, Senator Fred Gregory. Commissioner, I'm going to give you an opportunity to put a closing statement on the record.
Well, honestly, Senators, I want to thank you really and truly for giving us the opportunity. I know we had a long report to you, but I thought it was important because our directors work really hard. And despite the COVID pandemic, the things that they have done is outside of COVID. And I really wanted the general public to know the Department of Health is so much more than what we've done to COVID. So we are appreciative of really and truly the appreciation that we get for what we've done, but it's also been our goal to ensure that we are not only focusing on infectious disease, but we're focusing on the daily chronic disease issues, as well as, for example, a new grant for now assessing cancer and breast health in women. I'm asking for them to include men as well. So we're doing so much, and I really want to take the opportunity to thank the staff of the Department of Health. Well, first of all, thank for everyone to coming on the call and being available to answer the questions that were posed here today, especially our CFO and her team, and of course, DC Jean-Baptiste and her team. And we're all there. Of course, Dr. Sims is always at my side, supporting. So Dr. Sims, I thank you, thank you, thank you. And of course, we have our new Assistant Commissioner, Ruben Malloy, who's there with us as well. So really and truly, I think that just a thank you to the community for supporting, because we couldn't do it if the community wasn't there doing it with us. So thank you, Senator.
Thank you so much. You said new Assistant Commissioner?
He was just promoted.
Okay. All right, thank you. Thank you to the Department of Health and the staff that came to support the Commissioner in her testimony. We thank you for answering our questions, and we are going to break for 3 minutes and bring the Board of Nurse Licensure up next. This committee stands in recess for 3 minutes. The Committee of Finance is back on the record. Next before us, we have the Board of Nurse Licensure. I am going to give you an opportunity to put your name and title on the record, beginning with Ms. Vanterpool. Okay, pull the mic down to you. Down. Okay.
It's on?
Yes.
Okay. Carmen Vanterpool-Romney, Territorial Executive Director, Virgin Islands Board of Nurse Licensure.
Next.
Commissione, Treasurer for the Virgin Islands Board of Nurse Licensure.
Next.
Tanisha Penn, Chair for Virgin Islands Board of Nurse Licensure.
Now you're going to get closer to the mic for us.
Tanisha Penn, Chair, Virgin Islands Board of Nurse Licensure.
Next.
Dr. Brittany Dawson, Vice Chair of the Virgin Islands Board of Nurse Licensure.
Ms. Vanterpool, you may proceed with your testimony. You need a minute?
Senator, the chair, Ms. Penn, will be reading the testimony.
Ms. Penn, you may proceed with the testimony.
Okay. Thank you, Senator. Good afternoon, Senator Kurt Vierlake, Chair, Committee of Finance, members of the 34th Legislature, Office of the Commission of Health, members of the Virgin Islands Board of Nurse Licensure, the listening and viewing audiences. Thank you for the opportunity to present the Virgin Islands Board of Nurse Licensure 2023 budget. I am Tanisha Penn, Chairperson for the Virgin Islands Board of Nurse Licensure. I'm joined by Dr. Dawson, Vice Chair, Executive Director, Mrs. Carmen Vanterpool-Romney, and Treasurer, Mrs. Commissione, and other members of the staff and board virtually. The following summary of activities will highlight the board's work for the past year and clarify our budget request for the fiscal year of 2023. About the Virgin Islands Board of Nurse Licensure, it was created by the Virgin Islands Legislature to promote public protection and safety through the regulations of nursing practice in the territory. To the board, it's fulfilling the purpose for which it was created. The board's duty is to ensure that we approve duly qualified, competent nurses to practice in the United States Virgin Islands. The board continues to have active membership in the National Council of State Boards of Nursing. Board members represent the territory at the National State Board of Nursing annual meetings and conferences. The board responsibility goal is to ensure that nursing practice and standards are established and maintained. Improvements of our rules and regulations must be continuous to maintain safe practices of nursing in our community. The VIBNL aims to protect and defend the people of the Virgin Islands from illegal and dangerous nursing practices, which is accomplished by a rigorous and comprehensive review process of all nurses applying for licensure. The board performs members through a vetting process. All schools of nursing, nursing assistant programs, and training providers, licenses and endorsement for applicants, advanced practice registered nurses, and licensed practical nurses. Applicants to become certified nursing assistants and nursing-related institutions and training providers to maintain ongoing competency in the field of nursing. The Virgin Islands Board of Nurse Licensure is governed by the Nurse Practice Act, in which standards of nursing care are clearly defined. The Nurse Practice Act specifies that the board consists of 9 members appointed to serve for 2 to 3 years by the governor. The VIBNL consists of 7 members. 5 members make a quorum. Our existing membership consists of 1 nurse anesthetist, 1 nurse midwife, 2 registered nurses of varied specialties, 2 licensed practical nurses, 1 community lay person. There are 2 vacant positions with the exit of our nurse educator 1 month ago. Recruitment is ongoing for the lay person from the island of St. Croix. VIBNL continues to have active membership, as stated before, both with the National Council of State Boards of Nursing and now the National Practitioner Healthcare Integrity and Protection Data Bank. These memberships certified automatic notification of discipline actions taken on professional nurses across the country. Our collaboration continues to be ongoing with communication with both hospitals, long and short-term outpatient facilities, all nursing agencies outside the territory, and initiatives to promote and enhance safe, quality nursing care in our community through effective regulations. The VIBNL has seen great improvements with credentialing initiatives of employers of nursing personnel, resulting in a shared responsibility of public protection. Our scope of practice. VIBNL clarifies scope of practice for all levels of the nursing personnel. This means that each level of nursing, advanced practice, registered nurses, licensed practical nurse, and nursing certified assistants are required to function within specific professional practice parameters. All registered nurses and licensed practical nurses who hold active licenses issued within the territory can be verified by quick conform process via the NCSBN Nurses database. This quick conform process can be accessed by the public, employers, and staffing agencies for free. The Nurses Quick Conform program assists in keeping the public, nursing boards, and other credentialing agencies informed of nurses' ability to provide ongoing safe, quality care to patients across the United States and its territories. The VIBNL is the only legal authorized entity to grant the privilege to practice nursing in the Virgin Islands. Any nurse practicing without the express authority of the board is practicing in violation of the Virgin Islands Code and the Nurse Practice Act, which may jeopardize his or her ability to practice nursing anywhere else in the United States. The board carries out its roles as described below. VIBNL assists with and clarifies the scope of practice. These settings include hospitals, schools, clinics, private and group practices, industries, prisons, universities, nursing homes, group and private homes, and other healthcare-related entities. We also carry out our roles by approving certain institutions, such as the University of the Virgin Islands School of Nursing, Raphael O. Whitley Skills Center for the Licensed Practical Nurse Program and the Nursing Assistant Program, Nursing Assistant Program in District 1, Life Skills Training Center, and Nursing Assistant Program in District 2, the Embro Institute. VIBNL also reviews schools of nursing curricula in the territory that prepare students for licensure, and therefore approve the schools which meet the requirements. VIBNL also established criteria for initial licensure and recertification. This year, for the year of 2022, there was a total of 49 initial licenses issued. We also completed a total of 800 registered nurses renewals for this year as well. VIBNL is the only certified body that approves continuing education providers and programs to enable licenses to maintain their certification. Presently, there are 2 pending applications to be approved to become continuing education providers. The VIBNL reviews all licenses from applicants of other districts and states who represent for licensure in the Virgin Islands. VIBNL protects the community by investigating all written complaints against a licensee or certificate holder and carries out the authorized action on his or her credential for any proven violations of the Nurse Practice Act. The VIBNL maintains a member of the National Council of State Board of Nursing. This membership enables graduates from nursing schools within our territory to be able to take the National Council Licensure Exam, which is the NCLEX, and the National Nurse Aid Assistant Program exam. For the year 2022, there were approximately 30 graduates from the University of the Virgin Islands. There were 3 practical nurses from the Raphael O. Whitley Skills Center and 30 nursing assistants from combined nursing assistant programs between St. Thomas, St. John, and St. Croix. We'd like to congratulate all the nursing graduates for the class of 2022 for all the nursing education programs. So we started with licensures. VIBNL licensed 3 types of licenses: advanced practical nurses, registered nurses, and the licensed practical nurses. VIBNL is also responsible for certification of the Certified Nursing Assistants Program. APRNs and RNs renew their licenses on the odd years, and the LPNs and CNAs renew their licenses on the even years. For the upcoming renewal period, we will be introducing the birthday system renewal. So ongoing orientation and information about this new change will be forthcoming to the community. So temporary permits. Since March 2020 to June 2022, there have been approximately 1,101 temporary permits, which include permits processed and repeated renewals on a day-to-day monthly request from private agencies, travel agencies, hospitals, and clinics. Despite our challenges, the board has completed these licenses under strenuous circumstances and difficult situation on a month-to-month and daily basis to the end of the emergency proclamation. At this time, I wish to send and extend my sincere thank yous to the staff of VIBNL, Ms. Celia Sebastian, Ms. Stacy Penn, Ms. Ailsie Hughes, Ms. Grace Warner, and our dearly departed staff member, Ms. Evelyn Sheila Phillip, who worked feverishly to manually process these documents and expeditiously as humanly possible. There are many major accomplishments VIBNL has done for the year 2022. We continue to maintain our nurses database with the assistance of NCSBN, where VIBNL can easily generate demographic and statistical reports on nursing practice in the territory. Completed input on all licensed advanced practice registered nurses in the territory for registry into the National Practitioner Data Bank. The National Practitioner Data Bank is a confidential information clearinghouse with a primarily goal of improving healthcare quality, protecting the public, and reducing healthcare fraud and abuse in the United States. This report on healthcare means that the board will have a tracking system for all our APRNs. To date, we have 100% of VIBNL nurses filed that has been updated into the Nurses Data Bank, and we continue to do this daily as more nurses apply for endorsements, approved, and is placed in the system. Onboarded 2 new members to the board that provided an 8 out of 9 membership. With the assistance of the Division of Personnel and the Executive Director, we were able to fill our very long vacant positions at the board. This hiring process was completed on April of 2022. We also like to afford the opportunity to extend our thanks to the Department of Human Services with the addition of our CSEP worker, Ms. Naomi Belerium, who have worked out extremely beneficial and assist the administrative needs of the office during this critical time. We also accomplished, with the assistance, the passage of Bill 34-0040 for the compact nurse licensure. Implementation of this bill has begun and will continue during this fiscal year. It is imperative that we mention that without the passing or completion of critical criminal background check, this implementation will not be completed. With the prudent help from the staff of Department of Property and Procurement, we're diligently working to secure a site for the St. Croix District to house the Board of Nursing. Our website was launched with the help of BIT. Nurses can now seek information or make contact with the Virgin Islands Board by visiting our website or sending emails. And this has done and has helped to achieve expedited responses from the board. We also now have a Facebook page. And again, we issued more than 101,000 temporary permits to nurses during the COVID pandemic. We did virtual meetings with the University of the Virgin Islands to discuss and collaborate on working with student nurses at the university to allow them other opportunities to work in the community prior to graduation. And finally, this was a long and tedious process. We're happy to announce that we finalized our online data system with Certami, and this is slated to be completed by August 2022, which means renewal applications for this period will take so via online. Now, the challenges that we faced for 2022. What is a board? A board is an organizational body of elected individuals acting as fiduciaries on behalf of an organization, shareholders, and stakeholders. The role of the board is to ensure that the purpose, mission, vision, and core values are defined and upheld. The board ensures that the organization has adequate, well-managed resources at its disposal to support executive team. VIBNL governs the licensure of nurses in the territory via the passage of the 1981 Nurse Practice Act, number 4666, Bill 140094, Section 415, Title 3, Virgin Islands Code, subsection Chapter 4, Powers and Duties, Bylaws, Rules, and Regulations. According to the bylaws for the VIBNL, the chair is a certifying officer. After Hurricanes Irma and Maria in September 2017, the board was faced with operational challenges as the chair and vice chair resided on the island of St. Croix. Hence, the then Commissioner of Health, Ms. Davis, made the decision to oversee the responsibilities of the board. These responsibilities included and was not limited to the following: nurse licensure approvals, contractual agreement approvals, notification of personal action documentation agreements, certification, authorization of financial responsibilities, administrative responsibilities, and so forth. After the expiration of term for the chair in 2019, the previous two chairs, nor myself, was not afforded the opportunity as the certifying officer for the BNL. Given the above situation, the board is being challenged despite several meetings and discussion as the now commissioner continues to exercise these functions as set by the previous commissioner. We are kindly requesting that the law be upheld as written in Title 27, subsection 93, and the bylaws, rules, and regulations of the board. VIBNL is seeking legislation to address the above concerns to ensure that we assert our responsibilities, roles, and fulfill authority to function independently. Our Conscience Gata property, since the hurricane of 2017, we were not able to participate or house in that area because of the destruction. But known light, we identified that as of November 25th, 2014, it was granted that the site was granted to the board, full care and custody, that was occupied by the VI legislature. So it means that as the custodian of that building, the board will be responsible for all daily maintenance, buildings, major renovations and improvements, and so forth. Our proposed goals for 2023: improve transparency with communication through marketing, promotion of ensuring a safe, consistent nursing care, continue collaborations in nursing education, practices, and outreach, improve on the utilization of effective technology, remove any barriers that interfere with the process of applications, implementation of the nurse practice licensure compact with the assistance of NCSBN, keep up to date with the NCSBN guidelines, policies, and changes, update our Nurse Practice Act rules and regulation bylaws, improve and adhere to the rules and policies to maintain compliance in nursing practice, form committees to help maintain full operation of the board, hiring an accountant, which will be at a territorial function, and a compliance officer for the District of St. Croix. The financial responsibilities: all fiscal activities are performed by the staff with assistance from Department of Health, Payroll, and Financial Services, property and procurement from the central government, processes and contracts for professional services, requisitions, and purchase orders, Department of Health, Department of Finance for financial processes of revenues and payables via the MUNIS system. Board fees such as licensure examinations, endorsements, certifications, renewal, educational providers, official verifications, penalty fees are remitted to the Department of Finance and deposited in the Nursing Licensure Revolving Fund. This fund was established by Act 46, Title 3 of the Virgin Islands Code and is administered by the Commissioner of Finance. VIBNL continues to use the MUNIS system for posting of deposits and processing of requisitions and payables. Reconciliation year-to-date reports offered on the MUNIS systems are done on a weekly basis for our internal records. With the passage of Bill number 34-00113, which provided for the board to be provided a direct funding for fiscal year 2022. It was necessary for the board to request a supplementary fund to hire an accountant. This bill is still awaiting approval from full body. Our general fund appropriation covers salaries, rental, maintenance, and machinery. We are currently up to date with our rentals and utility bills. In addition, we complete payments of all outstanding invoices as to date. VIBNL met with Department of Health, Financial Team, and Department of Finance earlier this year to begin the transition of fiscal responsibilities totally. However, this is still in progress as we were limited with staff and the resources needed to complete the transition. We have decreased spending from our general fund and increased spending down on our revolving fund. We were negatively affected with the collection of funds due to the pandemic, with our inability to place a fee on temporary permits issued by the board as per the executive supplemental order. To maintain the present level of our activities of VIBNL, our funding request for fiscal year 2023 is $5,810.10 from the general fund. This projected amount reflects salaries and fringe benefits of 6 full-time employees, property rentals, and other operating supplies. Reconciliation of the year-to-date reports offered on the MUNIS system are done on a weekly basis, as stated before, from our internal records. The board has utilized its revolving fund for most of its expenditures this year. VIBNL requests primarily that of employee salaries. The board has requested a supplementary budget of $312,344, which will cover new hires and raises for employees. This amount includes additional appropriation for an accountant and a compliance officer in the St. Croix district. We also have included rental fees, travel, and communication to this supplementary request. The Nurse Licensure Revolving Fund 6054 consists of fees from licenses, examinations, endorsements, certifications, renewal, and penalty fees that are remitted to the Department of Finance and deposited in the revolving fund. We are requesting a reimbursement of funds for our lost revenue during the pandemic, which was approximately $140,000, by issuing a total of 1,101 temporary licenses. Our supplementary request is not inclusive of this loss. The total of our funding request is $849,229.10. I would like to thank you for your attention and consideration of the Virgin Islands Board of Nurse Licensure request, and we await any questions or clarifications that you may have. Thank you.
Thank you, Ms. Penn, for your testimony. Colleagues, we're going to go directly into a 5-minute round, beginning with Senator James.
Good afternoon. Thank you, Mr. Chair, for the time. Good afternoon, testifiers. I see when it comes to your board members, I'm not sure if this is outdated when it comes to the post-audit report, but there's a vacant position for secretary and vice chairperson. Did we ever fill those vacancies?
Presently, we have a vice chair, Dr. Dawson, and we don't have a secretary at this point.
Okay, and any other candidates came before you for this position?
This is Dr. Dawson speaking. We do have a candidate, a current board member that is, for our next hearing next month, potentially going to be moving into the secretary role.
Okay, thank you. And you spoke about hiring an accountant. In the meantime, how do you go about addressing that void, not having an accountant? Who fills that position in the meantime?
Well, presently, right now, we have our office manager, Ms. Celia Sebastian. She does all the Munis EPR system expenditures and things of that nature for the office.
Okay, just want to make sure that the operation is smooth and everything is running as it needs to be functioning. And I saw where you mentioned Department of Property and Procurement is working to secure a site for the St. Croix District to house the Board of Nursing. I'm assuming that is a property that's already built and structured from the government of the Virgin Islands?
I'm going to defer that question to ED Vanterpool.
Carmen Vanterpool-Romney. The property that we're now looking at in St. Croix, yes, is already a structure, and we are going into negotiation. Property and Procurement spoke with the realty, and we are actually moving forward with that contract as we speak.
And currently, do you have a place where you operate out of? No?
In St. Croix, not currently. We have only one staff in St. Croix, and currently she works off-site.
The reason why I'm asking...
And coming to St. Thomas.
The reason why I'm asking that, I want to know by when will you get a finalization from Property and Procurement? Is that something we have to factor in this budget when it comes to a possible cost that you would have to pay for the utilization of this building?
Well, actually, we put that in our budget request for rental. That's in the budget request.
And that's an estimate, or you know for sure that would be the total amount?
That's an estimate of $45,000 that we put there, and we are actually working. It might be less. I know definitely it's going to be less than the $45,000.
Thank you. And I failed to mention in my opening, I want to say congratulations to the recent 2022 graduates. We had 30 graduates from the University of the Virgin Islands, 3 practical nurses from the Raphael Whitley Skills Center, and 30 nursing assistants from combined nursing assistant programs. So I just want to place that on the record. And as far as supplies and resources territorial-wide,
2 minutes.
Based on the budget, what I'm seeing here, you were able to factor in possible supplies for the St. Croix District Office?
Yes, sir. And most of the supplies, as we said, we are spending more on the revolving fund. To ease the general fund, we are utilizing that fund for supplies operating some of the operating costs.
Okay, thank you for placing that on the record. And any challenges you had with the FY 2022 budget? Any challenges you had as far as appropriations, not being able to get sufficient funding in any specific areas? And if so, in FY 2022, did you address that in the FY 2023 budget?
For the fiscal year 2022, we did not. Anything that was taken away, we actually used our revolving fund to make up that cost.
Okay, so the revolving fund is the savior of the day.
Yes.
Awesome. And as far as increases to funds that will go towards the revolving fund, can you think of any way where we'll be able to increase the amount that goes there based on, I guess that comes, where's the main source of revenues coming from the fund? That's for fees and license and what have you?
Correct, Senator.
So I'm assuming with these new graduates and those individuals who graduated, we're going to see an increase as well.
Right. That's why we actually rely heavily on our licensure and the renewal, which is the endorsement, renewals, fees, etc., to replenish that fund. If that fund is not replenished, then we have a great loss in the revolving fund.
And I'm not sure if this will be premature of us, but have you factored in, that's an estimate of with the new individuals coming on board, what expectations or projections we will see coming into the revolving fund with the new nurses, no?
Time.
It's not going to, it's not going to be that much of an increase. Where the board sees the increase is the renewal period for registered nurses, which in our renewal, that's always like maybe near 1,000, and that's when we really, the renewal year for registered nurses are higher. And this year with the CNA, certified nursing assistants, and the licensed practical nurses, we're gonna see a drop in our revenues.
Okay, it's a straightforward budget, and I know my colleagues will drill down somewhere. I don't want to abuse my time, but I really want to say we know for sure we need more nurses in the territory as far as recruiting and retention. It's very competitive right now. I know we had to do that last minute thing with Pafford, but I want to make sure the same way that we can take care of outside individuals who are helping the territory, that we can do the same for our local nurses. And of course, it's not going to happen overnight. But with conversations and collaboration between the executive branch and the legislative branch, we can do so. So thank you, Mr. Chair, for the time.
Thank you, Senator James. What's the renewal fee? What's the cost?
For the APRNs renewal / RNs, it's $150. The flat registered nurses are $125. The LPNs are
$100.
$100, and the CNAs are $75.
What's the average amount of LPNs and CNA?
The
I mean, you
average,
said we have like 1,000 renewals for RNs every 2 years?
no, it's 800.
800.
For the RN renewal period.
And LPN?
We only have a total of 16 LPNs.
16?
Yeah, 16.
Wow.
LPNs.
And CNAs?
64.
How are we functioning at the hospitals with only 64
Low.
CNAs territorially? I mean, that's just a question, but not a budget question, but how do we function with just 64? That's such an important role.
Well, actually, I wouldn't be able to answer how that, because that's institutional, but one of the problems that had was affecting the Virgin Islands was that of having nursing assistant schools, and we actually approved 3 of them last year. So that's why we had the increase in the numbers.
Good.
So currently what we are being played with is we do not have any licensed practical nurse, especially on the island of St. Croix. We are trying to see if someone out here, and I have spoken to one individual to see if they, or two, to see if they can begin a program of licensed practical nurses in St. Croix, the St. Croix district.
Okay, so all we have is the CNA classes in St. Croix?
Currently, yes.
Who's
And,
offering that?
That's Embryo, I think, that's Cindy, Ms. Joseph for Turning Point, and I also spoke to her to see if she could take on that role to at least have a LPN program in St. Croix, because we did understand that there was a great need for LPNs to cover your like nursing homes, to make it simple, like those centers in St. Croix instead of a registered nurse. But because you do not have a nursing school in St. Croix, that's actually, they're being at a loss.
Okay, and Turning Point, they're doing it for their program or overall?
Turning Point is doing it for overall. Anyone
Okay.
can attend their program, the
Do you
CNA
know,
program.
Do you know if it's supplemented by the Department of Labor?
I know, yes, it is. I know, based on what she told me, that they do take Department of Labor students.
Okay. Senator Francis, you recognize.
Thank you very much, Mr. Chair. Thank you very much for your testimony. Here, I just have a few questions. And yes, in fact, I think Turning Point, Ms. Joseph, is very much willing to assist in both the CNA program as well as the LPN program. One of the concerns for her, though, a lot of times that she's been challenged by her students is in respect to the certification. We want to make sure that once it's completed, that the certification will be timely. I'm sure that you know, I'm sure she's having discussion, and if you're directly involved in that with her, that in fact you'll come up with a measure by which we're able to see individuals moving towards certification.
Yes, both her, actually all the nursing assistant program. What happened this year, for the record, is Pearson View, who is the official testing center for the nursing, well, that's nursing in the continental US and the in the territories. They had a separation, but not separation. It's now with Credentia. So there was a change in testing site, not testing site, but testing, there was a change in the testing
Instrument?
agency that was going to administer the test. And Credentia, we had to come and make a new contract. And that contract, we have been trying to get it executed since February or about April, let me be fair, about April. And we are glad to say today, based on my last information, the last information received, it's now at Property and Procurement, and that's what caused that big delay in testing for the CNAs, or we would have had them actually already tested. Just for the record, the board, it's not our intention to delay testing, because in nursing, the quicker you take the exam after finishing the course, your chances of passing it are, it's greater. So what we have been looking into, and I have asked the programs if they will be willing to give those nurses a review. Now, the payment on that we haven't come up with yet, but those nurses will definitely need a review before they go and take that exam.
Very well. So at least you're close to the finish line and being able to get that contract executed and
Yes,
be able
thanks.
to do certification.
Right, thanks to the Department of Health OPCMR office.
Okay, very well. So we'll move on from there, but I think that there's some good opportunities. We have the interest in our community to do the CNA as well as the LPN, and it's just a matter of making sure that we get the certification done. So the initiative to start to utilize the birthday as one of the renewal of licensure is an initiative that the board had undertaken. Is that correct?
2 minutes.
Correct. We're doing it at the birthday period because the amount of licenses that comes in at the end of the year based on what rotation you're in, the RN or the LPN, it becomes overwhelming. So to ease the strain on the office, we have decided to change it to birthdays. So that initiative is going to take place with this renewal for the LPNs and CNAs. Even though your birthday might have passed, you still have the opportunity to have your license still expire at the end of the year. So with the next renewal period, which would be for the RNs, it's going to be 100% in full force.
I commend that initiative. I think it's a good one, and hopefully will streamline the process by which you're able to do that. In regards to your supplemental request, that was sent to who? To the administration, to OMB? You mentioned here about the $312,344 that you're asking for in a supplemental budget. Who was that sent to?
That budget was originally sent to OMB, but because of our ceiling, it could not be approved.
So it's just a wish list at this time. There is no real request in place for that.
Well, it's kind of a wish list, but we're hoping to.
But it's needed.
It's needed. It's needed.
Hear that? I'm not a member of this committee, but obviously, chair in the contemplation of the supplemental, I guess we will see the availability of this funding and certainly the use of it. In regards to the loss of revenues that you experienced of the $125,000, can you just explain what happened there? I'm very much aware because we have had this discussion already in regards to that loss, but what happened? What caused that $125,000 lapse?
Well, as stated before, with the initiation of the pandemic, there was a need for nurses. We were in a nursing staffage crisis. And the initiation of the executive supplement order stipulated that nurses come but cannot be charged a fee. So initially, based on our Nurse Practice Act, nurses can come. We provide a temporary permit. Once all their documents are placed and in the office, then we give them that $125 charge based on whatever role you're playing, LPN, RN, etc.
Time.
But because of that, because of what was stipulated in the supplementary order, we were not able to charge fees for those temporary permits. And
Okay.
like stated, it was
Sure.
over 1,000.
And in my discussion with the board, I did mention that we should probably, or you should attempt to write a letter to OMB or to the governor in respect to being given some credit or being reimbursed, in light of the pandemic and the availability of funds, that there was an opportunity for you to be able to get that $125,000 back. Have that been done?
This is Dr. Dawson speaking. So we were afforded the opportunity to meet with the governor's chief of staff and were able to communicate these requests from the board, but no further action has been taken at this time on or in regards to that. I also want to make a clarifying statement. In regards to the executive order, we were also never consulted on that nor the process when the Virgin Islands Code Nurse Practice Act would have allotted us the time and space to grant the 90-day permits and allowed us to function at a higher capacity. Because we are a very small office, the executive orders placed a large amount of strain on the staff that we currently have. So the monies requested are closer to $140,000 when we did our review of that. And that money would go towards the actual time, effort, and resources required to process those permits. Because every single 30 days, those permits had to be completely reprocessed.
No argument there with that. I think all of those are good talking points in order to encourage the reimbursement to be made in that respect. In terms of your operating budget, Mr. Chair, I'll just conclude here. Your request is for the $536,885.10. Is it your testimony that is somewhat inadequate to be able to run your operations, or it is in fact sufficient once you receive the supplemental?
That would be sufficient once we receive the supplemental. The 536,000 plus, it's only for salaries. And I think with that, we were even asked to cut some of our we had operating supplies, we were asked to remove it. So therefore, if we look at it closely, it's just salaries. And I think not even total if we have to rent out 2 sites. So we were asked to cut it to come down to our ceiling. So that's what we did. So it's strictly salaries and fringe benefits on that budget.
Okay. And Mr. Chair, if I could also ask that you allow them to answer in your time the utilization of effective technology in one of their performance goals for 2023. If they could just, again, further explain what type of technology they're looking forward to and how technology would make them a lot more effective and efficient.
Well, for the technology, once we go fully online with the application process, that will be easier for the applicants as well as the staff members. When it comes to Compact, and with training and education, the IT infrastructure changes, all of that will come under the technology initiatives once moving forward.
Thank you, Senator Francis. The 536 includes a position that's in the supplemental budget now?
No.
Yes.
It does?
Wait. The 530, the supplemental now includes the position for the accountant, because at that time we could not add it.
Okay, but does this 536 include?
No, it does not.
Okay, so it
The
does not.
536 does not. We
Okay.
were unable to add it.
Trying to remember what we funded that position at. I think it was, I'll get the information. But your supplemental includes that position.
Yes, Senator.
So then it's not a wish list,
Well,
because it's actually a position that we're trying to fund now in this fiscal year.
correct.
So you will need to continue to fund it in the next fiscal year, correct?
Correct.
Okay. And before 2-3 years ago, we had no staff in St. Croix, correct?
No.
So all licensure had to do what?
Go to St. Thomas.
By mail, by seaplane?
Whatever means
Because
necessary.
I've seen different avenues where you've been sent over in the seaplane and
Yes.
asked somebody to pick it up.
Whatever means was necessary, the applications were sent by that.
Okay, so the 400 nurses and St. Croix would have to submit the documentation to St. Thomas for renewal.
Correct.
And you decided that that was not a good practice.
No, no, not at all. I think if we're territorial, we should be represented in all the the 2 districts. So that's when this board decided we needed an office in St. Croix.
Okay, so your hiring of staff in St. Croix would enable what?
The hiring of staff in St. Croix is, because we have Ms. Joseph who's doing most of the work for St. Croix office. If there's anything that needs to be done in St. Croix, she's taken up. She is completing that task, including assisting with looking with the site, and she's also working with us.
So hold up. If I'm coming for renewal, I turn in the application. Well, I'm a new nurse coming. I turn in the application to Ms. Joseph.
If right now it's being mailed to St. Thomas because we don't have the actual physical site. As soon as we get that physical site, as I told Ms., we are no longer going to be.
That's what I wanted to put on the record. I'm trying to develop your justification as to your actions to the supplemental. So your action is to ensure that new nurses on the island of St. Croix would have a place to drop off the application and it'd be processed, etc. Or would it still have to go to St. Thomas?
This is Dr. Dawson speaking. So our justification for an additional site in St. Croix not only speaks to the licensure process. So we want to provide an avenue for not only new, but nurses coming into the territory to come to an actual physical site if they need help also with applications.
Correct.
And if there's requested documentation of urgency. Along with that, the board also regulates and supervises the practice of nursing. To do that effectively, we need a representation here to be able to regulate the hospitals and also do further research. We host our meetings solely in St. Thomas, so as a board member, I'm constantly going over. If need be, we've been able to utilize technology to be able to meet, but some of the things, including more sensitive topics, would be better off handled in person, including any kind of infringements on licensures, being able to hold those meetings on the island the nurse is there for, versus having to come back.
So hold
and
up 1
forth.
second.
Yeah.
So you do site, the Board of Nurse Licensure is supposed to do site visits?
Correct. Yes.
Okay, so you would be checking all of these medical entities to ensure that the nurses are duly licensed, etc.
Yes, Senator.
Okay, so we won't have to wait for CMS to come and point out that something was wrong, correct?
No. We should, once we are given the opportunity, yes, we will be doing all of that.
You seek to hire how many individuals on St. Croix?
Right now, I am requesting for a compliance officer in St. Croix and the accountant. We are hoping that that will be filled on St. Croix.
Okay, and you're in negotiation for a site, for a rental site.
Yes, Senator.
How close are you? Or does it depend on this budget?
Not really on this, not on the budget, because we had rental, we had requested some, so I am leaning towards that little bit that's left from last year's budget. Ms. Sebastian, could you answer that question in regards to how close we are being with the contract or with the findings?
Good afternoon, everyone.
Good afternoon.
In terms of the lease,
Okay, I don't think I allowed you to put your name and title on the record when we started. I think I just did. Who weren't here. So can you put your name and title on the record, please?
my name is Celia Sebastian. I'm the executive manager.
Okay. Now go ahead and answer.
The last time we met with property and procurement, we were in negotiations with Lockhart Realty, and we're in the process of, PMP is in the process of preparing the lease for us to sign off. We're not sure how close they are to finishing, but once they are finished, then we will be moving forward in starting, the work that needs to be done at the property.
So it needs to be built out?
Somewhat, yes.
Some of it.
Where are you getting the funds for that?
It was already appropriated in the budget we have now.
Okay. Before I go to Senator Gittins, you spoke about a contract. What is a contract for with the testing?
Oh, for
You
credential?
said you're waiting for a contract that's now in PMP.
Yes, that's the contract with Credential, which is the testing agency, like Pearson View, they
Okay,
test.
so you had a contract with Pearson first.
We had a contract with Pearson View first,
And
but the-
Credential purchased Pearson?
no, it appears as though based on my what was told to me, Pearson View, they just decided to separate. At first, every nurse went to Pearson View for testing or was tested through Pearson
And
View.
they decided to separate from testing?
They decided to
Or
separate.
to separate from the Virgin Islands?
No, separate from Pearson View. However, it's not truly a separation of entities. It's just they decided now the nursing assistant, which for the record, nursing assistants are not considered nurses. So
Correct.
they separate them. So Credential is now the agency, the program that's going to be testing nursing assistants.
Okay.
And Pearson View will remain with the registered nurses.
Okay, so we'll have two contracts. One with Pearson View and
Will
one with Credential.
continue.
Okay.
That's there already, and Credential is the one that we are trying to get new.
Okay, so, and you've been trying to get this contract from February?
About, I think conversations began in February. I would say about April.
Okay, and you think you're close?
Based on the information received, yes.
Well, what's the name of the company, Credential?
Credential, yes.
Okay, and it's important that we get this because if individuals are going to the class and then the class is completed and then they have to wait 5 months to take the test, that's unfair to them. It's like we're wasting money there. They should be taking the test immediately. So, and we have a severe shortage of CNAs, correct?
Correct.
Severe. So we need to get this passed as quick as possible. Senator Gittins.
Thank you, Mr. Chair, and good afternoon to all. Ms. Vanterpool, I must say that I am happy to hear you speaking up today. And this is what you guys are supposed to be doing, not because you're a small entity. You're a small entity, but you have a big task on your hand. And I personally don't believe that the budget amount is sufficient for your operation, especially your territorial duties. Now, you're talking about $536,000 thereabout, correct?
Yes.
To offset this, have the Board of Licensure ever tapped into the U.S. Department of Interior Technical Assistance Program? It's called a TAP grant.
No, Senator.
Okay, well, I will encourage you to do so. I believe each entity gets about $300,000 to $400,000 max on your applications. There's about $3 million to the territory or so. So please, I think that they reopen again October 1st. If you need to, I mean, you could get it online, but if you need a contact, I will get you that contact. But make sure that you're able to tap into some of those federal monies.
Thank you, Senator. That would be great, considering with Compact, it's going to take a lot from us. But NCSBN, they are going to assist us to one point, but I think as a territory, we will have our fair share of work upcoming for this upcoming fiscal period with Compact.
Now, do you have the personnel to address all this?
For the upgrade, for which
For
ones?
Compact.
For Compact, well, when the implementation process starts with the assistance of SCNBS, they're gonna provide employees. Yeah, employees with training and education once we start to do the infrastructure changes.
Now, compliance.
Well, 1 minute, Senator. Just hold it, Senator, time. We have a new reporter, so put your name on the record before you answer, okay? You may proceed.
Let's go straight to compliance. Who's doing your compliance now? You have a team to follow up on compliance? Because I looked at your strategic goals for 2023, and one of them speaks to adherence to rules and policies and maintaining compliance in nursing practices. What does your compliance unit look like? Do you have one?
Currently, we have, Carmen Vanterpool-Romney, Executive Director. Currently, we just hired in March, a compliance officer in St. Thomas who is fully trained by National to be a compliance officer in the Virgin Islands. She is because of our workload, we were not able to do as much compliance outside to the hospitals, and that's why for St. Croix, we are going to heavily need at least one to begin, but to really do compliance in the Virgin Islands, I think is going to need more than one, but for right now, especially with Compact coming on too, we're going to need a little bit more assistance in that area, but we can start with one on both islands.
So with this projection, is it in this budget?
The compliance officer in St. Croix is on the budget.
So just one?
One so far.
So we're going to borrow one person with all this? I mean, what other position would be required to successfully and efficiently carry out this responsibility?
I would say it would be great if we could have 2 on St. Croix and 2 on St. Thomas. The one on St. Thomas, we are currently having her holding 2 roles, that of HR, because she is capable to carry out that role.
Let me remind you, this is the place for you to come and ask for what your needs are. This ain't the time for you to play bashful, to ask for what you need. So to ask for a bare minimum one, and next thing you know, nurses are still in limbo because this one person is out sick or this one person is on vacation and whatnot. Don't come and ask for one.
Okay.
Ask for your true needs. Even if it's 5 and we say, well, we don't have money for 5 and they give you 2. But don't ask for 1 and get none.
Okay.
Do you follow me?
Yes, sir.
Good.
Yes, Senator.
Know how to work the system.
Okay.
Now, lastly, I also see under your strategic goals for 2023, you spoke about the removal of any barrier that interferes with the application process.
Time.
Can you, in short, tell me what are some of those barriers that interferes with the process?
This is Dr. Dawson speaking. So I really love this conversation because the board meetings have really been around this topic. Currently, we have a meeting pending with the National Council of State Board of Nursing because our applications don't match their standards. And the goal is to streamline that process, including moving into compact, but not only for RNs, but also for the LPNs, CNAs, the APRNs. So everyone that we work with, currently we have a very heavy application of things that don't necessarily speak to the nurse's qualifications. One of those things being passport photos. So our goal is to, which was voted on already during our meetings, to remove that from that and move to something that everyone has, like a government-issued ID. So we're gonna kill 2 birds with 1 stone. We get a picture of the person to identify them, but we'll also get government-issued ID to also identify them. So as our applications move to the online platform, they're gonna be a very more specific and geared solely to licensures.
You know how to kill 2 birds with 1 stone, right?
We're trying to make it more efficient.
You know they have to line up with each other.
So our goal is to make it streamlined. Moving online and using the intelligence we have to the full benefit will help that.
All right, thank you, and I wish you all the best. I truly want to see you all come up with this compliance unit and have it up and working. When we were discussing the measure for the nurse licensure compact, you know, that's where we were like oil and water, and that's where we went at odds because we want to make sure that there is compliance, and we want to make sure that everyone is doing what they're supposed to do. Let's police ourselves, all right?
Yes.
Thank you so much for all you do, and for our nurses, and please, let's try to streamline this so we could get people on the workforce. Thank you, Mr. Chair.
Thank you, Senator Gittins. That bill only took 4 years to get it to pass. Thank God I was reelected, or else it might have been on the wayside. I think that we need to look at the justification as to why we want to increase monies to the Board of Nurse Licensure. And it is that we want to create a more efficient entity that would be able to regulate nursing in the Virgin Islands. And we should not have to wait for CMS to come to the Virgin Islands and go to the hospital and ask for records and begin to see who is licensed to realize that there might be unlicensed individuals, whether it's there or one of the health centers or one of the medical practices that's saying somebody's an RN and they're not. That should be caught because we have a good compliance unit. So I'm 100% behind that as long as the compliance unit is going to do just that, compliance.
Yes, actually, our compliance, and as I said, all our compliance officers will be trained by national, and one of the things that we are a little behind, they should, according to national standard, they should be having a badge, and we are now working on even that. So
Okay,
it's
good.
going to be a serious, some serious responsibilities in that position.
Okay, now I'm also happy that you are streamlining the application process, so you're looking at various applications from across the nation and trying to be standard in terms of what you request.
Correct. We actually got the help from NCSBN.
Okay,
They
good.
provided someone for us. So it's
So now
very
you-
short.
You wrote on I read something with background check.
Oh,
Because I know we passed legislation about 5 years ago that require background check in all medical professions. So what are you saying? That is not sufficient?
This is Dr. Dawson speaking. So I've taken ahead kind of with the compact licensure stuff. So the compact requires that the background check be handled through a specific system. Currently in the Virgin Islands, we are pending a response from the FBI, basically. In speaking to compact recently, we met with them last week during our annual, monthly meetings, and they have acknowledged that that process on average can take a year or more, simply waiting for the FBI's implementation. Guam currently has been waiting for over a year. So our Department of Health, the update we did get stated that they are, pending a response from the FBI. And then once that launches, the National Council of Nursing has stated on average implementation of the compact will take anywhere from 6 months to a year. And they're very much so vested in onboarding with us and getting us supplemental staffing and things like that as necessary. But again, that comes at a cost. At this current budget, that cost is not in it, but we potentially will have that, but we don't have, a timeline, effective timeline to request it.
So getting the authorization for the FBI takes a year
Or more.
or more.
Mhm.
And what's the alternative?
There is no other alternative. It's required from the National Council.
Okay, so we have already submitted.
Department of Health has, yes.
Okay.
And I must say for the record, with our own local VIPD, one problem that we encountered, and this is why it's very important for us to have all these background checks. If you do a background check on St. Thomas locally, it does not cover the St. Croix district.
Yeah, we wanted a national background check. That was the reason why we put it in, because you have individuals that's coming from the mainland, so we wanted to make sure that they are clear before they come to the Virgin Islands. So that was the intent, because we've had issues before. Doctors that were hired at Wang Louis, and then we find out that something took place in the mainland. So I hope you're able to work that out. Senator DeGraff, you're recognized. That's him. Senator DeGraff?
Thank you, Mr. Chair. Good afternoon, colleagues. Good afternoon, testifiers, all viewing, listening, and present. I came in a little late and I heard the conversation in regards to beefing up on the St. Croix end. And I concur and I agree 100%. I'm in full support of that. But that brings me to believe now and be aware of that the St. Thomas St. John district has been carrying the load. So let's look at what has been working and what needs to be fixed better. How many personnel do you have on the St. Thomas end processing all of these licenses and stuff?
That would be a total of 6, including myself. That's processing all the records because we are a small entity. Everyone must be cross-trained to ensure the efficiency of the office.
And Madam Edie, thank you very much, you and your team.
You're welcome,
excellent
sir.
job.
Thank you.
Appreciate
Thank
it.
you.
Now, are your employees unionized?
Excuse me?
Are any of your employees unionized?
We have one that's unionized, yes. The others are not because it's a board.
Okay, so do you know if that one unionized employee have received any wage increases in this fiscal year?
It's no.
Okay. And you know what union they're part of?
SIU. Seafarers.
SIU. Okay. Okay, so in regards to what is working now, based on because even if you get the personnel for St. Croix at this time, you will still need to train them up and bring them up to speed to be able to handle the volumes that you're handling. Now, out of the 5 of you, in terms of actual processing of someone, what actually is needed other than personnel? Do you have all the equipment and stuff to conduct these processes and expedite them?
We're always looking for room for improvement. One of the other thing that we're going to be working expeditiously on is getting an IT contract, because not having an IT person is really damaging our, output sometimes, because our office must be up and all the computers and all the IT stuff be running to make sure that we are up to par with what we're doing. Currently, we are trying to update our system for the printing of the identification card, which we should be moving away from this year. We are working so that the nurses do not need an ID card. So once that part is up.
Excuse me.
2 minutes.
Excuse me. So is an IT person a part of your vacancies?
No, we will be seeking a contract on that.
Okay, so we need to look for IT person, and then you would need equipment and everything. Because I'm saying, based on what you said for the budget, it basically covers personnel. So which would mean, what facility are you working out of here in St. Thomas?
We are currently working out of an office at VI Medical Foundation.
Are you paying rent?
Yes, sir. Yes, Senator.
And the rent is budgeted, is covered in your the acts, the funds?
It is budgeted in the, yes.
Okay, good. So again, so now besides expediting these processes for the nurses, besides the IT person, what else would you need to get this done in terms of expediting for St. Thomas, St. Croix, St. John, not just for St. Thomas? What else would you need?
To get movement expeditiously, one of the things greatest is for us to get our independence and do the things that we need to do as a board. And I cannot change the process in the Virgin Islands, but there are certain things that do keep us back. One being, papers back and forth. And for instance, just a simple credential contract, that was a contract that did not have much to it, and it has been taking us that time. So I can't change the process within the government, but that would be a great help if we can get our stuff put through in a more expeditious way.
Time.
Okay, so then the whole, in closing, if I do, Mr. Chair, so then in closing right now, just basically to add an IT person in with the personnel would be ideal to make a big difference.
Yes, it would make a big difference, but also in adding an IT person, this is why it's very important that we get our new office back. And our office right now, even though we have the staff, is quite small. It's not that big. So we are.
And finally, I see that you have proctors and examiner that are in the St. Thomas St. John district. Do you have those individuals on the St. Croix district?
That's a very good question. No, sir. But I'm sure once we look, we should find proctors. We can always reach out to our business counterpart or other nurses in the community and see if they would like to do it.
And they are paid positions?
Yes, Senator.
Okay, so again, that's another thing to add on to your list. Thank you for the time, Mr. Chair.
Thank you, Senator DeGraff. Point of inquiry quick, and then I go to Senator Joseph. Senator Giddens.
Thank you, Mr. Chair. Two things quickly, Director. You know, with your big task in the office, hearing you talking about your IT needs and whatnot. First off, I wanted to know if you don't utilize the Bureau of Information Technology for assistance. And secondly, do you have vehicles assigned to your office?
Currently,
the first question.
Yes, we do, and actually BIT is very support. They give us great support. Mr. Bao and his team and the others, they actually assisted us fully with our website to get it up and running. So if we need to, we call on them for anything with IT. But
And you have government emails.
yes,
Okay.
and all our board members, yes, we do.
Right. And the transportation?
The transportation, currently we have 2 vehicles on St. Thomas, and we just, maybe less than a month ago, we got the first vehicle on St. Croix.
Okay, I was just about to tell you, make sure you secure one of them Teslas or the Hondas and Acuras.
Well, actually, we do have to request another one because I feel the compliance officer will need their vehicles 24 hours.
And it might sound like a joke, but I'm serious about the compliance part of this so that they can move around.
Yes, they definitely, that's something I looked at in St. Thomas, and maybe I under budgeted for it because currently we have 2, and I've been saying that the compliance officers really need, with their badge, they do need a vehicle 24 hours.
Okay. Well, just make sure you get one because I think licensing a consumer got one too, so they might be able to loan it to you.
Okay.
Thank you.
Thank you.
Thank you, Mr. Chair.
Thank you, Senator. Senator Joseph, you're recognized.
Thank you. Thank you so much, Mr. Chairman, and pleasant good day to the Board of Nurse Licensure. I definitely really happy to see you're moving and transitioning to be a more autonomous board and functioning, and hopefully that level of autonomy will be completed within the next fiscal year. I want to go straight to your budget because I do have some probing question relative to your fiscal year 2023 budget. Given some of the revelations you've made under the questioning of my colleagues, because I'm looking first, let's go down to other services and charges. You have a total amount budgeted of $68,176. Do you think that is sufficient, given that you're renting property already in the St. Thomas, St. John district, correct? How much is your rent?
It's, Ms. Sebastian, could you answer that? I want to be exact, what we pay monthly?
I just need annual.
Oh.
And then I could divide it by 12.
Okay, St. Thomas, it's approximately $35,000 a year.
35. And in your contract with your lease, do you have to make the repairs, or is those repairs to the facility that you're using the responsibility of management?
We are responsible for, we are responsible for interior, and they responsible for.
And what about the water and electricity? Is
We
that
are
all?
responsible for that. Actually, we are responsible
Okay,
for the
so
electricity.
I think you want to look at your budget as far as that's concerned, because you still have to rent this other property that you're looking at, as well as do a build out, because there isn't any funding in your budget for capital outlay at all. If you take a look at it, do you have the post audit report at page 4 of 8? Go down and you see fiscal year 2023 request. You did have some monies in fiscal year 20. Oh, yeah, for capital outlay, but it doesn't look like you have any for fiscal year 2023. You had 31.
And that would have been requested through OMB Senate. For that, this is why we had to request the supplemental, because we had a ceiling, so we could
And who
not.
imposed that ceiling? OMB?
Yes.
Okay, so you're in the right venue right now, and colleagues are correct. You need to ask. You need to put your budget together better with your ask, with your needs, because if you're moving and transitioning to a fully autonomous board, which you should be in my perspective, because you already have your board, you have your governance.
2 minutes.
Then you should be able to put that in, including parts where you need to have travel and training. All of those things need to be included in your budget, and also your additional staff that you're going to need, that accountant that you're going to need, as well as the compliance persons, all of those individual to be included in that budget for you. And I know the board, they are taken care of with the nurse licensure revolving fund, correct?
Correct.
Do you utilize any of their funding for operational costs? Have they ever granted you authorization to utilize some of those funds for operational costs?
We are using the revolving budget for practically most of our cost right now.
And what costs are those? And if we could get, through the chair, an expenditure listing of what you have used so far.
We can have that be submitted to you.
Just for our purposes to understand how the money is being spent and managed for the Nurse Licensure Board. Now, I also wanted to ask regarding the Nurse Compact. I know the Vice Chair mentioned some costs that may be associated and funding. Is the National Board Licensure going to be able to provide you with any type of funding for implementation and transition and implementation of the Nurse Compact Act, which I signed on as a co-sponsor, thankfully?
Yes, actually, Compact, they are going to assist us with technical, as well as we will definitely be needing to hire temporary staff. They did not let us know how many, but we will be needing that. And there is also a grant that we can submit for. So all of that they're gonna assist us with for our conversion to the Compact.
Okay, so they're working on that. Great.
Time.
All right. Mr. Chairman, may I ask one question, and it's regarding the CNA examination.
Yes, you may.
Thank you kindly. I know for the St. Thomas District, we had a number of students who graduated with CNA. Some of them had already completed their requirements since last year, and only this year they had the graduation. And so they are going to need a refresher course. Some of them are already working. And there's 2 facilities. There's also Skills. I can't remember. Ms. Velma Freeman.
Yes, Life Skills.
Yeah, Life Skills, yes. She offers that course, as well as the Skills Center, the Raffaello Wheatley Skills Center. So it is going to be, she would be a great person, or because she's really quick on it, to collaborate to get the refresher course in. And that's one of the questions I want to ask you, because I don't see any professional services contracts in your budget. That is something that you should put in your budget as well. Those are just my recommendations to you, because you have professional services you're going to need, so that we could ramp up the amount of CNAs that are available for the territory, because it is a critical need. I just want to thank you, and thank you so much, Mr. Chairman, for the leeway.
Thank you so much, Senator. Let's just remember that they are the entity that issues the license and actually administer the test. So Department of Labor would be the entity that need to offer the refresher course. I wouldn't suggest that the board entertain anything with refresher course, because you're the entity that's administering the test. And I think that can definitely be done. I wanted to say that with the amendment or the supplemental to 84, Act 8474 it was? 8490, I'm trying to remember your bill number, but literally adding the accountant increases your overall budget to $608,500. And that's Act 8498. So we know that there was a $72,500 increase that was going to be utilized for personnel plus fringe. And then we will factor in the compliance and those other areas. When you came up with a 300 and whatever supplemental, did that included any monies for supplies and all of that? Because I saw you had.
It did include money for supplies and operating costs. I think there was also capital. Ms. Sebastian, do you have that up?
Or just the other categories. It included money for the other categories.
Yes, Senator.
Okay, that's what I need to know.
A small amount, but yes.
Okay. You're growing. You got to take incremental steps, okay? So
yes.
we're working on that. But I think that it's a simple budget for the Board of Nurse Licensure. You have one question, Senator? Quickly, because the DLC is here.
Thank you, Mr. Chair, for the time. Just quickly, I saw where you have on a document revised fees effective August 2012, inactive lapse renewal fee effective July 2018. I saw here where you have several penalties for different things. But as far as how you go about determining what will be a reasonable penalty for these kind of violations, can you just explain to me?
Well, Tani Siapen for the record. When we sit to the table with the board members and do a review of the penalties and fees, we will look at other board districts, especially those that mimic the area that matches the Virgin Islands, like Guam and stuff like that. And we will look to see how they come up to the agreement to see what fees are appropriate for whatever violations or penalties that they have. So we'll try to match or mimic as much as possible.
Okay, and speak directly into the mic. You're getting a little bit softer.
Oh, okay, I was saying that we would look at other boards and see what their fees and penalties are based on the violations that has been done, and we will make the changes to our penalties and fees, because our penalties and fees has not been changed for the past.
Okay, so you're doing thank you so much, Senator. You're doing a complete review of everything and,
Yes.
and aligning it to national standards.
Correct.
This
Okay.
is Dr. Dawson speaking as well. So currently our goal is to completely overhaul our Practice Act and our codes and bylaws, because nothing has been updated in an extended period of time. So the goal of this current board is to bring us up to best practice. And that includes updating all of our fees. As we meet with nationals, we'll also be updating our licensure fees to be appropriate as what it is for what their recommendations are as well.
The last two questions. The code allows you to set the fees, or you got to come back to the legislature? I need to do some research on that. Does the code allow you to set fees?
Currently, this is Dr. Darcy again. So currently the code does allow us to set our own fees.
Okay. Also, you have some outstanding applications again for the chaplain nurses, PAFA, to start shortly, August 1st. Let me be specific.
This is Dr. Dawson. I'll speak on the current issues with Pafford. So we have not been able to set up really great communication with them, with the board. It seems to be very much so third party. And we do have a list of nurses who are going to be starting in the territory. We received that list fairly recently, and they're requesting temporary permits. We do not have a direct contact that is submitting applications from Pafford, though we have requested that. And because of that, we are now attempting to track down those applications within the office. We have requested that Pafford send us a list of the nurses and their actual start dates and when they will be starting so that we can do it in order of priority.
Okay.
So we're trying to be
you
good
don't
to
have that from PAFA?
We do not.
Okay, so I will reach out to see how we're able to set up the link and get that information as quick as possible.
This is Carmen Vanterpool-Romney, Executive Director. I would, to add with that question with Pafford, for the record, currently we are working with 3 different agencies within, that are contracted through the territory.
What's the next 2?
Actually, the second one, I forgot.
Professional nursing services.
No, Curtis, that's Curtis. And there's a new one, and that's why I don't know the name. I know we have been speaking with them. That contract was signed 2 days ago or 3 days for St. Croix.
Okay.
However, that agency did do the correct thing. She reached out to us and asked us how can she get these, and I think she has 40 nurses that needs to start on St. Croix August. PAFA just submitted a couple days ago for 60 nurse, 25, 30, and these are the numbers that we get. And just to show what the board has been doing, we get these requests today for tomorrow.
And you get it for a short period of time.
Short period,
Yeah,
and the one that St. Croix, that agency was already being processed. So should we now stop the St. Croix process and just addressing Pafford?
No, we're not saying that. Ms. Vanterpool, you've been good all day. We just get ready to pong the gavel. You've been good all the time.
What I will, this is Dr. Dawson again. So what I will say to that is that we have been able to develop really great relationships with other entities. So Schneider Regional, the JFL has reached out and we have direct contact with HR. Pafford has been continuously a challenge for the board because though we issue directives, they do not respond to those directives. Along with Ms. Vanterpool, what she's speaking to is Aya Health, who they actually have designated an individual to be in charge of the application process. They reached out to streamline that process and we've been able to come to an agreement on how that will work.
Okay, so we're going to make sure we're able to also develop that relationship with PAFA. I'm going to put some energy and work into making sure that we have that particular relationship. We're not in a good place with healthcare in the Virgin Islands, and that's a sad thing, because lack of licensure mean ICU might not have sufficient nurses. The emergency room might not have sufficient nurses. So you try to balance, like, well, what do? You know, you're not doing this, but then if we don't do this, then the ICU remains not staffed, or the emergency room is not staffed, or we don't have sufficient individuals for the ambulance. You see all the PAFA ambulance driving around the island. So we got to come up with a solution so we're able to move forward. You guys have been progressive. You're moving forward in terms of your ability to license and compliance and all, and regulatory in reference to nursing care. So we're going to get this worked out. It's not impossible to work out. And the chair of Health, Hospital, and Human Services will have a meeting with the Board of Nurse Licensure and Department of Health so we can work out whatever outstanding issues we have there. And we're going to move forward and make sure that you're able to do your job. So I'm going to ask Ms. Penn to put a closing statement on the record. We want to thank you for your testimony. So I'll give you a short closing statement.
Thank you. I would like to thank the committee and VIBNL and the members for taking this opportunity to hear our plea. We would like to also thank the listening audience. We would like to know that we have tried our best. We have worked diligently. We have made partners with many of the departments within the government, and we just want to make sure that the Board of Nurse Licensure gets the full authority that it needs to function and follow the rules, regulations of the VI Title Code and the Nurse Practice Act.
Oh, wow, okay.
Thank you.
Thank you so much for your testimony. Media, I think we have an issue in St. Thomas. It said they're not hearing anything. So it's a perfect time to take a 5 minutes recess. The committee stands at recess for 5 minutes. The Committee of Finance is back on the record. Next before us, we have the Department of Licensing and Consumer Affairs. We have the Commissioner here along with members of his staff. We are going to allow him to put his name and title on the record and then move on to his staff. Commissioner?
Good afternoon, Honorable Senator Kurt Vialet, Chair, Committee of Finance, members of the Committee of Finance, other senators of the 34th Legislature, the legislative staff, the DLCA family, and the listening and viewing audience. I am Richard Tomas Evangelista. My apologies, sir.
I know you're going straight into the testimony. I appreciate that, but let me get your...
And I have people on Teams too.
Yes. Okay, so we're going to get them up now. So let's begin. You're ready. Put your name and title on the record. Let's start with the Assistant Commissioner.
Assistant Commissioner of the LCA.
Thank you. Next.
Director Wilbur Francis, Director of Enforcement, DLCA.
Again, good afternoon. Horace Graham, Director, Division of Licensing.
Thank you. Ms. George.
Good afternoon, Deputy Commissioner Myrna George.
Mr. Paget.
Good afternoon, Matthew Paget, Director, Consumer Affairs.
Ms. Cardi.
Good afternoon, Hannah Cardi, Executive Director, Office of Cannabis Regulations.
Assistant Commissioner, can you go again? They didn't hear it on St. Thomas with a recorder. Name and title.
Good afternoon, Senators. Natalie Hodge, Assistant Commissioner of DLCA.
Okay, I think that is it, Commissioner.
Yes, Senator.
Okay, you may proceed.
Thank you. I am Richard Tomas Evangelista, Commissioner of the Department of Licensing and Consumer Affairs. Today, I am accompanied by Assistant Commissioner H. Natalie Hodge, Director of Licensing Horace Graham Jr., and Director of Enforcement Wilbur Francis. Both Deputy Commissioner Myrna George and Director of Consumer Affairs Matthew Paget are appearing virtually, and I am elated and excited to share with you for the first time publicly that this morning the Cannabis Advisory Board, with the advice and consent of the 34th Legislature for my nomination, actually confirmed with a majority board Ms. Hannah Cardi to serve as Executive Director of the Office of Cannabis Regulation. Unfortunately, both representatives of the business office as well as General Counsel are unavailable for today's hearing. The Director of Administration and Business Management was selected for jury duty this past Monday, July 25th, 2022, and both the Administrative Service Manager of Administrative Services as well as the General Counsel are out on leave. At this moment, I request of the acting chair for your indulgence to pause for a moment of silence. This past year, within the past 6 weeks, a former DLCA teammate, Mr. Howard Dyer, when he retired, was director of the Consumer Division. He passed tragically, as well as a team member who was in the office with me less than 4 days before her untimely passing, Ms. Janita Martin, licensing officer for the boards and commissions. Thank you, Senator James.
Thank you, Commissioner. And once again, we'd like to express our condolences on the 34th Legislature of the Virgin Islands on the passing of your 2 employees at DLCA. So thank you for placing that on the record.
Thank you, sir. If I may proceed.
Proceed.
Thank you. The Department of Licensing and Consumer Affairs, or DLCA, is established under the Virgin Islands Code, Title III, Chapter 16. The department provides consumer-related services and programs pursuant to the Consumer Code as set forth in the Virgin Islands Code, Title 12A of the Consumer Code, including the Consumer Protection Law of 1973 and the Price Control Act as set forth in the Virgin Islands Code, Title 11, Price Control, Section 1010A. DLCA also regulates the licensing of private businesses and professions as provided forth in the Virgin Islands Code, Title 27, Professions and Occupations, including Chapter 9, Licensing of Businesses and Occupations, Section 301 et sec. The department's mission statement is, I quote, serving businesses and assisting, educating, and protecting consumers. Now, for a review of the fiscal year 2023 budget. DLCA's total budget for fiscal years 2023 is $4,740,288. It reflects a decrease of $646,898 from the department's final fiscal year 2022 budget appropriation amount of $5,387,186. The budget is comprised of $4,240,288 in general fund appropriations and $500 in the Consumer Protection Fund appropriations. The general fund allotment of $3,651,916 covers personnel services and fringe benefits. The remaining $588,372 covers the department's operating expenses. The operating expenses for the general fund include $29,600 for supplies, consisting of office supplies as well as operating supplies, as well as $322,557 for other services and charges, including professional services, website/online licensing system, technological consultant, janitorial services, testing services, exterminating services, communication, telephone systems, monthly telephone service, long distance, fiber internet connection, maintenance agreements, repairs, and maintenance, as well as rent for the St. Croix office, for a vast difference of $170,375 between fiscal year 2022 and fiscal year 2023, and $81,000 for utilities. The remaining budget allotment of $500,000 comes from the Consumer Protection Fund, which is a revolving fund derived from the collection of license penalties and citation fines. This special fund is designated to address the costs associated with investigating as well as resolving consumer disputes and complaints and consumer education. Due to the general fund expenditure ceiling imposed by the Office of Management and Budget to the Department of Licensing and Consumer Affairs since 2021, the CPF funds have been utilized to defray costs for professional contracts, equipment, communication, and supplies. CPF expenses include $5,000 for fringe benefits, such as uniform allowance, $81,000 for supplies, and $414,000 for other services and charges. I will now proceed with a department overview. There are currently 8 separate divisions within the department, which include Office of the Commissioner. The Office of the Commissioner is responsible for the overall leadership, management, planning, supervision, and direction of the department so that it may effectively carry out its mission. And I would be remiss if I didn't share with you that the Special Assistant to the Office of the Commissioner, Ms. Kiwanda Daniels, is sitting in the, sitting in the chambers. And her direct cell number for anyone between the hours of 8 a.m. and 5 p.m. is 340-725-5129. We are accessible, but please respect Ms. Daniels' privacy after hours. The next division is Administration and Business Management. This division is responsible for all budgeting, accounting, payroll, procurement, and personnel operations of the department. It provides all the resources required for staff to perform their duties in an efficient, effective, and professional manner. This office maintains the following accounts: General Fund, Consumer Protection Fund, Vendors Plaza Revolving Fund, Virgin Islands Public Accountancy Fund, and the Real Estate Appraisers Fund. The next division is Division of Licensing. The Division of Licensing is responsible for receiving, reviewing, and approving applications for business licenses. Upon receipt of the electronic application for new or renewal licenses, fees are collected and electronic approval from other departments integral to the licensing approval process is verified. These departments include Office of the Lieutenant Governor, particularly the Office of Corporations and Trademarks, the Virgin Islands Police Department, the Department of Planning and Natural Resources, the Virgin Islands Fire Service, and the Department of Health, whichever applicable, before the license is issued. I am proud to say with no reservation that the information that I'm about to provide to you is as a result of the members of Team DLCA. And I think this is why we're here today for a budget hearing to demonstrate to you that we get it done. During fiscal year 2021, the Division of Licensing approved 9,819 businesses, having a total of 14,958 categories of business activity. The breakdown is as follows: 1,027 new businesses, having 1,519 categories of business activity, and 7,658 renewed businesses, having 13,439 categories of business activity. Revenues collected during the period were $4,032,913.37. That is for the entire year of fiscal year 2021, beginning October 1st, 2020, and expiring on September 30th, 2022. October 1st, 2020, expiring September 30th, 2021. Thus far, during fiscal year 2022 through June 30th of 2022, so approximately 28 days ago, the Division of Licensing approved 9,874 businesses, having a total of 16,526 categories of business activity. This is an 81% increase over the prior fiscal year value of 9,124. The breakdown is as follows: 1,509 new businesses, which is a 151% increase over the previous fiscal year value of 600, having 2,143 categories of business activity, which is a 133% increase over the prior fiscal year value of 918, and 8,365 renewed businesses, which is a 77% increase over the previous fiscal year value of 4,702, having 14,383 categories of business activity, which is a 75% increase over the prior fiscal year value of 8,206. Revenues collected thus far during the period October 1st, 2021 through June 30th, 2022 amounts to $3,560,109. This is a 34% increase over the prior fiscal year, October 1st to June 30th of last year, value of $2,664,840.96. I am proud to say that the licensing team on St. Croix is led by Director Horace Graham, and it's followed up by licensing officers Ms. Wanda Brooks, Ms. Sandra Tyson, Ms. Patricia Greenidge, and the cashier who collects the money, Ms. Maxine Frederick. On St. Thomas, the team is led by Assistant Director Carlene Jeffers, and she's followed up by the licensing officers Ms. Cherokee Thomas, Ms. Stephanie Ross, Ms. Karen Stapleton, Ms. Estelita Peterson, Ms. Sharon Alexander, and they're backed up by the cashier who collects the money that I reported to you, Ms. Anisha Industrious. And on the island of St. John, we have an all-rounder, but she participates, Ms. Lakia Abbott. The division has now fully implemented the provisions of Title 27 Virgin Islands Code, Section 303A, resulting in 60% of business license renewals issued in less than 10 days, which is about a week and a half. The issuance of a new business license is gradually improving as 25% are issued within 10 days. The challenge with the new business remains the timely submission of payment as well as documents required for a minimum review to be accomplished. The division, persistent use of social media and other media resources to inform the public are yielding positive results as applicants are following through with the requirements more readily, as is evidenced by the numbers for this fiscal year through June 30th of 2022. I must highlight that the double disasters of the hurricanes in 2017 and the global pandemic in 2020 have had significant adverse effects on the business community, and I do not need to repeat that because it's a well-known fact. Many businesses struggled to remain viable during this period. Thus, the department, pursuant to its authority granted under Title 27, Section 301, has sought to ameliorate these negative impacts by reviewing and subsequently reducing administrative penalty fees in exchange for immediate payment of fees. For the month of July 2022, the Department of Licensing and Consumer Affairs implemented Operation Apply and Comply. This program enables all formally licensed establishments who have since fell delinquent, as well as unlicensed establishments, those operating without a business license, to reapply or apply for a business license and automatically, I repeat, underscore, italicize, bold, automatically receive a waiver for 70% of the outstanding penalties associated with their failure to timely renew their business license or their failure to obtain a business license. We continue to maintain that we shall educate before we regulate, but we also have empathy in light of those two major incidents that have occurred within the past 5 years. As of July 22nd, 2022, Operation Apply and Comply has seen more than 60 businesses come into compliance with the requirements for licensure. At this point, I'm publicly pleading to all persons who are currently operating with a expired business license or who are operating a business without a business license, period, to please, now is the time, take advantage of Operation Apply and Comply. Next up, the Division of Boards and Commissions. This division has oversight responsibility for professions and trades, including the testing and licensing of individuals in each area. There are distinct requirements for each of the following 8 boards and commissions, and they're as follows. 1, architects, engineers, and land surveyors. 2, barbering and cosmetology. 3, certified public accountants. 4, and thank you to the members of the 34th Legislature who combined the General Contractors Board to form the Contractors, Trades, and Crafts Board. Pursuant to Act 8464, the board is now comprised of the former General Contractors Board, the Electricians Board, the Fiber Optics Board, the Plumbing Board, and the HVAC Mechanical Board. 5, the Real Estate Appraisers Board. 6, the Real Estate Brokers and Salespersons Board. 7, the Social Workers Board. 8, the Licensed Counselors Board. Like the Licensing Division, during fiscal year 2021, Division administered examinations to 109 candidates and issued 2,475 licenses. Through June 30th of this fiscal year 2022, the division administered examinations to 90 candidates and issued 2,227 licenses, with a breakdown of 420 new licenses and 1,807 renewals. That was not done overnight. That was done through the assistance and the leadership of Assistant Commissioner Natalie Hodge, Ms. Christina Lake, Ms. Shireen Gums, Ms. Jouvert Pennyfeather, and may she rest in peace, Ms. Janita Martin. The next division is the Division of Consumer Affairs. The Division of Consumer Affairs is responsible for assisting, educating, and protecting consumer rights against unfair and deceptive trade practices. It advises, guides, and represents consumers regarding the filing of formal complaints against businesses and/or professionals and attempts to resolve them. It is also responsible for ensuring equity in the marketplace through the establishment and enforcement of weights and measures standards in the Virgin Islands. The division also conducts monthly market basket surveys, weekly gasoline price surveys, monthly scanner surveys, various store inspections, and weekly pull date inspections. The market basket and fuel surveys are available online for viewing at our website, www.dlca.vi.gov. During fiscal year 2022, from October 2021 to May 2022, the division conducted 204 inspections at retail establishments and issued citations for various consumer laws, violations valued at over $16,500. Within the Consumer Affairs Division is a separate, distinct Consumer Protection Services Unit. This unit is responsible for the development and implementation of consumer education programs and activities, addressing consumer complaints, and monitoring business practices throughout the territory for compliance with consumer laws. During fiscal year 2022 through May 31st of this year, the unit received 219 consumer complaints, resolved 56 of them, and kept as information only or referred 163 to DLCA's legal division and or other agencies with jurisdiction. The division thus far has collected $63,141.25 in restitution for consumers from businesses. The Weights and Measures Unit is another distinct unit within this division. It is responsible for ensuring that all commercial weighing and measuring devices and methods used in the territory are accurate and correct. The unit also enforces all laws and regulations pertaining to food freshness and net contents of packaged goods. During fiscal year 2022 through May 31st of 2022, the unit inspected 71 scales and 102 retail meters and conducted 72 pull date item inspections of over 3 million food items. The department would like to take this opportunity to formally introduce Director Matthew Paget as our new Director of the Consumer Affairs Division. Director Paget was internally promoted to the Director of Consumer Affairs from Weights and Measures Inspector effective October 2021. The next division, Enforcement. The Enforcement Division enforces the Virgin Islands licensing laws by inspecting all businesses to ensure compliance. Additionally, the enforcement officers provide process of service on behalf of the Legal Division and the Boards and Commissions Division, as well as escorts the cashiers, collection clerks to the bank as needed. The division also regularly participates in various task forces and joint initiatives with the Virgin Islands Police Department, the Office of the Governor, the Department of Health, and local community organizations as needed. Pursuant to Governor Bryan's State of Emergency Executive Order of March 13, 2020, all DLCA enforcement officers were deputized and reported to the Virgin Islands Police Department to assist with the efforts of the state of emergency. The director began taking a methodical approach to guiding the division by implementing policies where none existed and strategies to get the division current. During the last fiscal year, while the officers were displaced, or should I rather say were on loan to the Virgin Islands Police Department, a total of 455 licenses were processed through the Enforcement Division. As a result of the pending business license requests, plus the applications compounding daily, the department requested its officers to return to the department with success. From December 15th of 2021 through the end of June 2022, while the officers spent a limited amount of time with the Department of Licensing and Consumer Affairs when away from the Virgin Islands Police Department, the division processed 4,148 business applications. The Enforcement Division spent the last 6 months clearing out the stockpile of work that was created as a consequence of the officers' 21-month assignment with the Virgin Islands Police Department. Also, after addressing the backlog of outstanding applications, the division has issued $39,400 in citations to non-compliant businesses. On average, the Enforcement Division processes its enforcement portion of a business license in approximately 3 days. In addition, since June of 2022, the Enforcement Division implemented a monthly calendar consistent of time allocated to conduct random inspection of businesses to determine whether or not a valid business license exists in addition to the scheduled inspections for the new business license applications. Businesses are urged to take advantage of the department's Operation Apply and Comply program because it offers, as indicated previously, up to and actually a 70% waiver on penalties and citations during the month of July 2022. The Virgin Islands Board of Control of Beverages, also known as the Alcohol Control Board, was established to regulate the manufacture, sale, and importation of alcohol beverages in the territory. In the past, the Alcohol Control Board had members from all 3 districts and an office managed by an executive director. The board was responsible for the approval of all liquor licenses, warehouses for storage, and aging of all fermented and distilled spirits and liquors in the territory. However, the board statute was repealed and the powers of the board were transferred to the Office of the Commissioner of DLCA. In the absence of the board, the Enforcement Division is tasked with performing the fieldwork and regulatory duties for the ACB board that used to stand up. In both the District of St. Croix and the District of St. Thomas and St. John, DLC inspects incoming spirits. Specifically, in the District of St. Croix, this includes inspection of shipments of rum produced in the Virgin Islands and shipped to the United States. The rum shipment reports for fiscal year 2021 and fiscal year 2022 through June 30th of 2022 are attached as exhibits for your viewing. I am happy to inform this committee that the DLCA is currently in the process of reestablishing the Office of Alcohol Control Beverages, and we have scheduled interviews to fill the following open positions: the Alcohol Control Coordinator, which is a territorial position, one Alcohol Control Inspector in St. Thomas and St. John, one Alcohol Control Inspector in the District of St. Croix, and an administrative assistant, I believe, that is left out. The next division, legal. The legal office is responsible for providing in-house legal advice to the commissioner and the department, promulgating and implementing rules and regulations, providing legal advice to all the boards and commissions, assisting with the development of policies and procedures, prosecuting licensing and consumer violations through administrative proceedings, and representing the department and consumers on legal matters. In addition, the division also assists with professional contract matters, including insurance contractor compliance, and with addressing and processing personnel issues and grievances. Conduct a survey through subpoena investigation of the reasonableness of the wholesale and retail prices of propane, retail and wholesale gas in the territory. Subpoenas are also issued to businesses in order to investigate consumer complaints against alleged violations of price gouging. DLCA will soon be staffed with a complete legal team to ensure consumers are afforded their full due process rights. Currently on staff is Geraldine Vaval, General Counsel, and Melanie Fenzel, Legal Counsel for boards and commissions. And we are in the process of onboarding a district counsel for the District of St. Thomas and St. John, as well as a hearing officer. During fiscal year 2022 through May 31st of 2022, 21 cases have been referred to the legal office. 4 cases have been resolved through mediation without the need for formal administrative proceedings. 1 complaint was advised to file a case in small claims court to be resolved through the civil process. And after investigation of the consumer complaints filed, there have been 2 administrative proceedings commenced. Both were resolved in favor of DLCA, and currently there are 14 pending cases. In addition to DLCA's legal office, assisted the Virgin Islands Department of Health with conducting informal conferences on businesses that were cited by the now stood down COVID-19 task force for allegedly violating Governor Bryan's state of public health emergency. Additionally, rules and regulations were drafted for the Virgin Islands Board of Licensed Counselors and Examiners, as well as the Virgin Islands Board of Contractors, Trades, and Crafts. Finally, the Office of Cannabis Regulation. This morning, as I indicated, the Cannabis Advisory Board with a quorum met and formally moved to add and hire Ms. Hannah Carty as the Executive Director of the Office of Cannabis Regulation, retroactive to January 30th of 2022. Pursuant to Act Number 8167, the Virgin Islands Office of Cannabis Regulation was created to implement and administer the provisions of the Virgin Islands Medicinal Cannabis Patient Care Act. The Office of Cannabis Regulation began to lay the foundations of its operations on January 3rd, 2022, and is dedicated to protecting and ensuring access for medical patients with qualifying conditions and ensuring products are safe, quality tested, and accurately labeled. The focus of the office has been ensuring the Cannabis Advisory Board is properly staffed and finalizing the rules and regulations. I would like to say thank you for confirming me to the board as of July 20th, 2022. This will allow the Cannabis Advisory Board to proceed on its outstanding items, including completing the rules and regulations for the office, and as I indicated earlier today, we formally selected Hannah Carty as the Executive Director of the office. While awaiting her full appointment to the office, Ms. Carty began developing the tools necessary for the successful rollout of the program, including standing up and developing the OCR website and social media sites. The website is www.ocr.vi.gov. The social media site is at USVI-OCR. Developing logos and seals, monitoring and processing consumer concerns and questions, creation of the OCR strategic plan, which includes revenue projections, budget, timeline, mission, vision, goals, and organizational charts, organizing executive branch level support for programmatic initiatives, joining 2 national cannabis organizations, the Cannabis Regulators Association and the National Council for Federal Cannabis Regulation, developing forms and applications, researching and taking cannabis education courses, contacting vendors for services, organizing office space, and developing contact information, including the phone number and email address. All of these items will be addressed at our next Cannabis Advisory Board meeting scheduled right now for August 10th, 2022. Staffing. The department's current staffing level for fiscal year 2022 is 55 persons, all paid for by the general fund. All budgeted positions are currently filled or in the process of being filled. Of 55 positions, 23 are in the St. Croix district and 24 are in the St. Thomas St. John district. There are a total of 8 vacant positions. The vacant positions are as follows: 1 hearing officer, 1 paralegal officer, 1 weights and measures inspector, 2 administrative assistant supervisors, 1 alcohol coordinator, and 2 alcohol inspectors. I'd like to share with you that the hearing officer position's paperwork is actually in the process of being completed, so that should be 1 less actual physical vacancy. All their other positions are actually posted at the Division of Personnel, or if they're exempt, they're actually, we've received resumes and we'll start conducting interviews within the next 1 to 2 weeks. The fiscal year 2023 staffing is allocated as indicated in the chart below that I just mentioned to you. The lack of adequate staffing is a great obstacle to attaining greater results from the Department of Licensing and Consumer Affairs, as well as an expeditious outcome for our customers, both internal and external. However, I'd like to stress and underscore that with the existing staff load that we currently have at the department, as the numbers say, numbers don't lie, and I'm proud to say that we are excelling, if not in fact over-excelling in what we do at Team DLCA. However, the presence of inspectors, officers, and investigators in the field in a greater number will provide the consumer with the confidence and comfort in the department, and it helps to mitigate any offenses committed by businesses. Currently, the Weights and Measures Unit within the Division of Consumer Affairs is functioning with 1 Weights and Measure Inspector in the District of St. Thomas and St. John, and 1 Weights and Measure Inspector in the District of St. Croix. Unfortunately, the department lost its Chief of Weights and Measures to retirement on May 30th, 2022. At this time, I'd like to acknowledge Mr. Luis Santos, who created his mark at DLCA in a good way. To adequately serve the needs of the Virgin Islands, the division needs at least a staff of 4 inspectors per district to provide DLCA with enough inspectors to cover all the retail stores, gas stations, grocery stores, as well as associated tasks to meet the needs of our external customers. The Consumer Protection Unit consists of 1 Consumer Compliance Officer in the St. Thomas and St. John District, and 1 Chief Compliance Officer and 1 Consumer Compliance Officer in the District of St. Croix. Unfortunately, DLC will be losing soon a Chief Compliance Officer in the District of St. Croix due to retirement. The unit needs at least a staff of 3 compliance officers in St. Thomas and 3 in the District of St. Croix to adequately serve the needs of the Virgin Islands. The Consumer Affairs Division will also benefit from an administrative officer who will be needed to provide administrative and clerical support to the director and staff. The Office of Boards and Commissions would like to add a proctor to its team in the District of St. Croix. As indicated earlier, our team member who passed away untimely used to be the proctor as one of her duties. So as such, on St. Croix, DLCA provides testing for not only the professions as well as the trades, but all PSI developed tests. As indicated, up until the untimely passing of our team member in May of 2022, the test center had offered 2 days of testing per week. Currently, the testing center is closed until DLCA can hire a certified proctor. So it's not just anyone, you must be certified by PSI. To date, the Brian Roach administration has successfully appointed 23 persons to various boards and commissions with the cooperation of the legislature of the Virgin Islands. On behalf of DLCA, thank you to the members of the 33rd and the 34th legislature of the Virgin Islands. The governor's office has been diligently trying to fill these vacancies. However, it's sometimes challenging to obtain a commitment from some of these tradespersons. Many are faced with trepidation to go before the Rules Committee for a confirmation hearing. However, recommendations and resumes of qualified individuals who have agreed to serve have been submitted, and we continuously submit to the Office of the Governor for its action. The department awaits action on these, and it's my understanding that the process is ongoing. However, for those persons listening to the sound of my voice, if you are one of the tradespersons for which there is a board, I urge you to apply for a position on the board so that you can assist the Virgin Islands government to create a better place for the people of the Virgin Islands. A complete listing of boards and commission appointments as well as vacancies are provided in the following chart on page 18. Finally, goals, initiatives, accomplishments. In addition to meeting all the regular mandates pursuant to the code and the numbers that I provided to you, the DLCA understands and continues to work on improving its website. We continue with enhancements to the website that would make the processing of licensing applications more efficient and effective, as well as the increased urgency and attention drawn by current events have caused DLCA to inquire on Palm Beach County, who is our server for the software, what is their posture to protect our assets from adversaries. Cyber criminals have and will continue to attack critical infrastructure to disrupt many lives and create chaos. So they have assured us that some of the measures that they've put in place include next generation firewalls, continuous vulnerability scanning, patch management, endpoint protection, and daily backups. They have assured us that DLCA shall continue to enhance cyber resilience to prepare, respond, and recover from any cyber attack. Consumer outreach. The Department of Licensing and Consumer Affairs has continued its community outreach efforts on various community consumer topics, as well as educating businesses on the business license requirements. Some of the public outreach and educational initiatives are Talk DLCA. It's a weekly virtual series to hear community concerns and educate on DLCA initiatives, and it's held via Zoom. Depending on the topic, we can have anywhere from 150 to, if it's just Evangelista on the air, to 2 people. But nonetheless, it's a forum that's available for anyone in the community to sign on. So literally, it's a virtual talk show. We hold Tri-Island Town Halls. The last one we held was March 14th through 16th, 2022. And this is where businesses were invited to be educated on the Virgin Islands law regarding tavern keeper liquor licenses, nightclub licenses, cabaret licenses, and tavern license. There's an upcoming Latin Town Hall to educate our Spanish-speaking community specifically on the business license requirements. And this town hall is scheduled for Thursday, August 4th, 2022 at 6 p.m. at the Sunny Isles Amphitheater. We will also have another one in St. Thomas, and that schedule will be available in the next 2 weeks. Gas surveys and rack rates are issued by Gulf Oil Pricing at Lime Tree Bay, and the surveys conducted by our 2 inspectors are uploaded to our website, not currently, twice a week at www.dlca.vi.gov. We also have an online Facebook presence and sending an email blast to businesses notifying them of initiatives and important messages from DLCA. Vendors Plaza Revitalization. Last week, DLCA met with Creations Global LLC, the vendor selected to construct a new kiosk for Vendors Plaza. After weeks of conceptualizing and countless engineering and structural changes, the first completed kiosk is built. Last week's meeting was called to provide the various government stakeholders with an update on what is requested of them to prepare the site for the new kiosk. The kiosks are expected to begin arriving into the territory on or about the first week of October 2022. In the extremely near future, DLCA shall meet with the existing vendors to provide them with a personalized update. I cannot express enough that the Department of Licensing and Consumer Affairs team is comprised of an excellent cadre of individuals who work diligently and are dedicated to their best to improve the department's responsibility to serve the business and consumer public. The numbers speak for themselves. Currently, I want to publicly acknowledge and express how grateful and thankful I am to work with Team DLCA. They fill in for each other to assist our clients and do so professionally and competently. I take this opportunity to thank each member for all they do to serve the public efficiently and effectively, especially during the coronavirus pandemic and now with the current recession. When consumers contact DLCA asking about prices, who feels it knows it? Our team members feel it also. Our team is comprised of hardworking and dedicated public servants. Each member of Team DLCA brings their own personality and qualities to work. Senator Vialet and members of the 34th Legislature, this concludes the fiscal year 2022-2023 budget testimony for the Department of Licensing and Consumer Affairs. Thank you for your time. Members of Team DLCA here with me, as well as virtually, are available to answer your questions. Good afternoon.
Thank you for your testimony, Commissioner. We're going to go directly into a round of questioning. We're going to begin with 6 minutes. Senator J. Van James, you recognize.
One, two. Thank you, Mr. Chair, for the time. Good afternoon, testifiers. Thank you for being here.
Good afternoon, Senator.
It was a wonderful feeling when I heard you said that all or most of your positions are filled and they are in the process of being filled. This is a very good sign for the Virgin Islands government, and I really hope more departments and agencies can do the same. Now, you mentioned the Cannabis Board, and you mentioned Act 8167 that speaks to the Virgin Islands Office of Cannabis Regulation. But ever since that act was passed, would you say that there's a need for any additional funding to move forward with implementation of that board?
So, Senator, if you are unaware, there was a $500,000 loan that was was put into the bill to be loaned to the Office of Cannabis Regulation. And 2 years after the implementation, and we're going to say when it actually starts working, that it should be repaid. But I will allow Director Cardi to respond to that question, if that's okay with you.
Yes, and it'll be brief if you don't mind.
Yes, Hannah Cardi, Executive Director. So the money that has been provided at this time is essentially not enough to proceed with the development of the office. Ideally, the office would be, instead of being granted a loan, would be given a grant so that the monies can be preserved for future development of the office. In addition, there was a second bill that provided funding for cannabis technology. In our review of vendors, those funds do not cover the entire cost of cannabis technology for the first 2 years. So that may be needed to be adjusted as well.
Okay, thank you for placing that on the record. I'm a strong supporter of Act number 8167. And I just really hope and pray that we move forward with this. They have been far too long, and we need to make sure that these laws are enforced. So whatever you need to get it up and running, I'm not saying we're going to promise you anything, but let us know, because we want to see revenues generated in the territory.
Thank you, Senator. And if I may, more importantly, in addition to revenues, I have people who have approached me who have been diagnosed with certain illnesses in other jurisdictions. They're prescribed medical cannabis, and unfortunately, when they return to the Virgin Islands, they find themselves hiding, seeking out the medication that they've been prescribed. So for all the medical users, we're almost there. So thank you for your patience and thank you for your concern.
No problem. And I saw where you mentioned you need at least a staff of 4 inspectors per district, specifically for retail stores, gas stations, grocery stores, to hold them accountable. So as far as the interviewing process that you made mention of with filling the vacancies, that is factored into that, or this is for the future?
So, Senator, what we currently have in our books is one inspector, but it goes beyond the one inspector. What is occurring is because the level of funding associated to the position, it's a classified position, we're working on improving the salary because these are actually technical positions. And so currently we have one on the book, but as part of the supplemental, we are requesting the additional positions. And the Director of Consumer Protection is available to clarify my response if in case I didn't do it properly.
Please do, because we definitely need to be able to hold these businesses accountable. I am for business. I'm all about the private sector. I believe in less government and more private sector, but at the end of the day, they still need to be regulated, and if we can get those inspectors, we'll be able to hold them accountable.
Sure. Director Paget?
2 minutes.
Matthew Paget, Director of Consumer Affairs. No, Commissioner summed it up pretty well. The only thing we didn't include was the total cost for procuring those additional staff members. As of right now, our entry salary is $27,040 for a weights and measures inspector. We're finding it difficult to compete with the private sector when, frankly, a grocery store tenant makes more than we're offering. The total salary allocation for a fully funded staff would be just under $313,000 additional to what's already included in the budget.
Thank you for placing that on the record. And you also mentioned, Commissioner, that there's a vacant position for one hearing officer. How many hearings are currently pending or scheduled? Do you have a backlog of cases or hearings?
Thank you for the question, Senator James. We actually have already interviewed and selected someone for the hearing officer position. We're just finalizing the paperwork. The hearing officer is integral to the department's administrative process and providing due process to both the complainant as well as the business. Since I arrived at DLCA, if somebody complains about something and it's unresolved, it literally sits in an abyss because we don't have the hearing officer to take the dispute further when in fact there is no settlement of that cause. So in terms of the number of cases, sometimes they go away, sometimes they're still there. Based on what we said, there's about 21 current pending cases that were filed this year to be heard, but it's critical because it's as if you have a police force and you don't have a courthouse.
So my next question would be, with those 21 cases, how many of those cases have been heard? And
they're waiting to be heard, sir.
Every single one of them?
Every single one.
All right. And I hope and pray that you get it up and running. I do believe in due process and being fair. So hopefully we get individuals to come forward with that. And I see you here where you mentioned your Consumer Protection Fund. I think $500,000 comes from the Consumer Protection Fund, a revolving fund from the license penalties and citation fees.
Time.
As I speak about being pro-business and less government, our job is never to make it hard for businesses, but as far as the fines and the fees, when last they have been increased? Or is it part of the Virgin Islands Code? Is the Virgin Islands Code will have to be amended?
Yes, sir.
So based on any recent assessment, have you done any assessment to find out if we need to increase those fees or not, if they're reasonable? Because I know a lot of them, they have been there for like the 1970s and 1980s.
Correct. So as I mentioned, the hearing officer position is on its way to the department. Currently, if you are caught operating without a business license, the citation is $500. So persons tend to say, oh, I'll pay the $500 and I'll go about my business and I won't comply, or they don't pay it. I think there was a bill that the chair of the Finance Committee passed about 2.5 years ago that we are now actively enforcing. It is the requirement that you have 2 forms of payment if you gross more than $50,000 annually in your business. I have no wiggle room. It literally says $1,000 first penalty. So we probably need something that's more stringent, such as that within our code of DLCA when in fact we're issuing citations.
All right, I would just wrap up by saying it might be politically incorrect to say I do support that, but it should be served as a deterrent so individuals can fall in line. It's unfair for individuals, hardworking taxpayers to be out there paying their license fees and what have you, and individuals just flying under the radar when we know they have the capability and the capacity to do so. So thank you for your due diligence, and once again, my condolences to the families and the DLCA family on the loss of those 2 employees, and continue to do the good work. Thank you,
You're
Mr.
welcome,
Chair, for the
Senator.
time.
As an editorial, if you'd like to hear from, with the permission of the chair, from Director Francis, what he and his team encounter when they find persons operating without 2 forms of payment.
Gladly. Let me proceed.
Director Francis, Department of Licensing and Consumer Affairs. Whenever we do encounter this, by way of either a complaint that comes in or if we see businesses advertising cash only, or we suspect that an individual or an entity grosses more than $50,000, we have contact with the Bureau of Information, with the IRB. And so we establish contact with them, we provide the business information, and they notify us whether or not that business is exempt from the Act 8205, which was passed.
Okay, do you have any businesses that just say we were violating, we're going to comply, or?
I'm sorry, Senator?
Any of those businesses telling you, the machine was down, we're going to comply now, we'll begin, or?
Well, there are some businesses that make the claim that they didn't know about the law. I know that the commissioner had made several PSAs, either by way of Facebook or radio ads. So the information is out there. Whenever they do make that complaint, they're also provided a copy of the act from the officer who's given them the citation.
Okay, so you're finding pretty good compliance?
Yes. There are those who still make that claim, but we do our part. But for the most part, we do find compliance, yes.
Okay. Commissioner, in reference to your vacancies that's listed on page 15 to 19, positions.
Yes.
When the post audit was doing the report, they realized that some of the vacant positions have already been filled, correct?
Yes.
Okay. They also found that some position was submitted, filled by OMB, but there was no permission, there was no position submitted by DLCA.
Yeah, so that may have been I don't want to say the mail was crossing, but Assistant Commissioner Hodge, if you can actually respond to those, because we thank you for submitting the post-audit report for us. Through that, we were able to come up with the reason for the discrepancies.
Yeah, and to include positions submitted new by OMB, but not submitted by DLCA.
Good afternoon, Senator. Natalie Hodge, Assistant Commissioner for DLCA. I think when we submitted, DLCA submitted our information, the positions weren't within us at that time. The legal hearing officer came after we submitted our information to post-audit.
Okay, so is a legal hearing officer here?
And
I'm not seeing it in the vacancy. Is it here in the, what was submitted by OMB?
Yes.
What page? Okay, that would be a new position. I'm seeing legal counsel, special investigator, the alcohol staff.
Well, within your post-audit,
The executive director, the special assistant. Because the amounts are based on this, the amount for personnel is based on the information here in the post-audit report that matches what was submitted by OMB. So if we have that position and it's not here, then I need to know so that we can add it on.
page 7 of the post-audit. Under enforcement, we had asked that enforcement be separated from licensing. And what we found was that they separated in the post-audit, but they put the hearing officer position here under the personnel cost rather than the enforcement division's information.
So that 80,000 there is a hearing officer?
Yes, sir.
Yeah, but then it doesn't go back to the personnel listing.
So if I may, Senator, if you recall, we're moving a special appropriation, and
No, I'm good with
oh,
that.
okay.
What I'm saying is, the balance, if you look at let me double check here.
I think it was created after this was prepared.
If you look at the personnel listing,
Personnel listing that we submitted.
submitted by OMB, all this information is in the budget book from OMB. The subtotal for Fund 100 is $2,616,394. But what was submitted here is $2,537,000, but you do have $1 million under the Public Service Commission Revolving Fund,
Which is not ours.
and that's a PSC, so that's not
Correct.
closed at all. So
No.
absent that.
Yes.
So I'm seeing the amount that OMB submitted overall to be less than the personnel listing. Well, what I'd like us to do is to I think I see what's happening. And that is why I pointed that out. The first column, if you look at page 15, the first column is OMB salary. The second column is DLCA salary. So DLCA submission is different to OMB submission. So if you go to the back page, which is page 18, OMB comes up to $2,537,422, but DLCA comes up to $2,616,394, which is like a $88 million difference, 88, 89 million. So I need for you to look at DLCA column and OMB column and tell me which one is right.
Sure. So, Senator, if you look at page 16 of 19, the highlighted yellow by post-audit, the yellow position, receptionist, it's funded at $2,740. That person was hired within the past couple of months.
Okay, so, it
looks
needs to be
like
funded at that amount.
So it should be budgeted at 100%.
Okay, but they have an executive
have it-
director and a special assistant that you don't have.
And where is that?
The same
Page
page.
16.
Right. So when we looked at that closely, that appears to be the salary for the executive director for the Office of Cannabis Regulation, the executive director position.
Okay, but you don't have it, so that is a position that you need.
That is the position for Director Hannah Carty.
Right.
Okay, which would carry the amount up even more. And then the special assistant?
Did we figure out what that was for?
That was the special assistant for.
Okay, let's go from the beginning, and then
Okay.
coming to you now, Senator DeGraff. Let's go from page 15. The legal counsel, you have hired a person, so you funded the position at 100%.
Yes.
Okay, so
That's
your
attorney-
number is right.
That's Attorney Fenzel in St. Thomas for the Boards and
The
Commissions.
special investigator, you have hired a person,
Yes, Kerry Fleming, St. Thomas Boards and Commission.
so it's 100%.
Yes.
There are 4 new positions, and you funded them all at 100%.
Yes.
Well, you funded 3 at 100%, but you didn't have the administrative assistant supervisor.
That is correct.
Okay. And you need the administrative assistant supervisor, or you don't?
And that confused us because in that section, that administrative assistant supervisor was listed twice.
Okay, so I can remove that one position?
The one in blue.
Okay. Now the other 3 positions, they funded it at 50%, and you funded it at 100%.
That is correct.
Correct.
Okay. You have individuals for those positions as to why you funded it at 100%?
We actually are currently about to embark on interviews for all 3 positions. They're all
Okay. Okay, you turn the page, the executive director, you said that is Ms. Carty.
yes.
The exception is the 50,000 is 50%?
Yes.
So that position is 100,000.
Yes, sir.
The special assistant is that person hired,
No, sir.
and it's funded at 50% here.
It appears that way.
The receptionist, you have already hired that person.
Yes, Senator.
So that needs to stay at 27.
Yes.
The district council, is that person hired?
Hired, getting the admissions documents through the Supreme Court.
So that need to be funded at
100%.
the 82, at the 100%.
Correct.
Paralegal, researcher,
That is currently vacant, and we're searching for someone. So if you'd like to share someone from your office who's interested in working with
We'll
Richard
leave it. You just-
Evangelista,
your, what is it, a compliance protocol officer? That's what it is?
which one?
Page 18.
Consumer complaint officer.
Consumer complaint, okay.
That's a consumer officer.
You're going to hire somebody in that position?
Definitely.
Okay, because you didn't have anything down there. Okay, so that would be penitent there at 50 for now. The weights and measures inspector,
We definitely are trying to fill that position. The salary is just so low, so we keep trying. There's 2 vacancies, so one is posted and one is actually filled on the island of St. Croix.
so one is filled.
Yes.
Okay, so can you update the personnel listing?
And
that
submit it to you.
Yeah.
Okay.
And then come up with a total, because the totals are totally off now.
Okay.
Because you have hired some individuals that need to be 100%, and there's some positions that were not listed otherwise. So I was going to ask you about the reduction in personnel, but I can't ask you that because I'm seeing the different issues. Okay, Senator Francis is here, and then Senator Graves. Senator Francis, you recognize. Oh, before Senator Francis, the rum shipments, you said appendix. I don't see it.
It was submitted to you that last evening, but I can provide you a hard copy now if you'd like to circulate.
Okay, thank you so much.
Thank you very much, Mr. Chair. Good afternoon to you. Good afternoon to the VALCA family, and good afternoon to the people of the Virgin Islands.
Good afternoon, Senator.
Forgive me, I had to step out into a meeting real quickly of urgency, but nonetheless, I'm here. So if I ask any questions that have already been asked, just say so, and we can move on. In regards to revenues, how much revenues did you collect so far in FY 2022?
Ms. Hodge, you got that? Ms. Hodge will take that, Senator.
Assistant Commissioner?
Good afternoon, Senator. Natalie Hodge, Assistant Commissioner. We've collected $3,867,209.82.
And how, say that again, please? 3,800,000.
$67,209.82.
290? 209?
209. Yes,
and
and
82 cents. How is that comparison to FY 2021?
Can I steal her thunder? Senator Francis, I am proud to tell you that for fiscal year 2021 actual, we collected $3,791,382, and thus far through June or May or June of 2022, we've collected $3,867,209. What you may have missed is both the licensing team as well as the boards and commissions team have been in overdrive, and they're smoking it.
I miss it. I hear the businesses complaining.
I got to collect my revenue. However, please share with them, for the month of July, with Operation Apply and Comply, we're waiving 70% of all penalties accrued. So now is the time to come in.
All right, we'll send you a bill for that announcement.
No problem. And I
But so-
approve that
so you're on-
message.
You're on target to actually collect more revenues than you did in FY 20.
We're going to we've already surpassed it, sir.
Very well. So in regard, there's a number of key performance indicators that's mentioned here, and I see that you came close to several of them. Who's ultimately responsible for tracking your key performance indicators?
Each director is responsible for keeping track of their own KPIs, and on a monthly basis and a weekly basis thereafter, we meet to discuss it.
What instrument is used to make that determination?
Numbers, bodies.
And there's an evaluation on a monthly basis and make a determination?
Yes, sir.
And then that presentation is made to you overall to gauge and guide your efficiency and effectiveness?
I'm actually part of the evaluation. After they collect it, we sit down amongst ourselves, but then we also meet with OMB on a monthly basis.
So tell me, in instances where you fell short and you're deficient in meeting that mandate, what happens?
So quite frankly, if we want to be frank, the reason why we fall short for some of those mandates in there is because of the lack of personnel. If we had the person, so for example, if you can see our boards and commissions team, our licensing team, we don't have the exact numbers we want, but we're able to maximize efficiency, and through the cooperation and the tenacity of the team, they've just kicked it out. Unfortunately, you know, in the weights and measures team, we have one inspector in St. Thomas and St. John, one in St. Croix. They're responsible for everything from monitoring the prices of fuel to calibrating scales to doing pull dates. So, you know, it's a matter of we figure out what's our priority, we create a plan, and we attack it.
So, so tell me, because I've been tracking since we started our budget cycle, and I've been doing budgets for the last 4 terms. And every time an agency come before us, they fall short of being able to fulfill their vacancies. What have you done in terms of understanding that as a result of not being able to fill your vacancies, it's creating a deficiency within your operations? What have you done to, again, ramp up hiring of people?
I'd be happy to, if I can defer to Director Matthew Paget. He actually oversees the division within DLCA that is most deficient in terms of personnel, despite the fact that they're still carrying out quite a bit of duties. Director Paget, if you can share with Senator Francis what you have done to increase efficiency by stacking up your personnel.
Thank
Your
you.
proposals.
Yeah, Matthew Paget, Director, Consumer Affairs. One of the things that we had to do is we just had to take an honest look at the most important functions of the weights and measures team and the consumer protection team. And with consumer protection, it's consumer complaints. So we prioritize consumer complaints over site inspections for grocery store price verification and scanner surveys. And we also prioritize the fuel regulations over pull dates and other on-site inspections for the weights and measures division.
And additionally, Senator, what we've done is we're working on a reorganization so that we can, quote unquote, address and amend the job description of the current position so we can actually get and attract technical persons who will then fill the positions. That's really the crux of the matter at DLCA. We're one of the lower paid agencies for whatever reason. So we're working our way through that by updating job descriptions and just basically creating new positions so we can get technical persons into these fields.
Very well, thank you. Thank you very much for that.
You're welcome.
And in respect to, I mean, we have worked on some legislation most recently, especially with your assistant commissioner, yourself as well as your legal counsel. We had the trades and commission that we did, as well as the beautification board, in kind of right fitting those legislation. Can you speak to how this improved legislation has assisted and supported you in being able to be more efficient and effective?
Sure. Before I defer to Assistant Commissioner Hodge, because that's right up her line of professionalism, I shouted out to you and to the members of the 34th legislature for actually allowing us to consolidate the General Contractors Board and consolidate it to add 3 trades. So You missed it, but you got your highlight, and I won't charge you for that. Ms. Hodge?
Good afternoon, Senator. Natalie Hodge, Assistant Commissioner. I'm a piggyback off of what Commissioner Evangelista stated and said, express my gratitude with your sponsoring that bill and helping us out. So we were able to name 2 board members to the trade board, and we have Commissioner Evangelista and Mr. Charles Anthony. And with that, we've been meeting more regularly, and we're working on drafting rules and regs and implementing the complaint. We receive a lot of complaints in the construction and trade field, so we're working on the procedurally process on
2 minutes.
dealing with complaints.
Okay, very well. Thank you.
Senator Francis, if I may, everyone's innocent until proven guilty, but I'm happy and proud to share with you that publicly, for those of you who are engaged in unscrupulous construction activity, bad boy, what you're going to do, we already have some people who have been, are being pursued. So thank you for your efforts. And, we're just trying to protect the community, and we needed that extra oomph to get it done.
Very well. Thank you. And in respect to this budget, and obviously, I'm sure you could do more if you had more money. What about this budget gives you reason for pause? What keeps you up at night regarding this budget?
Quite frankly, I would love to just increase the salaries of the current staff because they're going over and beyond. A majority of them are members of the USWA contract that we're currently negotiating. So it looks positive. However, in terms of reorganization, I think once we reorganize and attach new salaries to these new positions, I think that's when we can come back and tell you, let's get it done so that we can actually get the right persons doing the right jobs.
Okay. And in respect to enforcement, and of course, I know that most of your guys and gals have been.
Women rule the world, Senator.
Absolutely.
Thank you. You're welcome.
Most of them. Most of them have been with the Virgin Islands Police Department with the COVID task force. Have you received or gotten back your full complement?
I'll defer to Director Francis.
The question was asked about finance or officers?
The enforcement officers, whether or not they're back with you in terms of, that was a question initially, and then I have a follow-up to that.
Yes, they are back full-time.
They're back full-time?
Yes,
No,
sir.
yeah. And so are you at sufficient levels, or what is their current assignment and deployment?
Well, we have a calendar that we run on because we don't have just a surplus of officers. To remain efficient, we have to proceed and schedule accordingly to make sure that we maximize
Time.
what needs to be done. So by way of information, we can use more, but we're getting along with what we have.
Very well. I hear my time call. This is Lotus. I hear the timekeeper all day. Thank you very much for the time, Mr. Chair.
Thank you, Senator Francis. You kind of got some additional time because she wasn't there in the seat, so you got a lot of additional time. You found the rum shipment?
Yes, it's here.
Okay.
I didn't see us. Is there someone?
Yeah. We will get it now. Amanda. Next up, we're going to have Senator DeGraff. Senator DeGraff, you're recognized.
Mike, Senator DeGraff.
1 minute, Senator DeGraff. Mike, media.
Test.
Go ahead. You're good.
We can't hear you, Senator.
Media, Senator DeGraff. Mike.
Oh, man.
Okay, now go ahead.
All right, thank you. Commissioner, do your enforcement officers make overtime?
Senator, they make overtime if there is a budget for it. Their budget has been exhausted for this fiscal year. So currently, they're not making any overtime from DLCA.
No, okay, so then your mandates have not been executed. So going forward into the 23 budget, to execute your mandates, you should have overtime for your officers based on what you want to do. They were before on loan, now they're back to you.
Right.
So there should be an overtime factor in your budget.
So, Senator, in our budget, there's a $25,000 that this body actually implemented, I think, right after I came into office. But I thought you were asking about this current fiscal year.
Correct. 2023, is it budgeted for overtime?
$25,000.
Okay, so then you do have. Okay, good.
Yes, sir. But if you're feeling jolly, you know.
Yeah, sounds good. Your personnel, any of your personnel, I heard you mention about them negotiating now. Have any of your personnel received any wage increases?
Those that were actually already priorly negotiated, any prior negotiated increase in the past fiscal year that was approved have been awarded. There's no outstanding wages due to anyone.
Okay, great. How many retirees do you have?
This fiscal year, we're looking at 2. One this past May, one projected in August, and we had an untimely retirement because she's resting in peace in May, so 3.
Right. Condolences to your,
Thank you, sir.
your department. Now, also, GERS, is GERS completely paid up for your personnel?
Oh, yes, sir, definitely. When I was acting CEO of the hospital, I pushed it. Wherever I go, we go.
Good.
Right, Senator Villa?
Good. Do you have any separations or terminations?
We have pending 2. We have 2 pending.
Two what? Separations
2
or
pending
terminations?
terminations.
2 pending terminations.
Yeah, but you know, until well, like they say, until the lady sings, you know, things could change.
Right. And now, I had some individuals ask me in regards to the architecture testing process. I know you mentioned it in terms of getting licenses for the architects, but they mentioned about Public Works having an issue with providing the test. Has that been addressed?
Yes, so Senator, I'm going to allow Ms. Hodge to respond. And just so for the public's consumption, Senator Graff called me based on a constituent's concern that the draftsman's license is unavailable. And Ms. Hodge is the one who gave me the educated response on what the answer is. So Ms. Hodge, if you could kindly share with the Senator why there is no draftsman's license.
Good afternoon, Senator. Natalie Hodge, Assistant Commissioner. Currently, there's no draftsman license being issued because the Department of Public Works, who used to proctor that test, I guess the equipment has been inoperable and there haven't been a replacement.
Okay, good. Then we need to check with them in terms of getting that back up online. I'll do a follow-up on that. The Vendors Plaza, the cost for the Vendors Plaza kiosks that's underway, has that been budgeted in 22, or they need any money need to go over into 23 for, I guess, maintenance of them?
Senator, the cost for the Vendors Plaza kiosk was $3,115,160, and that was an allotment released through the Office of Management and Budget. And then there was recently a change order for $200,283 to ensure that they can withstand up to a Category 3 storm. So they were redesigned and reinforced, and all that money was made available and spent through an allotment by Office of Management and Budget. So there's no need for that money. Now, as it relates to maintenance, that's a cost that has not yet been factored in. So currently, we collect $200 a year from approximately 50 vendors. So that is currently our operating budget, but we have not yet implemented a maintenance budget for those new kiosks. So that's something that, based on what you're asking, I'm going to have to do post-haste.
Yeah. Okay, great. It is very much needed. Now, and do you have any outstanding obligations?
Just like in my house, Senator DeGraff, I go to the boss, so I'm going to defer to the boss. Women rule the world, sir. Ms. Hodge?
Natalie Hodge. Currently, no, manage to pay our bills timely.
She's a stickler, Senator
Okay,
DeGraff.
Good. I appreciate that. Now you have the online application portal. Is that up and running?
Yes, Senator. What I'd like to do is allow Director Graham to respond because that is actually his child, and his wife approves of the child.
Also, could he indicate what amount of money has been generated using that form?
All right. Well, good afternoon. My name is Horace Graham.
Good afternoon.
Senator, as the Director of the Division of Licensing, the online portal is the main unit that's used to process business licenses. So whatever revenues are collected through the processing of business licenses, all of that transpires through the online processing system.
Okay, so do you also keep the paper processing for individuals who come in? You still process by paper?
We do not have a paper processing methodology currently. We have eliminated that, but individuals who need assistance are provided same through the licensing officers, and that automatically gets updated into the system.
Okay, and final question. I heard my time come, Mr. Chair. One last question, if I may.
Proceed.
Go ahead. Okay, thank you. In regards to when your enforcement officers were with PD, you may have had a backlog in applications. I think you mentioned about it, but what percentage of your backlog have you been able to clear since they have come back over to your department?
Director Francis?
Yes, Director Francis. We've been able to clear about 85% of that backlog.
Thank you for that. You could translate in terms of what it would be in terms of money. What did that transpire to? The 85%. And you I answer in the chair's time. Thank you for the time, Mr. Chair.
Director Graham, you want to take a shot?
Oh, the question was, how would that transpire into funds or money?
Correct.
The
Revenue.
department took some administrative procedures that sought to mitigate the loss of funding during that period. And so we moved along with issuing the licenses, and what the enforcement team did was they went in the aftermath and completed their obligation for that review. So we did not stand to lose anything during the process of their absence.
Mr. Chair, if I'm clear, so then you're saying of the backlog, there
Right.
was a backlog mentioned.
Correct. The backlog was
Right. So and 85% of the backlog has been cleared.
correct.
So what amount of money does that equal to? Is basically what I'm asking, based on your backlog.
All right. So what I was trying to clarify is that what we did when we lost the active participation of the enforcement team in the process of the business license, which normally required them to do an investigation prior to the issuance of the license, we took an administrative, we made a policy, internal policy, that allowed us to proceed with the issuance of the license and then follow up with the inspection by the enforcement team. So we did not have outstanding obligations, meaning that licenses were not held up for enforcement inspection.
So we collected the fee,
We collected
Senator
the
DeGraff?
fees
Yes.
all up front. So
I got you.
thank you.
Thank
you, Senator DeGraff. We're going to take a 1-minute recess. This committee stands in recess for 1 minute.
The mic cut.
The Committee of Finance is back on the record. Senator Carla Joseph, you recognize.
Thank you so kindly, Mr. Chairman. A pleasant good day to you as well as my colleagues. I really wanted to actually start off our conversation with the Department of Licensing and Consumer Affairs and really thank the men and the women who work behind the scenes and you, Commissioner.
Mainly women, Senator.
And the hard work that you're doing. I really appreciate it. And I know a lot of our persons in our community appreciates it as well. Now, I wanted to get to your actuals,
Yes.
Expenditures. I don't know, based on a post-audit report, I didn't see anything listed as far as your actual expenditures as of whatever date. How recent do you have your actuals?
Defer to Ms. Hodge. We can do that together.
Mr. Chairman, could you please hold my time? Could you kindly hold my time? Okay. In looking at that, let me just ask you, I know, let's put a pin in that until Ms. Hodge gets that information. Commissioner Evangelista, how many enforcement officers do you have on board?
Sure. So we have 3 on the island of St. Croix and 3 on the island of St. Thomas. And we have Director Francis.
Okay, so a total of 7, including Director Francis,
Yes.
correct? Do you have any outstanding litigations with any enforcement officer or personnel?
No, ma'am.
Do you have any personnel that are pending to return to work?
Not that I'm aware of.
Okay. Okay, so I'm aware of a personnel that's supposed to be returning to work, and I wanted to inquire about that status, but I'll speak to you afterwards, one-on-one, relative to that matter, and to be able to inform me about what's the status and how that is working.
Sure. And since it's a personal issue, that's probably the best way to address that issue.
That's exactly what I mentioned it. Ms. Hodge, are you ready for me?
Good afternoon, Senator. Yes, I am.
Great. Let's come down the road now. Personnel services, because we're looking at the line itemized budget that was passed in Act 8474. Personnel services, and state the as of date.
So, Senator, please forgive me because it says from October 1, 2020 to present. However, I don't know when this was run. The director of the business office is not here. So can I get back to you? Present, I can't tell you if it's present as far back as June 30th or when we submitted the information.
Okay, so what you can do is submit it to the chair.
Okay.
And submit all of the major items based on the line itemized budget that was granted to you. And then I also wanted to ask, I don't know if you're prepared to answer this question relative to how much you have expended in utilities.
I have that.
You have that?
I think thus far we expended $64,000 in actuals.
64.
We've budgeted for 81 and we expended 64.
64. So you should be able to expend all of that. And you don't have the total amount for any of the other line itemized budget?
No.
Okay. All right. That's fine. I wanted to ask you, Commissioner, or better yet, your new director, executive director of the Cannabis Board. Ms. Cardi, are you there?
2 minutes.
Yes, I'm here.
Okay, great. Ms. Cardi, kindly indicate to us the number of new employees you are anticipating to bring on board to help you carry out the duties and responsibilities and oversights required under your leadership. And have you put together any type of budget?
Yes. So over the course of the next 2 fiscal years, we're anticipated to hire 7 full-time employees and 1 part-time employee. There are some preliminary budget items that need to be reviewed by the Cannabis Advisory Board prior to me bringing them public, but those are numbers that we have discussed.
Okay, great.
So approximately 8 in total.
Okay, 8 total.
including myself.
Okay. And now I wanted to ask you, do you have a time frame set on when you will be fully implementing the rules and regulations for the whole cannabis entity, business entity?
So the Cannabis Advisory Board is scheduled to have its next meeting on August 10th, 2022. At that meeting, we will be discussing the full timeline of events. I have developed a timeline based on all of the current rules and regulations and the projections as to how long things will take. And it's flexible, so we just input the date that we meet and formally propose the rules and regulations, and then those items we'll be able to disclose all of those times.
Okay, thank you. Now, my next question is directed to you, Commissioner Evangelista. It's relative to your portal to renew and apply for business licenses. Over the past years, I've been having some basic challenges with constituents calling me and inundated, as you know. Have you looked at upgrading that portal?
Sure.
Time.
Thank you for the question. I'll allow Director Graham or Assistant Commissioner Hodge to respond. They work more closely with the web host.
We have scheduled a number of meetings with our producers there, and we anticipate those improvements. I know that on the boards and commissions side, and I'll allow Assistant Commissioner Hodge to address that, but significant work has been going into improvements on that side also. So there's a balancing act. There's several divisions that are engaged right now. So consumer protection also, they're supposed to be coming online with their reporting. So that has been the major thrust of the system.
I know my time has already been called and I don't want to abuse it, but I just have one final burning question relative to, the timeline of getting that done, because the more it sits there and our consumers and your clients are having challenges paying in and registering their businesses, we are actually going to be losing money. So I really would like to know if you are really working with a strict timeline with your producer, your vendor, to assure that those glitches and issues are being worked out.
And the answer is yes. We have been working with a timeline, but it had become fluid subsequent to during the course of the pandemic. And I'm not blaming the pandemic for it, but I'm telling you, it's the reality is we have lost some capacity on that side. We have even began having discussions with alternative sources of being able to upgrade and update the web portal.
Okay, thank you so much, Mr. Chairman, and thank you, DLCA, for your responses. I really appreciate it. Thank you, Mr. Chairman.
You're welcome.
Thank you, Senator Joseph. Senator Fred Gregory. Senator Fred Gregory, you recognize.
Thank you. Thank you, Mr. Chair, and good afternoon to the DLCA team.
Good afternoon, Madam
Good afternoon
President.
to my colleagues. I want to go back very quickly to the Personnel Services General Fund budget conversation that was had earlier. So I note that there is a variance of some $137,000, but I also heard that your general fund positions are filled. And I am also aware that the general fund positions that were vacant were budgeted at 50%. So how does this, and you indicated that the majority of, if not all of your general fund positions are filled or about to be filled. So how does this reduction impact your general fund if you're now going to need 100% of the funding to support those filled positions?
Thank you for the question, Madam President. Good afternoon. we were advised that if in fact the position is filled,
I'm not hearing you.
I'm sorry, mic test, can you hear me? Good afternoon, mic test.
Yes.
Mike, can you hear me now?
Go ahead.
No, I said,
Yeah, go ahead.
good
You're breaking up a little bit, but go ahead.
Okay, good afternoon, Senator. Thank you very much for the question. I'll attempt to speak louder. So those positions that were budgeted for us at half, we were advised that if in fact they were filled come September 30th going into the next fiscal year, that they would be properly budgeted at that point in time.
Okay, so what needs to happen at this point then is your office needs to send back to the Finance Committee, to the chair of the Finance Committee, the actual amount of these filled positions so we could budget this appropriately based on your responses that you provided today.
Yes, Senator,
Please?
and the
So
chairman,
through the chair, we need to get that information.
and the chair
Thank
of the
you.
Finance Committee
Now,
asked me. The chair of the Finance
Thank
Committee
you,
asked
thank
for that.
you, thank
All
you,
right.
thank you. You also talked about your weight and measures positions. You said you have one in St. Thomas, one in St. Croix, and you are in need of 4, I believe. Your need is really 4, so you need 2 more. Are those 2 more included or considered in this budget that's presented today?
It was included in our supplemental budget that we produced, we shared with OMB. It's not in this particular budget.
Okay, so that needs to also be included in whatever the updated information that you need to provide as new recommended new positions if we're going to consider this. Likewise, you spoke about your Consumer Affairs Division.
Yes, Senator.
How many positions compliance officers do you have in that that division?
In Consumer Affairs, we have 3, but 1 is about to retire.
And you have the full complement, that office is covered appropriately?
No, we're going to have to fill the retiring position, and we have 1 opening.
No, I'm not talking about your openings. I'm talking about your need.
I'll defer to
You have
Director
it, these
Padgett.
are budgeted.
Director
I'm
Padgett?
talking about potential need.
Thank you. Matthew Padgett, Director of Consumer Affairs. The need would be 1 additional per district, so 2 more in the Consumer Affairs or the Consumer Protection Services Division would be our need.
Please include that in your request so we can make some considerations around this. This is a revenue generating entity. So one of the things that I heard earlier was that your weights and means inspectors, their salary is $27,000.
That's correct.
And you said that you have a need for additional weight and means personnel, right?
Yes, Senator.
You have the full complement of 2. How are you guys you're unable to attract new weights and means inspectors due to this low salary? I asked this question and I continue to ask it to all of the departments that come before us and agencies. What's preventing you from bringing these individuals on the 3rd step? Is there some policy that we have in our government right now that we're not allowing individuals to come in on the 3rd step?
No, Senator. I'll defer to Director Padgett, but quite frankly, even if we brought in someone at the 3rd step, which we examined, due to the technical nature of the position, we still cannot attract the proper candidate. So we're actually working on reorganizing and reclassifying the position with a different job description to up the ante. But Director Padgett, if you're allowed...
When is that going to happen? When's that going to happen?
I'm sorry, it's not going to happen?
When?
Oh, when? When
is it going to happen?
Sure, Director Padgett is working on that as we speak because we've went through 2 rounds of interviews
no.
already.
Just tell me when it's going to happen because you're using up my time.
Sure.
When is it going to happen? 3 months? Yeah, just tell me.
30 days.
30 days. Thank you. We're going to
You're
look
welcome.
to see that happening in 30 days. Now, I want to talk about the 2 forms of payment. So one of my colleagues moved legislation to ensure that if your business's revenues is over 50K, there is a requirement for 2 forms of payment. And I listened to the response, and it just seems to me that we kind of hit and missing on this, right? So we are now having to be foot soldiers to determine or get tips from our community to determine whether or not individual businesses who are over 50 are in fact in compliance. What's preventing the DLCA from establishing some sort of a policy internally when you re-up your business license to provide verification of the two forms of payment that they're accepting?
Nothing,
Because
Senator.
otherwise we're never going to be able to really enact this legislation in earnest. These legislations need policy around them.
Thank you,
Time.
Senator, for that recommendation. We're going to work on that in earnest.
Yeah, that needs to happen ASAP. That's what needs to happen. As they re-up their licenses, then the businesses will
Senate
have
President,
to provide
the Director of Licensing has a response to your query. Go ahead, Director.
Yes, Senator Horace Graham, we had the system updated so that every renewal of the business license takes into consideration that the request that you just made. Everyone who submits a renewal of their business license, they are asked to provide notice as to whether or not they have their revenues are over 50,000, and once they give that authorization to the Internal Revenue Bureau, they notify the Department of same. So we do have a method right now where that's being tracked.
How recent was that done, Director Graham? So
That
Senator
was
Gregory knows.
done
Very
as
recent.
of May, I think May, April, entering into June of 2022.
So it just occurred.
Yeah, it's a huge issue that needs to be addressed. If it's being addressed, kudos to y'all. And Mr. Chair, I have one more question, if you would allow me. I think it's one more.
You may.
The cannabis rules and regs. I heard you touting the fact that we now have a permanent executive director, or a new rather executive director for the cannabis board. So we've been talking about the medical cannabis rules and regs for as long as I've sat in the 34th legislature. What's the status?
Senator, good afternoon. I'll allow Director Carty to respond. Director Carty?
Good afternoon. As of this morning, we've received back from legal counsel the final draft of the rules and regulations. At our next Cannabis Advisory Board meeting, they will be reviewing the rules and regulations and issuing a decision on them at that time.
Okay, thank you. And let me just wrap up by asking if you could answer it on the chair's time. You talked about the kiosks at the Vendors Plaza. When do we expect? I heard you indicate that they should arrive by, I can't remember what the specific month was, October actually. When do you intend to install them? And are we looking at making some changes as to how we deal with the Vendors Plaza overall as far as policy and just the whole process around Vendors Plaza?
Yes, Senator. The first model was actually completed last week. The first delivery of the kiosk are expected the first week of October 2022. And yes, with the new kiosk will come a revision of the rules and regs currently governing Vendors Plaza, so it will be a completely different experience.
Installation.
First week of October 2022, they begin to arrive and get installed. When they arrive, they will be installed. We just met last week with Public Works, DPNR, with the contractor to explain to them what the layout needs to look at so that they can prepare the groundwork.
Thank you, and thank you for all
You're
you do.
welcome.
Thank you for the time, for the leeway, Mr. Chair.
Thank you, Senator Fred Gregory. Is there a target date for them to go back to normalcy in Vendors Plaza? I know that you have a rotation schedule now, right?
No, Senator.
They're back to normal?
Yes.
Okay, so we have lost some.
Some people are waiting. You know, COVID is still around, so the more mature folks, they're moving with trepidation. They're moving slow, but yes.
Because I looked at it yesterday, I know it's not the normal amount of vendors that's in the plaza. So some of them are just waiting.
Correct.
Okay.
And or, I don't know if you recall, right before the pandemic, I spoke to the vendors, brought in Homeland Security, spoke about selling fake items, and those people have,
so some of
somehow
them,
they disappeared. I don't
some
know
of
where
them
they
are
went.
weeded out.
Yeah.
Okay,
So,
but you're going to have a process of individuals that have been waiting to get a spot that they would now be eligible?
yeah. So, Senator, what we're going to do is we're auditing, and I hope they're listening to me. Those who should be there shall remain. Those who are there improperly or illegally, quite frankly, they will be removed. So, you know, the party's almost over. We're about to turn on the light and play that song nobody wants to hear when it's time to go home.
But they're not allowed to sublet, right?
No, sir.
Okay.
Can you say that again?
No, you'll say it. You DLC.
Okay.
So I'll let you put it on the record. but they're not, and we need to regulate that particular area, and it's going to be really nice when we redesign it. And it is not the intention of DLCA to give somebody a lease and then they lease it out to somebody at double the price, and some of that have happened. You know,
Correct.
So we need to make sure that we're able to protect that. Are there any laws surrounding licensure that you would like tweak or change? Or any laws that might have complicated the process?
I think just really the fines and penalties associated with operating a business without a business license. I know one of the things that the enforcement team and the legal team are looking at is currently we are an administrative due process body. Contrary to popular belief, DLCA, unlike Fire Service, Virgin Islands Police Department, Department of Health, we do not have automatic shutdown powers. So when constituents call and complain and they see an officer and, you know, something that stops or is decreased for a number of days and then it restarts again, you know, they're thinking, oh, DLC is not doing its job. In fact, we issue a citation, and as you heard me say, there's a due process hearing, which we're about to start embarking on, you know, 24/7, which will allow the process to move forward before we can actually suspend or terminate a business license.
Okay, and lastly, in reference to gas prices, and I know that you're trying to regulate the price of gas. I saw $6.49 on St. Thomas yesterday.
Senator?
And I know that is way more than they have spent. We're down to $4.85 on St. Croix. I don't expect them to be that, $4.85, $4.89. But $6.49?
Right. So on your time, if you allow me, I'll give you a quick 1-minute overview, and then the director of CP can continue. On the island of St. Croix, the fuelers, retailers have an option of purchasing locally from Gulf Oil at the Lime Tree Bay Terminal, or they can do like St. Thomas and St. John and purchase from Puerto Rico using ISO tanks, paying a shipping fee plus trucking delivery fee. In the island of St. Thomas and St. John, their only option is to purchase fuel from San Juan Wholesale, either directly from San Juan or via Total or via Puma.
Using ISO tanks?
Using ISO tanks.
Okay, so stop there.
Sure.
Puma is the most expensive.
So let me share with
if
you.
they're selling gas to a next gas station, and they're the wholesaler plus the retailer, but they have the highest prices on St. Thomas, something is wrong.
So I'll share with you. Puma is actually the company that purchased Chevron. Chevron is the company with which the former DLCA commissioner had a lawsuit, and they settled. Pursuant to that settlement, Chevron, now Puma, sets its fee. However, they set the fee right now for a month. There was a time when...
No.
No, let me share with you.
You're sharing, but, I don't agree with the sharing.
Right, so there was a time...
That's their problem.
So there was a time when Puma was the most affordable because what they do is they have a storage facility. So when they purchase fuel at a certain price, they have to exhaust what's in their reserve. So they give us a month price. I'm not putting my money on this, but I'm certain that come August 1st, we should be getting their new rate sheet for the month of August. Their price will probably be, if not equal or less than the current price, maybe by 20, 30, even 40 cents. So in fairness to that company, and I'm not picking a company, when everyone was rising every second, their price remained steady. Total and Puma, their prices are steady for 1 month. So it's one of those things where they hedge, you either lock in or you're not. Now,
So you're telling me when the price rise to $5.99 on St. Thomas, the Puma was cheaper?
yes. Yes. Now, what I challenge you to do with our constituents, I'm not running for office, but please, whatever district you're in, we need to start supporting the fuel retailers who have the most affordable fuel. If you're into lights and ice and sound, you're going to pay for it. There are retailers on every district who always have the most affordable price within 5 to 7 cents of each other. Until we as a community visit those and cater to those businesses, the other businesses are going to continue to charge what they want. How do you do it? You don't have to plan your trip. You don't have to go from A to B all over the place.
And I agree with that. You know, you go to the gas station that perhaps have the cheapest price so that you can save money. But that's a strange situation that they have in terms of this 1 month setting of prices. I mean, that's found no other place but I guess here. Because all across the nation, gas station prices reflect the current market.
Right. And the major
even in St. Croix, I mean, you see that fluctuation of prices so quick that you see the price go down and you immediately see it now. You know, when I saw $6.49, that's hard. That's very hard. And the lowest after that was like $5.49 or something like that. But they're buying this.
Matthew Paget, the Consumer Affairs Director.
Identify yourself, Paget.
Really
I can't hear her.
Identify yourself and speak.
Matthew Paget, Director of Consumer Affairs.
Can you just get closer to the device?
Can you get closer to your mic, sir? We can't hear you. There you go. That's better.
I haven't moved since I started. Can you hear me?
Yeah, go ahead. Speak up.
Okay. To add on to what the commissioner was saying, when the business that you're referring to brings in fuel, they bring in hundreds of thousands of gallons, barrels. They bring it in by the barrel, and they have a storage facility on St. Thomas. Until that's exhausted, they won't change their price as quickly as the businesses on St. Croix, because essentially their storage facility is the rack at Lime Tree, and they're able to purchase 10,000 gallons at a time, not 250,000 gallons. That's why that specific business goes up slower, but also goes down slower.
So somebody, and I'm done with this after this somebody made a determination that the supply that they purchase actually lasts a month, no matter what the price is. So they have that particular, so who determines that maybe after 20 days the supply didn't run out?
So, Senator, we actually have the invoices of when fuel is purchased and brought into the territory, so that's how we keep track of it.
And you've been monitoring that?
Yes, sir.
Okay, thank you so much. We have exhausted all the questions. I'll allow you to put a closing statement on the record.
Sure. First of all, I'd like to thank my team that is actually presenting to you this afternoon. But more importantly and more succinctly, I want to thank each and every member of Team DLCA, whether you're on St. Croix, St. Thomas, or St. John. Without your efforts that you use and deliver day in and day out, despite all the gripes and arguments we may have as a family, at the end of the day, we are producing. The numbers show for itself. I presented it today. So on behalf of you, the staff, Senator, I'm delivering to you what is our proposed budget, and we shall also supplement any requests that you have made today via email or personal delivery requests. So thank you very much for your committee and its time, for sharing your time today with us, because we know you have a choice in who you speak to at 2 o'clock in the afternoon on July 28th, 2022. And DLCA thanks you for your patience and your cooperation.
Thank you, Commissioner Evangelista. Yesterday we had a long day, so today we're a bit, have finished it quite a bit earlier. I thank you for your testimony. I thank your team for providing support to the DLCA Commissioner. I thank you for your colorful answers. And the Committee of Finance is hereby adjourned.
Thank you.
Thank you.
Thank you, sir. You got any officials?